Morning, guys and ladies, and this is the fourth lessons we have in this course. Yeah, welcome to the class again. And today we are trying to finish this book called Gynecology and Pediatric Disorders. This book. Before I started, I would like to remind you guys on the assignments we got last Sunday, right? And let me check. Yeah, if you still remember, this is the one you get. I wonder, anyone who didn't get this one, or you forgot to bring it? No problem, no problem. Okay, over there. Yeah. Yeah, this is, before I start on the topic today, from, the case one, to chapter 1 to chapter 10 in this book of gynecology and also pediatric disorders, I'd like to remind you of the assignments, because some of you guys told me that, it's more valuable for me to discuss this kind of casework than review. Of course, review is my, major task, right? I need to go through all the 52 common cases review. However, case study is very important because it just give you guys some of the training. And in addition to that, in the last lesson, the 6th lesson, and Dylan will just give you guys the mock examinations and to review some of the cases. Of course, we can't go through the 52, right? We don't have time. I don't know whether the school will later on arrange any courses for just reviewing, the cases. I'm not sure, right? But just I can tell you guys, just 2 days before, the association, the Greek association of all the schools of the TCM in Toronto, they're planning to have a data bank on all the case studies for those general class. I'm one of them to prepare. I'm going to prepare about 15 cases from these 2 cases for the review. However, okay, let's go back to our case study here, right? So as you see in the case study here, so I just want you guys to go through all these questions, right? It's a very simple case about the personal information and about the chief complaint. The chief complaint, just talking about the coughing. And also another important word is dyspnea. Dyspnea, and this dyspnea, happened because 3 days ago the patient, getting the catching cold. After that, it become headache and also body aching and stuffy nose. And what he described is the coughing intensified for 3 days with dyspnea, and then you can hear the sound of the phlegm. And also plenty of phlegm accumulated there. And the situation worse from day to day. And the most important information, guys, remember, is that he could not lie down because of dyspnea. And this is a very severe case for people getting this kind of disease, right? And also, as a doctor, a PCM practitioner, or acupuncturist, you should observe the situation just like, by observation of the light of the tongue, and also the pulse, and also his breathing situation, and also thank you much. Thanks a lot. Get it. No problem. I will give them later. Okay, and also the tongue condition and the pulse condition in this case. Okay, first of all, let's go through all the questions in the case study. First of all, anybody give me the name of the illness in this issue? Coughing. Chronic asthma. Asthma.
Exterior access asthma.
Yeah, I think asthma is one of the correct name for in the Western medicine, right? So I think just say coughing. I think this is not enough because, as I mentioned before, you can just see some important terms just like dyspnea. If your general coughing, okay, you won't have the coughing with dyspnea. The other is the patient will not, have the situation that whenever he lie down, he will get even worse. He cannot lie down, right? But those people suffer from wheezing and dyspnea. We suffer this kind of problem. And of course, chronic bronchitis will be the name of the, the Western medicine. But in Chinese medicine, we say wheezing, W-H-E-E-Z-I-N-G, wheezing and dyspnea. This is the traditional name for the traditional Chinese medicine, right? Of course, you can write as asthma. This is also another term commonly used for those. Yeah, question.
Do we also put like acute cold wind?
No, acute cold wind, no. I think the general term, either you can choose between exterior syndrome and or just as this gentleman said, this is because of the, about coughing or the dyspnea. I think those you can, you can do write anything besides these three terms, right? I mean the traditionally.
Okay, but it's acute case that we have in the office.
Yeah, you're right. Any exterior.
Asthma of his chronic disease.
You are right.
Now he's
you are right.
So what do we write?
Yeah, you're right. In this case, of course, every exterior syndrome should belong to acute because you have solved this problem first, right? And in many cases, in our student clinic or even in the examination, many acute syndromes are caused by the chronic one. That means we have two situations, either the root problem and also the urgent problem. The root problem here is the chronic and also asthma, right? But it will be initiated by what? Initiated by the weather or initiated by the, the sudden onset of the exterior syndrome, right? So in this case, you can either write down the, the dyspnea or the asthma, but no exterior syndrome or coughing will be accepted because this is just a general name for that, right? So specifically, I want you guys to write more specific for the dyspnea or asthma, right? Those will be the name for that, okay? And of course, in Chinese medicine, you call it Shaoquan. Shaoquan is the Chinese name. And how about the diagnosis? The diagnosis. What makes him this patient? What makes him, coughing, and what makes him having the symptom of dyspnea? What will be the diagnosis? If you guys open to book 1, you will find that the Shaoquan, that means that the dyspnea, will contain lots of symptoms. As I mentioned before, Chinese medicine is famous of dividing any kind of common disease in different symptoms, right? So this symptom belong to what? Okay, first of all, according to H principle, exterior or interior? Interior in the beginning, but now should be what? Yeah, but now should be, should be interior, should be an exterior. It should be exterior. So this is exterior, right? Yeah. About heat and cold, which one is wrong? Heat and cold. Well, first of all, we distinguish between exterior and interior. It's exterior, right? Heat and cold. Heat or cold division? Cold. Yeah, I will explain one by one. Okay. How about the exercise deficiency? Exercise deficiency. Deficiency, because there's deficiency. I'm not sure because this we can say because no sweating. Aversion to cold, no sweating. What do you mean by deficiency? That means it's lacking something, lacking the qi, lacking the blood, and also the general deficiency in the body. So usually in the exterior symptom, and we will refer to whether it's sweating or no. There's no sweating, of course. It can be usually the exterior symptom may belong to excess, but we do not need write down the excess or deficiency in this case because this is not important. Not important. What important is one exterior symptom, second is the cold, right? We will say exterior cold or exterior heat, but we will not say exterior excess cold. No, in this way. Okay, this belongs to excess type, of course. Usually, most of the exterior symptom belongs to excess type. Most of the chronic one belong to deficiency type. Of course, this disease, based on the deficiency, the constitution. But this time, since it's initiated by the cold and the coughing, the cold and also the exterior syndrome, of course, they belong to excess first. Okay. So besides the diagnosis now, okay, excess one. What's one? Phlegm, yeah, you're right. Phlegm to belong to excess. You're right. Usually, some pathogen inside the body also belongs to excess, just like undigested food, phlegm, and others, right? So let's move on in this one and see when we move to the part of the reasons for diagnosis.
So
why
we
do
just have one TCM diagnosis, exterior cold.
Yeah, you can say exterior coat. Yeah, exterior coat, because it is belong to external expression. You can just run with that exterior coat there, right? I think this is exact. And of course, on the other hand, if you guys know all that differentiation about the fluid, I mean the water fluid, you can just write down anything concerned about the flap, right? Exterior coat with flap. But it's not necessary. But exterior coat is the initiation for that. But of course, you can add some more frame of water retention, because you can see in the number bullet point number 1, 2, 3, 4. Bullet point number 5 is, you can see that the coughing intensified with the dizziness. Some of the phlegm can be heard, and white and plenty of phlegm. And situation getting worse. White and plenty of phlegm. When you guys describe phlegm disease, should be phlegm dampness, phlegm heat, or phlegm fire, right? In this case, you can see the phlegm heat. You can see the phlegm fire. So, but this is not phlegm cold. This type of phlegm dampness. So for me, I would just write down exterior coat with phlegm dampness, right? So it's more suitable for that, right? Okay, now if you guys get the diagnosis, if you guys get the reasons you must know. Why do you know this is the exterior syndrome? Why do you know this belongs to exterior syndrome? Because what?
Aversion to cold.
Yeah, acute version of cold, you're right. Hey, good morning. Aversion to cold. And how about the pulse? Floating pulse, right?
Yes.
Yeah, this is exterior. How do you know that this is exterior cold syndrome?
Tight.
Because tight pulse, right? And also about the phlegm. The phlegm should be the state of the phlegm. Clear, right? White and clear phlegm, of course. And also the urine. How do you find about the urine? Yeah, so three pieces of information is enough to say that this is belong to exterior cold, right? One, the pulse. Second is about the phlegm, and third about the the urine, and also aversion to cold.
And tongue cold.
Yeah. Also the tongue condition. Yeah, you're right. When you refer to tongue condition, you write the cold tongue condition. Those are quite enough. Yeah, light red tongue with white and slippery coat. Whenever you add the phlegm dampness, you have one more piece of information to support this is due to the phlegm dampness, which is a slippery coat, slippery white tongue coat, right? Slippery means what? Dampness, and also some accumulation there. So this is enough for you guys to know that, right? Why do I say this is the dyspnea? Because whenever people coughing with the opening mouth and also raising the in this case, what does that mean? It means, this is thirsting for oxygen, right? Because the lung is not enough to get oxygen. Why? The phlegm is congested with all phlegm. If you put these people under the X-ray examination, you find that half of the lung or over the tongue is blurred by what? By phlegm. And whenever you get the phlegm in the lung, of course, it's due to one, because of pneumonia, and second, because of bronchitis, right? Either this is acute bronchitis or the bronchitis. All those is because the X-ray showed that there is chronic tracheotitis, because sometimes the lung will appear some blurred area there because of the phlegm. Okay, so those are the reasons: one for exterior, two for exterior cold syndrome, right? And also you can get those reasons for that. So in this case, you get all the diagnosis, you get all the reasons, and you get all the name. Now come to the treatment principle.
Can I ask?
Yeah, go ahead.
Page 26, 28.
Yeah.
You're talking about excess pattern and with 3 underneath.
Yeah.
And the first one says the pattern of wrinkle.
Yeah, you're right.
And the pattern of wrinkle is watery sputum,
yeah,
aversion to cold,
yeah,
absence of sweating.
Yeah.
And then you're also talking about floating, like white tongue coating,
yeah,
floating and tight pulse.
Yeah.
So it sounds like this one.
Yeah, you're right.
Can we not use this one as a diagnosis?
Why not? The wrinkle is correct. How about with number 3?
Right?
Wrinkle, yeah, wrinkle.
So I think we just say that this is wrinkle with asthma as a diagnosis, but wrinkle. He has everything. He has everything.
Yeah, you're right. You're right. So this, just as I said, when you go into differential syndrome, you can use the wrinkle, right? Wrinkle is same as exterior cold syndrome. As I said, wrinkle. You're right. Yeah, you can refer to this chapter saying that this is because of wrinkle. Why not? It's good, right?
So wind cold as it instead of exterior cold.
Yeah, wind cold same as exterior cold. Wind every time refer to the, yeah. Can you get one more page? Yeah. You know, okay, I repeat once again. When anytime you know there's a symptoms due to wind and due to exterior symptom, you can either say wind cold or exterior cold. They're the same because wind is from what we classify as a kind of exopathogenic factors. So exterior cold is same as a wind cold, right? So yeah, we have finished all the topic. What?
So sorry, the
yeah,
illnesses asthma. So when we're referring to wind cold,
yeah,
that is the TCM. Like so when we're going through the list of what they want us to answer.
yeah,
So illness, asthma.
yeah.
And then TCM diagnosis.
Yeah.
That's the separate section.
Yeah.
Okay.
Yeah, you're right. There's two sections. Yeah, go ahead.
Excuse me, just to clarify,
Mm.
when you mentioned illness before, it was don't use the word asthma because that's a medical question.
You're right.
So we have to say if the illness is cough,
Disney.
Oh,
Disney. Yeah.
cough with disease.
Yeah, coughing with Disney, you're right. This is a topic because you always talk about this, right? Okay. How about the treatment principle? We try to look at the treatment principle this time. So when the illness is coughing with dyspnea, or what we call this is 哮喘, right? Anybody suggest any principle? If you got coughing, if you get wind cold, if you get some phlegm, so what are you going to do with this guy? First of all, the most important item this thing is with coughing, dyspnea, stop. Stop the cough is the method, but you know you have some what we call it the treatment principle, right? Okay, exterior symptom is
Dispel
yeah, you're right. Dispel the wind or dispel wind cold, right? Or release exterior, yeah. So the principle, you know, always explain this. Principle is principle, method is method, right? Principle is a set of principles governing all the methods. One principle can have many methods to solve it, right? So in this case, the principle is we try to expel the wind or expel the exterior. And then, second, in order to stop coughing, we do at least 2 or 3 things. In order to stop coughing, one is we're going to, you're right. One, we are going to exterior, dispel the wind or dispel the exterior, right? Second, you're right. We try to descend the lung qi. Because coughing is because what? Because of the rebellious lung qi, right? So the descend the lung qi. And then the third one, the coughing is caused by the phlegm. So what we're going to do? Yeah, we just got to resolve the phlegm. Resolving the phlegm or removing the phlegm, right? So if you write all these 3, this will save for you to deal with this case. In order to stop coughing, we have to expel the exterior cold, and then we need to descend the wind lung qi, and then last time is just try to remove the phlegm, right? Okay, going to the treatment principle, yeah, you got really familiar the points, right? Are you going to reduce the phlegm first, or going to expel the wind first? Of course, dispel the wind first, right? And generally, for any people suffering from exterior symptom, we are trying to use 3 common points. One is the Li4 right here, and then the Lu7, and then we got the also for people getting coughing, right? Depends on whether the coughing is cold or heat. But usually, when people getting cold coughing, we consider a point here. This is called the CV22 here. And for people suffering from dyspnea, this is a very important point, which is a special point we call the 定喘. 定喘, where's 定喘? 定喘, yeah, you're right. 定喘is, you guys know what is GV14, 大椎, right? And the point just lateral 1 inch, 1 chin, lateral to both sides of the GV14. We call 定喘, DINGZHONG, which was no 定喘is 6 yuan, right? 定喘 is another point.
So that's
for the
lateral too.
Yeah, 1 chin lateral there. Yeah, this is the point we try to remove the 定喘, DINGCHUAN, right? And of course, in order to relieve the more wind from your body, as I mentioned before, if you suffer from exterior symptom, in case of wind cold. You have to add 2 more points to release the wind rather than relieve the cold, right? So we will add BL12 and BL13. BL12 is what we call the 风满, release the wind. BL13, of course, you will consider the best shoe point of a lung, right? So all those we need to do is to get those points. Of course, I try to give you guys the answer for this point. Right? Okay.
So for this patient,
Yeah.
I mean, supine, you can, well, I guess you can only do these points prone.
Yes.
So, except for CV22, right?
Yeah, CV22, you're right.
So if CV22 is a major one for cough, how
No.
would you, no?
Yeah, major for those people suffer from serious coughing.
So
with
how
the
would
wind cold.
how would you treat this patient? Would you do 15 minutes prone first, so you can do BL 12, 13, and then try?
Sometimes they lie in the supine position, and then sometimes you need to lie in the face down, right? Face down, of course, you can do the Ding Chuan, yeah. But when you lie, face up, of course, you can do.
Yeah. So what would be most important?
Yeah,
both.
Yeah, both. Both. You're right. Yeah. Yeah. Questions?
Could we add spleen 6 and stomach 36 to harmonize nutritional chi after the effect?
You are right, but this is not in the same time. Not in the same time. Or we do it later, because at the same time you can tonify. Because this time for people suffering from exterior syndrome, we're not going to tonify anything. Otherwise, you just put it to chi. It's a general principle for us TCM practitioners that while people is coughing, we are not going to tonify any chi. Because when you tonify the chi go up and get more coughing in that case, right? So even in the Chinese herbs, we are not going to give some ginseng, some wang qi in order to put up the qi. Even the patient get a very weak constitution, we are not going to do that. Otherwise, you make him cough a lot, right? So in this case, so you're right, we can tonify just by using SP4 and also ST36. But later on we do that, but not this time. Okay, until the coughing get relieved, right?
And no stomach 40.
Yes, stomach 40. You are right. Stomach 40 is okay. For Fram, yeah, it's okay for this. So here, I just the paper I just gave you, it concerned about all this, the diagnosis and also the reason why I also enclose the invasion of and sulfuric antigen factors are common on those and bullet point below the illness, because this is all common for those people who attend the case study in the general class, because they need to provide the pathogenesis. Pathogenesis means the generation of the pathogen inside the body. So this is the one we need to explain the pathogenesis. And then you guys need to do that, okay? So what you are focused on is just on the diagnosis and also the reasons for the diagnosis, the treatment principle, the treatment plan, and also for those, of course, explanation is not needed. This is just for your reference. Why we take LU7, LU5? LU5 is important. You know why? LU5 usually for relieving the heat. But in this case, if the coughing is so severe, we also consider LU5 as a point for releasing the pressure in the lung. So we use the CV17 and also CV22 to release the qi.
So sorry, just to be clear, for us to write for this exam, do we have to give the explanation of these?
No, your exam doesn't need that. Yeah, just for your reference. Yeah, you're right. And then the herbal prescription, of course, there's an important formula. If you guys are going to major in it, remember we're trying to use 小青龙汤. 小青龙汤 is better for people who get exterior symptom outside, but with much of phlegm inside. And this phlegm belongs to the cold type. That means the phlegm is white and watery. Get copious phlegm. So we use this 小青龙汤. However, 小青龙汤 contains what? 麻黄、桂枝、细参, and also the 拔芍. However, we got 五味子、干姜、半夏. However, we need to do some modification with the additional 杏仁. 杏仁 is very important in dealing with the coughing. And jagan is good for the throat, while the gancha is always prescribed for the buffering the vigorous effects of the herbs, right? So in addition, you guys need to write down how about the dosage and for how many days, and also when this patient need to come back for the assessment, right? And however, for those exterior symptoms, no need for the assessment. Usually, in my experience, you just take about 3 or 4 days help, and then the patient will get healed. However, this belongs to a chronic disease. At the beginning, of course, I need him to come back for about 3 days after for reassessment, because chronic disease won't be, getting recovered within 3 days. This is why we need to do reassessment, right? So this is also some kind of a reference for you guys, right? And also down below here, I suppose you guys need not provide any lifestyle advice to the patient, but here we get some fresh air, we keep indoor, and what happened those what we call the nursing. Some of the nursing the measures is needed for the patients. So this is also for your reference. You guys need not provide any nursing strategy for the care and nursing for the patient. Okay, this is just for your reference. Okay, I think this is what we have done for last assignment. I hope you guys can learn a little bit, maybe how to distinguish people from the coughing from the dyspnea, and how you can treat those people getting dyspnea, right? And because of the external exertion, right? So today we are going to have one more classwork during the break, in the lunch break. And of course, I hope I can give you one more assignment on the gynecology, tonight. So tomorrow when you come back, we discuss another, the case again. Okay. So, there any questions? No, very good. So what is the PowerPoint? Yeah, this one.
So,
yes.
I do have one question actually. In doing that, I wrote pretty much down all of this, that the patients are looking at or looking at structure and all of that. But when you do the case,
yeah,
it's very different as to how it relates to what you're saying. It
yeah,
just deals with the percentage.
yeah,
So you don't
yeah.
go into all this explanation.
No need to do the explanation. You're right. Okay. Oh, so guys, let's start the course to the class today. Today, what we are going to do is to discuss on book 4. Book 4 mainly concerns about the gynecology and the pediatric disorders. And the gynecology is a very common disease, here in Canada and also in other parts of the world. In Chinese medicine, we also have a very important statement saying that you rather treat 10 guys than 1 woman, or rather treat 10 women than 1 kiss. You know why? This is always bear in mind when I study the TCM. My teacher always told me that we rather treat 10 men than treating 1 woman, and we rather treat 10 women than treating 1 kid. That means kid is a very difficult case for us to consider, and while woman is more complicated than man. Why? Any idea? Because of the physiological difference, right? Physiological difference between men and women. What women have but men don't have? You have 4 things. Always we mention about 4 things which women have but men don't have. Which 4? 1, menstruation cycle. Menstruation. We don't have menstruation, right? Second, we don't have leukorrhea. Third, we don't have pregnancy. And fourth, we don't have delivery of baby, right? So we got a 静待胎产. 经 that means what? It's a menstruation cycle. And then 待 that means what? Leukorrhea. That means abnormal, vaginal discharge. And 胎 that means what? Pregnancy. We pet a baby, right? And the fourth one, delivering of baby. This is we are considering obstetrics. The reason that women have all these 4 things, but men don't have. So this is why we say treating 10 men rather than 1 woman, because if you now consider it, although women also have the common internal disease, just internal disorders, just as men. But in this case, we have to consider more concerning about her menstruation cycle, her body, right? So this is more complicated. Okay, the other thing is, why do we say that treating 10 women rather than treating 1 kid? Because kid is what?
Flip easily from bad to worse, or
Yes, this is one of the reasons. The most important thing is the kids is a dummy.
High fever.
Kids is a dummy. That means kids cannot talk. You can just observe the thing, and when you get the pulse of the kid, especially under 3 years old, you cannot take the pulse. You can just use the superficial wingnail of the index finger to consider. Okay, you can just usually we carry on observation in the face and taking the superficial wingnail in his index finger, and then we get the inquiry. You know there are 4 diagnostic methods, right? Observation, inquiry, smelling and hearing, and palpation. And observation, what you can do for the kid is just for the observation only. Observation of his face and observation on the index fingers, right? And also for inquiry, you can just ask his mother or his caretaker. Instead of asking him, he cannot talk, he can't tell you anything, right? Just a caretaker. And also smell and also hearing is nothing besides just hearing his voice, hearing his, his crying and hearing his coughing sound. And of course, there's enough palpation. Of course, you just see the finger, right? So in this case, that's why I said, since kiss is, dummy, and then it's very difficult for us to consider the diagnosis. As I mentioned before, accurate diagnosis is the most important, right? If you do not get the diagnosis, how can you get the correct treatment? This is very difficult, right? So in this book, it consists of 9 cases in gynecology and 1 case in pediatrics. In Canada, it's very difficult for us to practice in the pediatrics because most mothers would not like to hand in their boys to you, then their kids for you. The first thing they will find their family doctor. But in Hong Kong, most mothers believe in 2 things. When they get the acute symptom in their kids, first they will go to see the family doctor. And later on, as you know, that the Western pill will do harm to their kids. So once the acute symptom, just like fever, just like coughing, stop, they will try to put their kids to a TCM practitioner because they believe that TCM practitioner can remediate their baby's body and then they put it into the correct situation in this case. So the mother in Canada and mother in Hong Kong will be different, right? They more trust the family doctor and the Chinese medicine half and half. But here, it's very difficult to get a kid. In Highway 7, in the clinic on Highway 7, I got a mother who always took her son to me. The son is about 1 year old. Every night he get coughing. He put him in the family doctor, but the family doctor cannot cure about his coughing, phlegm, and also night fever. So he asked me for consultation. I always take the remedial work, right? This is the point. Okay, just introduction for you guys to have a general idea on the boy, on the woman's body, right? But this afternoon, when I mentioned about the last chapter of this book, I will tell you something more about the characteristic of the babies. Because when I study the pediatrics, when I practice in Hong Kong, I do see a lot of cases which is quite more difficult and more complicated than the adult or can come, although they belong to the same internal medicine. So in this case, right? Okay, why 3 or 4 days afterward? I have no idea. So guys see that. No problem. Okay, so let's move to the first case first. And as I mentioned before, the woman case are not too difficult. And then, of course, in the woman case, when we study the gynecology, it consists of the 4 things. 1 is the menstruation cycle. The irregularity in menstruation is the first thing we consider. And then second, we consider the leukorrhea. That means the abnormal vaginal the discharge. And third thing, of course, we will consider about the pregnancy. There are some disease in pregnancy. So among these 9 cases, they will be evenly distributed in these 3 cases. And of course, there's nothing concerned about the other. Yeah, sorry, there's nothing concerning about the delivering for body. When I learned, gynecology, we also learn something about the lochia. After giving birth to the baby, there will be a lot of lochia floating out of which is amniotic fluid floating out of the mother. This will cause a lot of disorder, but we didn't mention about this. Of course, within these 52 cases, nothing concerned about the disease and disorders after the giving birth to the baby, right? Within that month, we can get a lot of a problem. But no, here in chapter 9, it just mentioned about infertility. That means the woman cannot, carry baby, and for a long time. This is also the same as the impotency in the guy, right? So let's start from the any disorder in the during the menstruation cycle. The first symptom we are going to consider is what we call the PMS. PMS, simply P means pre, M means menstrual, and then symptom. S means symptom. Okay, what will the disease in the women, we get a very special structure which men do not have, because they got their oviduct, and also the uterus, which will give rise to about some changes. What we call it about the vitamin change within every month. That means every 28 months, the woman's uterus get a lot of blood there, clotting, prepare for the baby. But after this accumulation, there's no sperm coming in, those blood will flow out, right? As a kind of a cord blood, and because the uterus will get, ready for the baby. But after no baby coming, of course, the blood will flow out as usual. There is a rhythmic change within every month, and of course for the women from the age of 14 to 49, she will suffer, this kind of menstruation cycle every month from 14 to 49, right? So every time you get this one, some women get a very, great disorder. Some women have no symptom at all, depending on their constitution and depending on their body. So this is the introduction of those few chapters concerning about the menstruation cycle, right? So the first symptom we're looking at is called the PMS. PMS means what? PMS means every time before the menstruation cycle, some women will have some symptoms appear in the physiological or psychological problem, such as the irritability, feeling stress. Sometimes they will get the edema in the legs or in the body, especially in the bloating. They get the bloating in the abdomen. Some women will get distension in the breast or headache, and all those work. Sometimes they're so severe they can get work. In Hong Kong, when I'm working in a company, women, always get sick leave every time you get the menstruation cycle, because you get this kind of PMS severe, and of course the boss here, of course they allow her to do that, because this kind of PMS symptom always affects their life, and sometimes some women even get the bed resting for that. Okay. However, this kind of symptom will disappear after the menstruation cycle, and this kind of disease will happen for sometimes maybe 7 to 14 days before, right? And this is quite common. Of course, why did one woman get this symptom? Women do not get this symptom? Of course, there are many causes, right? But roughly, you can just consider their constitution, and then their diet, and their job, the nature of job. All those will lead to this kind of problem. This problem will be affected by those reasons, right? So this is the introduction. And of course, how about the etiology? As I mentioned before, every common symptoms, some common disease will get two kinds of factors. One is external, the other is internal. Of course, in this PMS, premenstrual symptom, usually concern about the internal problem more than external problem. However, in case women get external contraction of the pathogenic factor, it will be a lot of problem, lead to a lot of disease. As I mentioned in another class, that getting external exterior symptom is not a very big problem. If you guys can just get solve the problem within a short time. However, when guy get the exterior symptom, when he get the food stagnation, there will be a lingering problem. When women get exterior symptom during the time of menstruation cycle, this is also another lingering problem. It takes a long time to recover, right? So as I mentioned here, PMS, the menstrual syndrome will be mostly caused by internal problem. This internal means what? One, emotional problem. Emotional problem always will associate with which organs? Liver. Liver, remember, most of the emotional disturbance are concerned with liver, right? And usually this is because of the liver fire or liver qi stagnation. This is, I always, some people try to do a research on the thoracic cavity of the men and women, and they find that the average volume of the thoracic cavity in men is usually larger than women. That means women will get a smaller thoracic cavity. That means he cannot accommodate too much thing here. So usually the women get jelly-syn than men, and then of course they get the liver qi stagnation more than men. This is one of the interesting finding they got, right? And of course, as I mentioned before, the liver fire will cause a lot of problem as it is the backhand of many common disease inside the body. So whenever we get the liver qi stagnation, the liver stagnated qi will become fire. And the fire, of course, what we do? Either will burn over. Fire will always burn over. It will affect the heart, affect the shan, that means the spirit, and also affect other part of the body, right? So this is one of the problems. The other, if we find the liver qi, it also affect not only the organs above, it also affect the organ in the neighbor, just as the spleen and also the stomach. If the spleen and stomach loses normal function, what will be the cost? The cost will be, the effect will be, if the spleen and stomach loses normal function, and then of course it will lead to accumulation of water, and this accumulation of water will lead to what? Phlegm. So as you know, the phlegm dampness with accumulator has the function of the spleen and stomach, become hypofunction. And it also affects what? Affect the milk lateral. What do I mean milk lateral? Because as everybody knows that the liver qi will go up from the hypochondrial region, go up to the breast. And women, you get the liver qi stagnation, either they get the secretion of milk will be obstructed, or in a younger lady, they will got some nodules on hard muscles inside their breast. This is also caused by the liver qi stagnation, right? And of course, those people who usually get a yin deficiency constitution, and of course, it will also cause some kind of a yin deficiency situation, just like the the fire, the liver fire, and also the kidney yin deficiency. And kidney yin deficiency, of course, will sometimes lead to kidney yang deficiency because of the fire insufficient in their life gate. And also it will lead to not only the kidney yang deficiency, but both kidney yang and also spleen yang deficiency. Since, as you guys know, spleen is able to transform and transport any water, any food from the spleen. If the spleen lack of the qi, or spleen is qi deficiency or yang deficiency, it will make more water accumulate in the spleen and becoming either phlegm or water accumulation as ascites. Right? Sometimes this water will go down, not only the spleen, not only in the stomach, it go down to the intestine. It becomes the what? You can hear some sound, borborema. You can see some water among the intestine. You can hear the rolling of the water, or the ringing of the gut. This we call the borborema. Therefore, this kind of PMS, the menstrual symptom, will cause a problem usually in the heart, in the spleen, in the kidney. So those are what we call the etiology and pathogenesis, right? So in conclusion, before I move down, I would like to remind you guys that this kind of PMS always affects the liver and also the heart and the spleen. But usually the manifestation may appear in the heart, spleen, and kidney. But the initial problem is caused in the liver. That's why I said many women, they got the problem in the menstrual cycle because of liver. So if you can soothe the liver, you can settle down the liver by qi, certain liver qi or liver fire, subduing liver fire, the menstrual cycle problem will be solved. This is what you guys know that, right? So anytime today our classwork will concern about something we call it the what do I say? This is a diarrhea. during the menstrual cycle, right? Which you guys have to consider not only the diarrhea, but also you must consider the problem in the menstrual cycle, right? So in the following paragraph, when we talk about the disease name, matching with the Western medicine, when we try to associate the problem of a premenstrual symptom with the Western term, we know that in Chinese medicine, we call those problems in the traditional Chinese classic has the headache during the menstrual cycle, and also what we call it the fever during the menstrual cycle. Some people get the edema, and the last one, of course, we call it the diarrhea during the menstrual cycle. And this menstrual cycle, of course, you get lots of disorder also arising from the emotion. And of course, during that time, some women get the distension in the breast. Some women get the distension in the abdomen, right? And so we just call them the syndrome. When you guys know the syndrome in the Western medicine term, syndrome means a series of signs and symptoms, which will not limit to one disease. So this means a complex, a complicated, disease. We call those to be syndrome. Remember, okay? Okay, and this is what we call it the etiology and also the pathogenesis. So, and as I told you guys before, every book contains several chapters which will have what we call it the treatment principle. And in chapter 1 of this book, you guys are lucky to see some, the treatment principle here. But the author here do not use the term treatment principle. He used the therapeutics or therapeutic method. Actually, principle is a principle, method is a method, right? But I really wonder why do they write down either the treatment method or the therapeutic method. But for me, I just regard them as a treatment principle. Okay, so later on, we'll talk later. So in order to explain the diagnosis in this disease, we'd like to know something more about the key points for diagnosis. Whenever you have a patient visiting your clinic complaining about the premenstrual syndrome, what are you looking for? What are you looking for? You have to bear in mind that during the menstrual cycle there are lots of stress in women. You know why? Because some women have difficulty to get rid of all those blood from their uterus. It's not really smooth. They got obstruction. They get some unsmooth over that. They will become really irritated. They will become frustrated, right? This sometimes we cannot see which is the cause, which is the effect, right? Sometimes the cause will be the stress and also the kind of frustration, and then leading to the menstrual cycle problem. On the other hand, sometimes the cause will be the menses, because the women get frustration, get stress in letting off all the blood from the uterus. You will get frustration, you will get leading to some kind of order. This is why I always told the women that whenever they get this one, they must get the relax. They must get relaxed. They must get leisure. So it's not easy to get the regular the menstrual cycle in that case. Some women even all the women they get a little bit abdominal bloating, and also they will get a little bit stress at that time, right? So there are many signs and symptoms during the time of before or during or before the menstrual cycle, just like depression, irritability, the insomnia, headache, and also some vertigo. And of course, as I mentioned before, some people get a little bit distension in the abdomen or breast. Those are the normal. But those symptoms will not affect their life and also their work, right? So some women, even at that time, they get so stressed that they get diarrhea, they get the oral ulceration, or even some women may get some, neurasthenia, which we call the psychosis or neurosis. So this is one characteristic you guys know. Why do they get so many trouble? Why do they get so many mental distress? The reason is because according to the Western medicine, they are affected by some kind of hormone. When women, they get two types of hormone. One is called the estrogen. The other is we call the progesterone, right? And those two hormones will govern, the secretion of the egg, that means the ovulation, and also govern the decreasing level in the blood inside the uterus. So those two hormones are very important. When they are in normal situation, the woman will feel healthier. But when they undergo different situation that this situation will affect it, or the ratio will be different, it will lead to lots of disorders. Some, especially those women, they undergo the menopause. Menopause is actually the stop a situation of the have this disorder. This division become disorder. Of course, it lead to lots of problem in women. Sometimes it lead to just as high level in cholesterol, high level in hypertension. All those will be affected by this kind of the hormone. Actually, in about year of the 14, and our brain, there's a structure in our brain called the pituitary gland. The pituitary gland start to secrete some kind of hormone which is called the follicle stimulating hormone. And this follicle stimulating hormone will send from our brain down into our reproductive organ. In men, we will start get some testosterone. In the woman, we start to secrete some progesterone and also estrogen. Those are the initiator for why we get the sperm in guy, why we get the ovule in the woman, and also the the ovulation, and also the uterus will get the menstrual cycle at that time. So in this, regarding this disease, of course, usually we practitioner will advise the patient will get more relaxed, and then sometimes they will have a more leisure life in order to get rid of those symptoms, just like schizophrenia or the sclerosis, and some people even get the tumor in their breast. You know why the tumor in the breast? Because breast is the region where liver governs. If you get the liver lesion, of course you get more disease in the area just like your breast, your neck, and also your internal areas. All those are the area governed by the liver. So again, I advise you guys, the liver is a very important organ governing the menstrual cycle of the women, right? So this is the key point for the diagnosis. And okay, let's go to the differentiation syndrome. And usually this kind of disease will, if not divided by the external internal, most of them can be divided into the excess type or deficiency type. As as I answer the questions to some of you students, that excess type always concerned about something you can see, just like the phlegm, just like you get the excess in your the body. Just excess means, according to the yellow emperors, classics of medicine, excess means too much what? Too much pathogen. What kind of pathogen inside your body? Pathogen inside your body can be consists of the 6 type of the exopathogen, or inside your body you get the water, you get undigested food, you get the stagnated blood, you get the phlegm, all those things. Whenever you get more, it's called the excess. Yeah, questions?
Chi stagnation, that's excess pattern?
Exactly, yeah. Some one student asked me whether chi stagnation belong to excess. I say yes. Yeah, you're right. Anyhow, those things you mean the too much pathogen inside the body. Pathogen means the disease-causing substance inside the body. Is also regarded as the excess type. Okay, so in this slide, you guys can find the PMS can consist of 2 types. One is the excess type, the other is the deficiency type. Okay. However, excess means what? 2 organs. One is the kidney, the other is the spleen. That means kidney deficiency or spleen deficiency will belong to the deficiency type. And then the excess type has the question raised by Lima. This is the example modeled by the chi stagnation, and also this stagnation, and also we also govern mostly according to chi stagnation. And then sometimes the phlegm, but usually we concerned about 3 organs when we concern about the excess type, which is the liver, spleen, and also the kidney. Okay, all those will be the organs concerned. And of course, since this symptom has more complicated and also has more clinical differentiation, we can try to consider other factors when we conduct the diagnosis, just like how long does it take and where will be the disorder happen. and also the nature of symptom, and then we have to combine the tongue condition and also the overall, the manifestation in the body. Questions?
What does asthenia or
Asthenia means, deficiency. Asthenia means excess. Usually in some textbook, they use asthenia, means deficiency. They use sthenia, means excess. Okay, STHENA, sthenia means excess, right? With A means opposite. That means not. So sthenia means excess, while asthenia means deficiency. Okay, thank you. Okay, after we consider differentiation syndrome, let's look at the how can we differentiate them and the treatment principle. Okay, this is a very typical page for you guys to look at the symptom first, and then the treatment principle, and then the treatment, right? The treatment method, that means the treatment plan. Okay, the first time is called the liver qi, the depression or liver qi stagnation. And anyhow, whether liver stagnation or this time I'm not sure whether you guys will get a little out here. Oh, this is the out liver light. I'm not sure whether you get this well or not here. Let me check. Yeah, but this is one. Yeah, you're right. In page 8, and then you get the light piece right down out. Okay, liver instead of the liver. Okay, the liver stagnation here. Of course, please note about all the symptoms. I think symptom is the most important thing you guys have to pay attention, because when you attend the examination, you always look at the symptom, right? How do you know that this is caused by the liver? One, hypochondrial distension and oppression. Okay, I have told you guys many times in the previous lesson that liver governs hypochondrial region. Whenever you get fullness and distension in the hypochondrial region, that's surely because of the liver or gallbladder, right? And this hypochondrial region also included your breast. In men, the breast distension is not so severe. It's not so clear, not so obvious. But in women, usually the breast distension is really obvious when they get the liver qi stagnation. And they also got frequent sighing. Why? Because as I told you guys before, whenever you sigh, that means you feel more comfortable. The more you sigh, the more qi can move. But every time you sigh, you just move the qi a little bit because the qi stagnation. How can you, can remove this kind of a sign? The only thing is you solve the problem. If you solve the problem, you need not get the sighing again, right? Because you feel, open. You feel the relief in your chest. Sometimes you get a kind of, easily get irritated, and your lower abdomen you get pain, and the tongue coat will be white, and also with the thin and wiry pulse before menstruation. Usually, women who get the PMS will get a typical type of tongue condition and pulse condition. In this way, if you find the women suffer from PMS, they got the white tongue coat. That means this is cold, right? Usually, what we get the thin white tongue coat. This is a usual case. But for those people suffering from exterior syndrome, they also get thin white tongue coat. But of course, the amount will be more. You find the tongue coat covering nearly all part of the tongue. Those is the pathological changes. Usually, normal tongue coat will occupy about half, 1/3 to half, right? The other situation, the pulse, thin and wiry pulse. Thin pulse means what? Thin means 30. The 30 pulse means deficiency in the body. And also the wiry means what? Wiry means the liver. So, and also this is a concern about the liver problem with the, white tongue coat, and this is the problem people getting stagnation. Yes?
At any point this weekend, can you discuss more about different pulses and combinations, what they mean?
Okay, I think this is the topic we are talking about in the diagnosis class. There are about 28 pulses, 28 type of pulses when we are teaching the pulse, the pulsation and the pulse condition, right? And also if you suffer any problem with the liver, usually the pulse will be wiry. what do you mean by wiry? Wiry means the pulse is very tough. You know, tough as is some strings. When you have strings in the violin, and also the strings in the bow, right? Those is what we call the tough. And this tough pulse always refer to the liver pulse, and this always appear in the middle area, what we call the 圈关气, the guan position, in the left hand, because in this hand we have a free region, 圈关气. 圈 means the heart, 关 means the liver, qi means the kidney, which govern the kidney yin. So this is the pulse. So this is what I can tell you about that, right? The characteristics is really tough and it's long. That means when you press the pulse, you find the pulse is so long they can occupy the whole fingers. Usually occupy half the finger, is it, right? And of course it's really tough. And then we can call this to be the wiry pulse, right? So I'm not, yeah, question.
The thin pulse was, what was the reason? The thin.
Yeah, thinness here I think it's because of weakness. Weakness, yeah. Although this belongs to the excess type,
Yeah.
but the pulse refer to, yeah, this is tricky, a little bit tricky. You know why? Yeah. When you see the thin white deficiency, because in this case this belongs to excess. Thin white pulse is because the women, before the menstrual cycle, they will get weakness there, right? All the blood will move to the uterus, and instead leaving a little blood in the liver. So in order to explain why it's thin and wiry, we can just say that because most of blood gather goes into the uterus and the heart position, leaving relatively a little amount of blood in the liver. So this woman will suffer a little bit of liver blood deficiency. So she will display some kind of sign and symptom, just like, you know, blurred eyesight, a little bit dizziness, and then of course you will get irritability, right? In this case, so thin is a little bit tricky. You're right. Okay. Besides this thin, I think other signs and symptoms will be really agreeable with this kind of symptom. Remember, okay? So if people have this kind of symptom, what will you do? Your treatment principle, of course, is to soothe the liver, and then to regulate the qi and activate the blood, right? Remember, soothing the liver is not the exact term. If you are talking about the treatment principle, there's no treatment principle called belonging to soothing the liver. The only term you can use is to move the qi and activate the blood, or you can use the same term here, regulate the qi and activate the blood. Why? Because whenever you get qi stagnation, the most important way is to move the qi or regulate the qi. This is the key word. While activate the blood is also important, but the other two terms, soothing the liver and also drag the collateral, that is not necessary. Not necessary, right? If you find, of course, it is a credit, another credit for that. But the most important two words is to regulate the blood, regulate the qi, and activate the blood. Understand?
So
Okay.
soothing the liver, you don't recommend for
No. You can put it at the back. You can put it at the credit, extra credit for that. But you know, regulate the qi and activate the blood, I think is most important for doing this problem. Okay. And also, I can tell you, I told you before, you know, liver qi stagnation is the cause of many common disease. This is one of them, PMS. The other, of course, you get the acid reflux, you get the stomach ache. All of them, you still can use the same principle. Okay, whenever you get the stomach ache, you can get the acid reflux because of the liver qi stagnation. You can use the same thing, just as regulate the qi, activate the blood in order to soothe, to relieve the pain. Right? So the same thing, the same principle will apply. But in different situations, you can use different word as a supplementary term for that. Okay. So what is the formula? The formula we use is 逍遥散. 逍遥散 is very popular, right? For people who suffer from some qi stagnation. And many doctors like to use 逍遥散 to deal with irregularity in the menstrual cycle. This is because, as I mentioned before, menstrual cycle always governed by liver. If the liver get problem, we just deal with the liver. And after the problem of liver disappear, of course, the PMS symptom will also disappear. This is our principle, right? Good. Okay, those are the modification. So we are not talking about modification of examination. What I'm going to concern is about the points, because every time you get the treatment plan, you get one is the acupoints, second is the formula. So after we're talking about the formula, so let's talk about the points. What points we are going to deal with, I can tell you guys, for any kind of PMS, we don't have a specific point, except except for the case of other cases, just like the delayed menstruation cycle or the preceded menstruation cycle or irregularity of menstruation cycle, we can use some point just like as a 三阴交, that means the SP6, or the 七妙, that means the BL32. Those 2 points usually, or sometimes we can use the point, the 中级, this is the CV3. But for PMS, we are not going to give any other specific point here, right? Except the SP6. SP6, you know why? Because SP6 is a cross point for 3 yin channel, namely kidney, liver, and spleen, right? So in this line, we'll just suggest the the 6 points for people who suffer from the PMS. One is a Tai Chung. Tai Chung is a point for the liver, right? Whenever people get liver cheese stimulation, which 2 points you will take? Whenever any people getting liver cheese stimulation, which 2 points you're going to take? One is the LI4. The other is the LR3. We call this open 4 gauge. Why do you need to open 4 gauge? Because you get stagnation. Yeah, you get stagnation, right? To move the chi, you need to open the 4 gauge. So as LR3, Tai Chung is 1 point. Why do we take KI3, Tai Chi? Because Tai Chi is the point to regulate the kidney yin, right? Why do you use kidney yin? Because you want to pull out the fire, pull off the fire. When you want to pull out the fire, get some water, right? Where you can get the water? Of course, the kidney. Kidney is contain much of water and much of fire. And when you want to get the water from the kidney, go to KI3, right? So KI3 and LR3, they are both points for releasing the heart fire. Sorry, the liver fire. Why do you get CV4? CV4 is a qi. Qi is to tonify the qi, right? As I mentioned before, oh, sorry, CV6, CV4, sorry. They always mix them together. CV4 is 官员, and CV6 is 气海, right? And CV4 and CV6, you're right. In this case, I think 官员气海, you're right. And usually I use CV4. Anyhow, CV4 and 6 are the same. My question is, when people get liver cheese stimulation, why do we find CV6? Because the treatment principle states that we are going to regulate the chi. How can you regulate the chi? Find all the chi points, activate the chi point, and then the chi will go really fast, right? So where are the chi points? The chi points you find in 1, here, yeah, the GV20. Second is here, the CV17, and then CV6, CV4, and also in your leg, here, ST36. All those are the chi points, right? When you find some people they get chi deficiency or chi stagnation, find those points, and then they will activate the chi and move the chi faster in order to remove what? Stagnation. Remember, when the chi move faster, of course it will lead to the blood moving faster too, and then chi stagnation will disappear, right? And also we got the 三阴交, as I've mentioned before. 格数, why do we find the 甘数? 甘数 is the best point for the liver. So whenever you get any problem in the liver, of course you will find the tonify. Remember, the best point always is tonification. Why do we tonify? Because we find whenever the liver get disorder, we get 2 solutions. Either we subdue the fire directly. Second, we use more blood to lubricate the liver. In Chinese medicine, we always use 2 herbs. One is dongui, the other is 拔芍, to lubricate the liver so that the liver will not go hyperactivity. In needling, you will find the best point of the liver, which is the BL18. When you tonify the liver will not go astray, will not go angry, will not go disorder, right?
So when you're tonifying the liver, but it's like a liver fire, that's what you do?
Yeah, this is a very ridiculous. Yeah, this is very wonderful. Even you get the liver fire, you can just still tonify the liver because you will tonify the liver by fire. I mean by the blood. If you get more blood, the fire will low down too, right? This is our principle. So
But if we're going to do more blood, why don't we use SP10?
SPN is only find the blood, you're right. But this issue, we are concerned about the Qi stagnation. So principally, you are using the Qi pore rather than the blood pore. In case people suffer from blood deficiency or blood stagnation, you're right, we are going to find the SP10, GB39, and also BL17. All those forms can move the blood, right? So you're right, in case the Qi stagnation develop to the blood stagnation, you can find those forms too. I agree with that, okay? One student asked me why we don't use SP10 to move the qi and blood. I said, because usually the blood stagnation we can use SP10, but here this topic concerns about the qi stagnation, so I would like to use all the qi point first. No, and also the high chung, as you know, right? Yeah, and the second symptom of the PMS is the symptom for the yin deficiency. Again, you can see asthenia here. Asthenia means deficiency. So here it means the liver hyperactivity and yin deficiency. That means the liver yang hyperactivity because of due to the yin deficiency in this symptom. So what we're going to do is we try to look at the symptom first and then see the treatment principle. And if for those women who suffer from PMS because of the yin deficiency, they will suffer the problem just like dizziness, headache, and also the headache with dizziness, and also restlessness, with irritability. Sometimes they got the tidal fever. Guys, remember, tidal fever is not only limited to yin deficiency. Some people getting yangming, fire, also get a tidal fever. But the tidal fever means what? Just the time. Whenever we mention tidal fever, that means from afternoon, even from 2 o'clock to 4, or from 4 to 6. Anyhow, this is a limit to some time in the afternoon, right? So we call this tidal fever. And tidal fever depends on whether this is the high fever or the low grade fever. Here, the tidal fever means the sensation of the heat on the chest, on the palms and the soul, which we call it the 5-pound heat or 5 centers heat. It's only this 5 center heat or 5-pound heat is the characteristic symptom for people suffering from the yin deficiency, right? And in this case, some people also find the itching eye, irritability, the irritable eyes, and also ear, and sometimes they get the tinnitus and dry mouth and dry throat. Whenever you get itching ear, itching eyes, this is also because of what? Not enough blood leading to the wind. Itching also because of the wind, remember. So some people got even itching in the pelvic area in the skin too, right? Those are because of the blood deficiency. Whenever you see the blood, the tongue, you always find that the tongue is red tongue with no coat or with little coat. And here, this slide doesn't mention about the state of the tongue coat. I want you guys to write down the additional information of the tongue condition. So besides red tongue, this should be like red tongue with no coat or red tongue with yellow coat, which appear in the page, in page 10 of your, no, page 1, I'm not sure. Okay, after the page you get.
So red tongue with yellow coat?
Yeah, no, red tongue with no coat. No coat or little coat. If you write yellow coat, that means the excess heat. Here we mean the deficiency. So I want to use this opportunity to remind you guys more and more about the characteristic of the tongue condition for people suffering from yin deficiency, which is red tongue with no coat or red tongue with little coat. And the pulse condition, please remember, always is rapid and thready. Rapid and thready, right? So it means the yin deficiency.
Yin deficiency, there's no white or pale tongue?
No, it should be red tongue. Should be. Yin deficiency means heat. And excess heat also means heat. Both of them share the same tongue color. That means red tongue. But the coat is different. Because be careful. Right? No, of course, excess heat you get yellow coat. While deficiency you get no coat or a little coat. Right? Remember, okay? Yeah. And also, how about the treatment principle? Remember, guys, whenever you get yin deficiency, you're not going to tonify, right? But you're nourished. Because whenever you do not get enough water, you nourish yourself. So what we are going to do is to nourish what? Yin deficiency, nourish yin. If blood deficiency, nourish blood. If fluid deficiency, you know it's body fluid, right? And also suppressing the liver yang is also important because the topic for this syndrome is yin deficiency with liver yang hyperactivity. So in treatment principle, you must mention two things. One, you must say nurse yin. The other, you just target at the yang hyperactivity, which you must suppress the yang, or what we call it to subdue the yang or suppress the yang. Both of them can work. So what we're going to use, we'll use a very important formula, which called the 几菊地黄汤. 几菊地黄汤. That means based on this, based on the 六味地黄汤, we add 菊花 chrysanthemum and also 鸡菊 Chinese goji berry. When we add the chrysanthemum and Chinese goji berry, of course, we can subdue the liver yang, and also we can nurse the liver yin in both cases, right? Good. So are there any questions? No. And then we try to move from the Chinese herbal part into the point, into the prescription point. So in this case, since this is a liver yin deficiency, so we are taking some point of the liver yin too, right? And how about we take the 西行冲神门内关合菇胎冲共宣? This is ridiculous for us to consider this case. I think the problem is here. We get the yin deficiency, so you have the nurse yin. But can you find any point here in nurse yin? So sorry. You only find, I have no idea. I have no idea on this point. The author gets some problem, right? Yin deficiency, you should only find the yin instead of the get the heart problem, right? So I think this is a problem.
Calm the mind.
Yeah, just calm the mind. You're right. You know, all the herbs and also the points here is going to calm the mind only.
The good idea to calm the mind or maybe get the one that's
Oh,
Yes.
for sure.
I think they calm the mind, not yet. No, it doesn't make sense. It doesn't make sense. Yeah, if you ask me, we keep using of the using the Ki3 and also the the Ki3 you only find the kidney yin and also BL23. I rather, and all those forms for calming mind such as HT7, PC6, I'm not going to use that. No. I will just keep the last 2 points. Last 3 points. LI4, LR3 in order to open the 4 gauge. And also Gongxun SP4, which tonify the spleen only. But I need you guys to write down BL23 and also KI3 for tonify the yin because of the yin deficiency and also yin. Yeah, north yin, you're right. And also the liver point, the liver such as a BL18, the gansu. So I will advise you guys to write down KI3, BL23, and also the BL18.
That's a
No, calm the mind. I don't think so, because you don't have a the disturbing of mind. You don't have insomnia. I don't think you need to take those points. So this I think of the kind of mistake, right? The calming the mind. And sometimes, and of course, you can keep those points as a reference. For me, I will like to put them on the other use, right? Good. So about moving to the third type, we got the spleen and kidney deficiency. Spleen and kidney deficiency. So for PL7 spleen and kidney deficiency, there are 2 types of disease, 2 types of signs and symptoms. One belongs to the spleen, the other to the kidney. Okay, first of all, you find the women get the distension. The cutaneous distension of the face, and also the edema in the 4 limbs. This is dropsical face, and also the edema in the limbs. Those are because of the water retention, right? And also the loose stool, and also the diarrhea. All these are because of dampness. Which are dampness? The dampness in the spleen, because of spleen yang deficiency. And on the other, you find when people suffer from lassitude in the lower loins and knees, this should surely because of the kidney deficiency. And in addition, you find any people suffer from intolerance of cold and cold limbs, that is because of kidney yang deficiency. Kidney yang, yeah. So I mentioned again, whenever people get kidney deficiency, he always get the lassitude in the lower loins and knees, no matter but I'm not sure whether kidney yin, kidney yang, or kidney jing. However, when you see people have the feeling of intolerance of cold and cold limbs, and should be kidney yang deficiency, right? So in this case, you combine all the symptoms together and you can say this is kidney yang. Are there any special feature you can see in the tongue? Yes, the tongue always get a little bit swollen whenever you get spleen and kidney yang deficiency, because the water cannot be driven from the tongue to the other parts of the body. So swollen tongue is another suggestion. But you know the notes here doesn't mention about this. He just said the white and slippery tongue coat. White and slippery tongue coat. This is because the tongue contains lots of water. Slippery means the whole tongue is wet. And the pulse is deep and weak pulse. Deep and weak pulse. Deep pulse means interior. Weak pulse means deficiency, right? So in this case, sometimes you may find slippery pulse, but you know the pulse, when you get more water, it will be slippery. In this stage, you can just find this is because of kidney deficiency, right? So how can you deal with this case? Easy. Okay, what I'm going to do is anytime you get kidney yang deficiency, please remember the word warm. Warm. Okay, kidney yang, spleen yang, also heart yang, this is warm deficiency, right? Yeah, BL23, KI3, and also BL18 for the tonify the liver. Okay, are there any questions? Thank you. And also we had to warm the kidney, and also both kidney and also the spleen. So you can either say warm both kidney yang and spleen yang, or some people like to say warm the kidney yang and strengthen the kidney yang, or somebody invigorate the kidney, the spleen. They're also the same. But whether you need to remove the dampness, I'm not sure. Removing dampness is not in this case, right? Of course, when people get the edema, you need to remove the dampness. So depending on the signs and symptoms. Of course, I would suggest you guys to retain all three. That means you warm the kidney yang, you try to strengthen the spleen yang, and also remove the dampness. I think those three of them. And of course, there's a very important formula which is called the 苓桂熟甘湯. I keep using, but this textbook uses the word 健菇湯. I think the 健菇湯will be more or less the same as the 苓桂熟甘湯, but they add one more. We call it 薏仁. 薏仁 is one kind of herb remove the dampness only. Okay, but I'm not going to talk about the modification. So let's look at the points. Yeah, this is right. If people get the weakness and the spleen, we first consider two organs, 2 points. One is ST36. ST36, in order to tonify the spleen and stomach, it is also able to remove the dampness. And of course, for spleen deficiency, please find the best super on the spleen, which is BL20. And kidney deficiency, please look for kidney, best super on the kidney, which is BL23. However, I'm not really agree with using the point of KI3 here, right? KI3 is to tonify kidney yin. In order to tonify kidney yang, please use KI6. KI6 is the point to tonify the kidney yang. Can I ask a question? Can I use both kidney 6 and kidney 3 together? Can I use kidney 6 and kidney 3 together? Yes. Yes, the reason is yes. Because in this case, it's suffering from kidney yang deficiency, right? And of course, the kidney yin, KI3, is for dealing with the water. However, KI3 is not so important. We just keep KI3 as a reference here. And what I'm going to emphasize on is the 2 water points inside the body. Whenever you get dampness, whenever you get the edema, please remember SP6 and SP9. SP6 and SP9, right? In the body. Yeah, removing dampness, no matter it is dampness in the spleen or edema in the leg, you can keep using SP.
But you were saying that when doing the therapeutic methods, you were saying that you're not really thinking about this as a dampness problem.
But now, okay, please go up to the last page. Can you see what's the problem? Yeah, facial, dropsical face, edema of limbs, right? Oh, yeah. You get lots of water here. So we had to deal with all these 2 problems. Okay, dropsical face and also edema. That's why I ask you guys to keep using SP6 and SP9, right? If it gets severe edema, which point you're going to look for? You look for CV9. This is the CV9, 1 inch above your umbilical point, right? If you get severe edema in the lower limb, you also consider CV9 because it's a very good point for removing the dampness, removing the edema. Of course, CV4 use. Why do we use CV4? 4元 is of course 25 the kidney yang, and also qi, right? Get more qi, the water will go away. So for the woman who suffer from severe diabetes, I always use the point CV4, CV6, and CV9. Also Moxa, the CV8, right? Also, those points is also important for getting rid of the water, right? Okay, I think this will be the end of our chapter 1, PMS, premenstrual symptom. Are there any questions? No. Okay. Let's keep the time because I want to finish 3 topics before we break first two topics before we go to the first break. Okay. Let's go to the 痛经. 痛经 means dysmenorrhea. Okay. Dysmenorrhea here, of course, we get 2 excess symptoms. One is deficiency. The other is excess symptom. Okay. And let's look at the introduction part. 痛经 means painful menstruation cycle. Painful menstruation cycle. And as I mentioned before, many women will suffer from different degrees of pain before and after their menstruation cycle. Some people get the pain during the menstruation cycle. And this, as I mentioned before, why are there differences among the women? Because of constitution, because of diet, sometimes because of the job nature, right? And okay, get pain during the menstrual cycle means sometimes you receive a cold pain, or sometimes you receive the abdominal pain inside the body. This is common for many women, before or during the menstrual cycle, they got a little bit, cold pain, abdominal pain. This is normal. Sometimes people get the pain in the back, as a lower back pain. So either in the front or the back, during or before the menstrual cycle. And sometimes after the menstrual cycle, all these symptoms will disappear, right? And as I mentioned before, this kind of dysmenorrhea always happens to the young girls. In Hong Kong and here in Toronto, I find most people suffer from this kind of dysmenorrhea because of the overeating too much of the cold thing, because they do not take care of body. Sometimes they stay up at night. All this will make the difference. Why 2 women, one is suffer from dysmenorrhea, the other is no, because they got the different lifestyle too, right? However, in Western medicine, they always put this kind of dysmenorrhea relating to some kind of the pathological changes in the external genital organ, and also sometimes they will attribute them to the endocrine system. However, in Chinese medicine, we never talk about the endocrine system, right? We always talk about the yin and yang. Actually, when you guys study the foundation of Chinese medicine, I don't know whether your teacher will remind you of this one, because the theory of yin and yang is really, really widespread in the world. And sometimes you concern about the qi and blood, sometimes concern about the heat and cold. But most of the time, when people talk about the hormonal secretion, they refer to this kind of secretion of the different hormones. Also can be attributed to the anomalous, the disharmony between the yin and yang, right? And of course, this kind of symptom, as I mentioned before, can be caused by the pathological changes in external genital organs. And sometimes, since I mentioned before, women get more appendages in their, get more organs in their abdomen, right? At least they get one, the uterus, 2 oviducts, and 2 ovaries there. They have more than that, more than men. So they got more disorder than the men, because they always get the either the chance they get the baby or they get the usual. I mean, they get the menstruation cycle, they got all the problem, right? And the other thing is, some people get another type of dysmenorrhea caused by disease, as because the the internal membrane of the uterus, they get the displacement there. And this is also a common symptom, as I mentioned before, in Hong Kong, some women, they accidentally eat something wrong, just like the baby bamboo shoot, or they get their barbecue meat of the goose, and after taking that in the dinner, when they eat out or when they go to the banquet, they eat those things. After that, they will find the internal linings of their uterus will displace. We call this symptom to the endometriosis, and this will cause sometimes the uterus will move to one side of the body and not in the right position. And this is also because of the diet disorder, right? Sometimes it's all because of the inflammation inside their pelvic girdles, and we call the inflammation, and sometimes because of tumor. And most of the time, they got the tumors inside the uterus, or sometimes it's not tumor because sometimes they call them to be benign or malignant cell over there. This is very useful for the women in Hong Kong getting any kind of hard masses inside or just outside their uterus. We just leave it behind, because if you do not bear any baby again, if you do not eat anything wrong, many women just live with their melanin cell for the whole life without any infection, without any pathological changes. So this is very different, or very special for the women's body. Okay, although men will have some, just as a prostate gland, or of course this is another characteristic of men. However, women get more for that, right? So when we talk about dysmenorrhea, of course we can divide them into two types. One pattern is the excess type, the other is deficiency type. Remember, every time we talk about excess type, that means there's too much pathological factors in your body. Excess type, that means deficiency type, that means you are lacking of the vital qi inside the body, just like the vital qi inside the organs, inside the meristem system. Okay, first of all, let's consider the excess type. Excess type consists, one, the liver qi stagnation. Every time we got liver qi stagnation, of course, it will lead to lots of problems. And this liver qi stagnation usually caused by emotional disturbance. Remember, okay? Whenever we get emotional disturbance, we get liver qi stagnation or liver qi depression, and which will block or which will obstruct the blood circulation. What do you mean by pain? In Chinese medicine, pain comes from obstruction, right? So any type of obstruction caused by external, the attack of the wind pathogen, or you drink too much cold beverage during the menstruation. I don't think during the menstrual period, even before after that, you are not advised to drink too much. In China, many women, they got restriction. Whenever they get menstrual cycle, their mother advised them not to shampoo, not to wash their hair. So many women obey this law, just like, Chinese people, just like Jewish people. They have many traditions and long passed down here, right? So many regulations, they will pass from generation to generation. For example, whenever they move their house, and then the woman will usually the first time they will set up all the, all the plates there for their essence there, all the ghosts they brought there, and then they just wash them and ask them, why do you do that? Because their mother told them so. And what did their grandmother told them so? The general pass from one generation to the other generation, right? And then this conjugation in the, they get many contraindications during the period, right? First one, of course, they cannot carry on the sexual activity. They cannot do that, right? And on the other hand, they cannot wash their hair. You know why? Because once they wash their hair, they will get some wind into their hair, and then they will get easily headache. And they, of course, when they are young, they will not. But once they get the menopause, they will get lots of problem in their head, just like the headache as if somebody stepped in their hair. And then the old people, they try to explain that because when you get the menstruation cycle, you wash your hair. It's not because they wash the hair. You know why? Because they wash their hair, they do not blow them dry. They don't blow them dry. and then they go out, and the wind blow, and then they get all the dampness, all the wind getting into the head, which accumulate in your body until they get menopause, they get all pain, right? So, and here you get also the same thing, right? Get the menstruation cycle, you cannot wash your hair, you cannot eat ice cream, you cannot eat the cold things, right? Because why? This is true. According to Western medicine, when you are getting, when you are during the menstruation cycle, your body getting weak, more weak because all the blood, goes into your uterus, right? And then you leave a little blood outside, you can lower immune system. You easily get cold, easily get any damage inside your body. This is true. So in Hong Kong and China, I always advise the ladies, you better believe in your mother. And you better believe in what your mother and what your grandmother say, right? This is safe. Especially those pregnant women. Pregnant women also get a lot of contraindication. Sometimes some of them are unreasonable, but still stick to that, because in order to get your healthy baby, to get your healthy body, you better believe in your mother, believe in your grandmother, right? All those contraindication, just stop doing that for this 9 months, and then later you can do anything you like, right? So this is what we get in question.
Did you use the term stagnation of
Yeah.
liver qi and liver qi depression? Those
Yeah.
are interchangeable?
Yeah, you are right. You are right. Yeah, when students ask me whether liver qi stagnation, liver qi depression, they interchangeable, I say yes, yes. Some books like to use the term liver qi depression. Some people like to use liver qi stagnation. They are the same thing. But of course, liver qi stagnation is caused by liver qi depression. Although they can exchange it, but you know which is the cause, which is the effect. Okay, and of course, whenever we get the obstruction of blood circulation in the uterus, that means the pain, right? So this pain may come from the external or internal. Externally, because of the invasion of the exterior sphincter. Internally, of course, this is because of your overtaking of the cold beverage, cold food, or any ice water. Okay, sometimes when people exposure to the wind or the wind, we got the same problem, right? Even you are not washing your hair, even you are not getting the wet body, but when you are always work in the damp condition, just like the moving in and out of the fridge, the fridge room, or the fridge, the large fridge, or you're working near the seashore, you always easily get all those cold water in your leg and your foot, and this is also a cause for the this kind of dampness. And the woman, of course, easily get the dysmenorrhea because of touching with all those cold water and also dampness. And internally, and this kind of dysmenorrhea may be caused by their spleen and stomach qi deficiency. And since I have mentioned many times, because your stomach and also the spleen is responsible for producing qi and blood. And if this is caused by any reason that the qi is insufficient, it is not able to, transform the food into the qi and blood and transport the water away. Okay, and another cause is because of the prolonged illness and also the weak constitution. All those will be because of the, the cause of the dysmenorrhea. So any kind of the factor leading to retention of cold or leading to retention of blood, insufficient blood, will lead to this kind of problem. And even there's a very important cause we call it the flush and conception version. They got the problem. This is also will lead to the problem in dysmenorrhea. So this insufficient blood inside the flush vessel and conception vessel is also another cause resulting in the dysmenorrhea. Okay, those are etiology and also pathogenesis. Are there any questions? If no, let's move to the patterns. Yeah, as I mentioned, there are two patterns. The axis pattern means the qi stagnation, right? And of course, anytime you see the qi stagnation within the menstruation cycle, you surely will find some clogged blood in the menses. You try to take out the napkin, you see, usually the blood is also red in color, is medium red and clear. However, the woman suffer from stagnation, qi stagnation, blood stagnation, we will find many clogs inside there. And besides the clot, you will feel very painful in the lower abdomen. And this is really pain in the lower. This pain is dislike touching. That means you do not allow anybody to touch your abdomen. Otherwise, you yell, right? And this kind of menstruation cycle will be really severe before and during the menstruation cycle. But after blood flowing out, and then this kind of pain will be relieved. And the menses is red and dark in color with clot, right? So it is easy to tell whether the woman is suffering from any, blood stagnation or chi stagnation. Just look at the menses. Just ask the woman, what does your menses look like? Do you have any clot inside? If you tell you so, for it means so, right? And this can divide it into the two patterns. One pattern is the pattern of chi and blood stagnation. As I mentioned before, you find really pain in the abdomen, lower abdomen, and also the breast. And you may find the blue stain or the purple spots on the top of the tongue. This is another sign of people getting the blood stagnation. And also we can find some wiry and thready pulse. Again, wiry and thready. Some students just say, hey, very tricky. You see, how come the people getting excess symptom, getting a thready pulse? Thready pulse means deficiency. You are right. For the symptom, it looks like excess. Pain, more clot, chi stagnation. But actually, the liver itself is lacking of blood. That means the liver deficiency. That's why we still got a thready pulse. Wiry pulse is a must because this pulse belongs to liver. Any pulse belongs to liver problem, you get the wiry pulse. Right? And the second pattern of this excess symptom is accumulation of cold. That means cold congealing symptom. The stagnation of cold inside the body will, the stagnation of the cold inside the body will lead to some kind of pain. If somebody asks you why we get pain as we get more cold, your answer is because cold, when attacking the body, it will make both the collateral and also the blood vessel constrict. When you get constriction of that means all the blood, all the warmth of the yang cannot go through them, so you will feel cold, you will feel pain, right? Obstruction in this way, right? And in addition, when the people attack by the cold during the menstrual cycle, he will feel cold. He like any warm object, and his her urine will be her menses will be scanty. Why scanty? Because when all the blood vessels close, there is less blood coming. However, the scanty blood display some dark purple color. That means this is stagnation. And she also feel cold, and the tongue cold will be white with greasy. How come people, have a cold congealing in their body but still find some, greasy tongue? The reason is because when it get cold congealing in the body, that means the kidney yang is so deficiency. So you're not able to drive the water away from the tongue. So the tongue will displace a film water covering the tongue coat, which we refer as a greasy tongue coat here, right? So with deep and tight pulse. Okay, easy to explain, right? Deep pulse means interior. Tight pulse means either cold or paint. And the greasy cold means greasy tongue cold means accumulation of some water inside, while the white means the heat. And in addition to other feelings, such as the intolerance of cold and also cold limbs, you can find that this is because of general cold. Okay, how can we solve the problem? The problem is anytime you get warm, cold, you can warm it, right? Anytime you get the chi stagnation, please move the chi and also activate the blood, right? Okay, go to the second part, the efficiency of blood pattern. Deficiency pattern, of course, that means the women getting the dysmenorrhea still get pain in the lower abdomen. But this pain is a dull pain. It's not stepping pain. You guys distinguish the two kinds of pain, right? Whenever you get blood stagnation, the pain is a stepping pain and also severe pain. When people get the deficiency That means 叻or 黐啦, but the pain is a little bit dull and sometimes lagging pain. In this case, right? And then they appear usually after the menstruation cycle. You know why? After. That means when you get the blood inside, you will not pain. But after the blood flow away, you get more deficiency. This is why you get pain after the menstruation cycle, right? And when the pain happens, you like to touch, to press on your abdomen because your hand is warm. You get warmer. Or like somebody pressing on your abdomen. And of course, it's better for you to get a warm pad, a heat pad here, right? So this is easy to understand that you got cold inside because of deficiency. And the tongue, of course, usually the pale tongue, right? For me. Okay, and the menses, of course, this time we get skin dependent menses, but the scanty and pale. That means it's a light red, really, really light. And for people suffer from chi and blood deficiency, of course, they get the yellow and swollen and shallow, yellow and shallow and also pale tongue, pale complexion. Easily feel tired. Sometimes you get dizziness and blurred eyesight. Palpitation. Palpitation is because of what? Because of the blood deficiency. Palpitation sometimes because of liver blood deficiency, mostly because of the heart blood deficiency, right? Look at the tongue. We have liver, pale and plump. Plump tongue means swollen. Why you get swollen tongue? Because deficiency of qi and yang cannot drive the water away from the tongue, so you get plump. The tongue is too swollen, right? Why you got teeth marks? I always share this example with you guys because swollen, yeah, plump means swollen. Plump means swollen. The swollen tongue. And we have no standard for the size of tongue. You cannot tell me, okay, this people get a certain 5 feet and 9 inches, your tongue should be 3 inches. This is no standard, right? When God created man, we put the tongue just fit in your jaws, right? So your tongue will nothing happen. But when the tongue is get too, swollen, the tongue will press on the teeth for a long time. So when you take the tongue, you can see all the teeth mark along the tongue. That means your tongue gets swollen. And then just like we Chinese people, when we eat the mushroom, the dry mushroom, we put it in the water, right? After that, the mushroom will get swollen, and then get. This is the same as your tongue. You get swollen, but the tongue is limited by the size of the tongue is limited by the teeth. So whenever you see the teeth mark, that means your tongue is get too large, oversized, right? So it's no need to measure your tongue. Just look at your tongue whether you get the teeth mark or not, and then we know whether it's oversized or undersized, right? You can see it. And then besides the teeth mark, you can also find the pulse of the patient getting weak and also fatty. This is the first pattern of the deficiency, called the deficiency of qi and blood. Second is deficiency of liver, kidney deficiency. Again, printing mistake here. Liver. Okay, the liver and kidney deficiency. Of course, liver kidney deficiency, we refer to what? All refer to blood or yin. So in this case, first of all, we can find that the patient will suffer from soreness in the lower part of the body, soreness in the wrist and also the knees. Second is because of the insomnia, because of the liver blood deficiency, you got insomnia, dizziness, tinnitus, blurred eyes, all of them because the liver blood. Right? So I advise you guys to add one more word here, pattern of liver, kidney, yin deficiency, rather than just kidney, liver deficiency. Please specify. This is because of yin deficiency, more than that. Because why? Why I say so? Why I ask you guys to put a word here instead of saying liver, kidney deficiency, liver, kidney, yin deficiency. Why? Because you can see one red tongue with little cold. Fatty pulse, of course, is one more word is working and fatty pulse, right? All these are because what? Because of yin and blood deficiency. So you better specify whether this is liver, kidney deficiency or whether it's liver, kidney, yin deficiency instead of that, right? Okay, how do you deal with that? How do you get all the signs and symptoms? Differentiation symptoms. Try to decide your treatment plan. Of course, please note that there are 4 important points which we call the principal points for treating dysmenorrhea. One is Sanyin gel, SP6. Sanyin gel is a very good point for dealing with all kinds of women disease. Remember, because it governs the yin, governs the 3 yin channel. Second, and the second is the Zhongji CV3. CV3 can be used to deal with what? Urinary bladder. Here is also used to deal with, the 3 organs, they are arranged in the same line. You know why? In the front, we got the urinary bladder. In the middle, we got the uterus. At the back, we got the rectus, the rectum. I say again, if you look at the abdomen for the woman, the lower abdomen, you'll find that in front of you is the urinary bladder. And in the middle, you get uterus. At the back, you get the large intestine in the rectum. Right? That's why when women giving birth to the baby, if the baby is too big, it will burst open not only the vagina, also it will break open the anus, the anus part, right? So because the 3 of them are arranged together. This is why when we needle the CV3, the CV3, the Zhongji, we can deal with the problem of the urinary bladder. We also deal with the problem of the uterus. That means any problem concerning about the menstrual cycle, right? And the third point is important because the chi nail. You know where chi nail is? Chi nail is very, very important, right? And let me see. And this is a picture for the backbone, right? You get this one, and down here you get all 3 points, just like the 大强书, that means BL25, right? And then down here you get BL28, and 28 here, and then 28, 29, and then 27, BL27, or 29, 30, all this one. And then 31, we go up again. Go up to this 3 points. 1, 2, 3. Actually, here you get the yes, the second one here, the second one here, and those are you got 8 holes here. 1, 2, 3, 4. This is the bone here. Right? So this is 27, 28, 29, 30, 31, 32, 33, 34, right? So actually, this is the 32. The 32 point is same level as the 膀胱书. That means BL28. Actually, when you put when you find the point, you can put the finger here, just middle between the backbone and also the 小强书 27, and put the 3 fingers in, 4 fingers in, and then you can touch number 2 here. This is chi nail. Chi nail is better for what? For people who suffer from many menstruation problem, and also the sometimes it concern about the hemorrhoid. You also can use this chi nail. So BL32 is important in dealing with all sorts of problems of the woman disease, right? And also the other point is DG. DG is SP3, SP8. You guys know what is SP9, right? Just 2 chin below the SP9. That means below the yin ning quan, and then you get this SP point. This is the secret point of the spin, right? Okay, please remember this 4 points when any woman suffer from dysmenorrhea, and these 4 points can release their pain during the menstruation cycle. Of course, depending on which symptom it got, so we get the other supplementary points, just as the LR3 and GB33 to people who suffer from chi stagnation. LR3, everybody knows that whenever you want to open 4 gauge, you get LI4 and LR3, right? However, GB34 is very useful. You know why? GB34, locally, it can deal with any kind of a problem in your leg, such as your lack of energy in your leg, or your lack of, the leg get some problem, or you get a knee problem in the knee, you can use this, GB34. And it's also the lower Hischi point of the gallbladder. That means you get the gallbladder or virgin touchy point. On the other hand, when people get the stomach fire, get the liver fire or the liver cheese stagnation, you can also make use of GB34. Actually, LR3 and GB34, they are paired in order to deal with the liver fire or the liver cheese stagnation. You can relieve that, right? So for blood stasis, you can use this point too. And then for cold stagnation, there's a very important point. We got the gray line. What do you mean by gray line? Okay, let me show. This is our umbilical, okay? 2 inches below that, we got this is ST25. SB25. ST25 for removing the stagnation. And then 4 chin below that, we do gray line. Gray line, this is the point for what? 4 chin below the ST25, we get gray line. And gray line is for one, people suffer from constipation. Constipation, then you can just press on gray line, right? And also down here, people also use this 2 point to deal with the, the cold stagnation, causing the dysmenorrhea, okay? And down below got 水稻 ST28, SB29, they are both for dealing with the problem of urinary bladder. For example, people suffer from urinary block or urinary dip. Of course, you can use this point too, right? Of course, the other is 中极 CV3 can also be used to deal with the urinary bladder. But for the dysmenorrhea, I advise you guys to use ST29 to help in release the cold into the uterus, right? And of course, below we are talking about the explanation. Why? And this is a very important point to note for you guys to know. Usually, we can use acupuncture to deal with the menstrual cycle because it takes shorter time. The effect is very immediate, better than you use herbs. Of course, you use herb after you get the menstrual. Acupuncture is good, right? There are many types of the dysmenorrhea. Some menorrhea happen acute one, but some will become habitual. That means every time the woman get the menstrual cycle, he get the same symptom. Okay, so during the times get the dysmenorrhea, I advise you guys to advise the patients to stay calm and then do not have an emotional disturbance, and to avoid doing quick exercise, and then avoid eating cold and raw food, and which is important for the body for that. Okay. And okay, I just use about 3 minutes time to go through the prescription. Anytime people get the qi and blood stagnation, okay, previously we can have the 柴胡四甘汤. However, when the woman is in menstrual cycle, we use a more stronger herb than 柴胡四甘汤 and 泻为散, which we call the 邪符逐瘀汤. 邪符逐瘀汤 is a very strong herb to remove the stagnation. Okay, because this is very powerful in both the lower abdomen and also the body. So this is a very famous formula to reduce the stagnation in the body. And when we get too much cold inside the uterus, and also we have another similar herb. This is another 逐瘀汤, but not 邪符逐瘀汤, but 泻附逐瘀汤. 泻附 means, what does that mean? 泻附 means the small abdomen. It's a small abdomen. Yeah, as I mentioned before, Chinese people will call the place under your umbilical area called the small abdomen, while both sides call the large abdomen. So now this formula called 泻附逐瘀汤 means small abdomen, relieving the stagnation. So it is below, just area below the umbilical area. So this is a very important formula for releasing the heat, so releasing the cold accumulated in the uterus. So we contain a lot of herbs, just like 绕桂, that means what? Cinnamon. And then also 茴香, others. And number 3, we got the qi and blood deficiency. Some women get pain because of the blood and qi deficiency. In this case, we have another important formula for tonify qi and blood, which is called the 拔针汤. 拔针汤 means the egg pill, that means containing 8 type of herbs to release to tonify the qi and blood inside the body. Okay, So number 4, some women get the pain not in the front, not in the abdomen, but the back, because the lower back pain. In this situation, of course, it advise her to take the 调肝汤. 调肝汤, I have no idea of this formula, but looking at the ingredient, I will find that most of them will belong to what we call the 肾气丸, 寄生生气丸. It also contains lots of the helps to tonify the kidney yang. So modification, of course, we can add them to deal with other disease. Okay. So number 3, we'll talk about the vaginitis. And this thing will continue the topic after we take the break, right? So can we take about 15 minutes break before we continue the other 3 topics? Thank you. So welcome back to the classroom. And then in this morning, we just finished 2 common disease. One is in the PMS, premenstrual syndrome, and the other concerns about dysmenorrhea. As I told you guys, women have 4, situations which men don't have. One is the menstrual cycle. The other is the vaginal discharge. We call them to be the leukorrhea. Or sometimes we call them morbid leukorrhea, right? And this means the secretion of the from the uterus, which is for lubrication only. Usually the amount for those secretion is so small, sometimes smaller than a spoonful of liquid, which we know wet the underwear. However, when the woman is in a morbid stage, this amount will be increased, and also it gets smelly, and the color is also different. If you have this problem and go to see the family doctor, all of them will say that, oh, sorry, you get the inflammation in the vertex of your vertex of your uterus, you get some antibiotics. That's it. However, the Chinese medicine doctor would like to differentiate into different syndrome according to the color and according to the stage. Usually, we get 2 types of color. Either you get white color or yellow color. Sometimes more yellow, we call it greenish yellow, right? And then we can divide the common disease into 2 or 3 symptoms according to the color, according to the stage. Sometimes whether it is sticky or watery, and sometimes whether you get a smell or doesn't have smell. All those are different. So as I mentioned before, Chinese medicine have a more classification than the Western medicine in this situation, in this the common disease. Okay, so let's start. So when we talk about the leukorrhea, and this is a kind of disease, as I mentioned before, usually it is normal because in the body we all need the lubrication. We all need the secretion, just like we have tear, we have your saliva, we have your eye secretion. All those for what? For lubrication. Like in the uterus, of course, the uterus also can secrete some fluid outside to lubricate the vagina and lubricate the external reproductive organ. This is normal. So, however, when we have a persistent and excessive secretion of this mucus outside the vaginal area, we call it abnormal vaginal discharge. This is a pathological change. So this kind of leukorrhea because of 2 reasons, as I mentioned before. If you get the clear color, of course, the watery and more amount, we say this is because of the spin deficiency. If you get this is yellow, sticky, and smelly, it is also because of the liver. This is all. I always tell you guys that any disorder concerning about the external reproductive organ, both in male and female, are concerned about the liver, and sometimes later on they will concern about the spin. So in this case, you can find that the main factors causing the leukorrhea are the deficiency of spin qi and also the stagnation of the liver qi. I think stagnation of the liver qi is not severe. If it develops to what we call the downward infusion of dam heat, this is more severe. It means when the woman get the smelly leukorrhea, or the man will get any inflammation in the scrotal sac or in the external, skin, the skin or external reproductive organ, all those will be
because of the because of the heat or because of the damp heat inside the body, and all this will leading to what we call it the yeah, okay, and all this will lead to what we call it the kind of abnormal leukorrhea. And sometimes, as I mentioned before, the two vessel. One is the the flush vessel. The other is the conceptual vessel, and also the third one is the bell vessel. All of them can be accountable for this kind of disorder, common disorder. Okay, so the ancient doctor, the ancient Chinese doctor, would like to classify this symptom according to its color, whether it's white, yellow, red, sometimes red, white. I think red, white is not usual, and as I mentioned before, usually white, red, and also yellow. Yellow means fire. Yellow means heat. White means dampness or the deficiency. Red usually means blood. That means sometimes you have the bleeding from the uterus. It is also in the case when the pregnant woman they get miscarriage. Sometimes they get the red mucosa. That means the baby either the bursting of the amniotic membrane or sometimes because of the going to miscarriage, and then they get this red color. And multiple color, of course, this of course will happen, right? Among which yellow and white are common. Yeah, this is true. Usually you either see yellow or see white, but more yellow we call it the greenish yellow. This is surely inflammation. Same as your phlegm, right? Usually the phlegm will get two types of color. One is yellow, the other is white. Sometimes they see greenish yellow. That means you get severe inflammation in your lung in this case too. So they can compare them to this kind of situation. Okay. And after we consider the different types of the leukorrhea, and we can justify what will be the cause of the disease. That means the etiology and the pathogenesis. As I mentioned before, there are two types. One is the deficiency type. The other is the excess type. For deficiency type, we usually mention about the spleen. Whenever we have the spleen deficiency, why do we have spleen deficiency? One, because you eat too much. As I always mention, if you go to take the buffet and then you take more than your stomach can more than what your stomach can accommodate, that means you overload your stomach. Of course, it will cause the spleen and stomach deficiency. In this case, your spleen and stomach will undergo stress, and it will not perform its own function in transportation and transportation and also transformation of food. And what is the result? Accumulation of the food, and then it will obstruct the flow of the spleen qi. And what is the result? The final result is this spleen qi will turn to damp. The dampness, of course, will lead to the leukorrhea, become more copious secretion of the leukorrhea, and also the the white, and also the large amount of the vaginal discharge. And the second deficiency is because of kidney deficiency. Okay, for this moment, I don't know what kind of deficiency is kidney. So you guys this textbook is not well organized. When you see in kidney, you must think of whether it's kidney yang, kidney yin, kidney qi, or kidney jing deficiency, right? So when you look, this time we have to see into those sign symptoms. For example, the constant deficiency of kidney qi. Kidney qi is responsible for the normal function of the kidney. Kidney has many functions, as I mentioned before. Besides, it governs the urination and also the defecation, and also governs the bone, governs the fluid. On the other hand, it also governs the menstrual cycle. So many women suffer from menstrual cycle problem because of the kidney qi deficiency, right? This lead to the problem of the bell vessel, the conception vessel, and then, of course, many problems in women disease because of the deficiency of the belt and also the conception vessel, right? And also the third one is about the dampness. If anybody get the dampness into the body, that means it will change to heat, and this heat will stay in the liver, and the liver qi will transform the heat. And when the heat and also dampness together, it will cause damp heat. As I told many people that, if in Chinese language, if we always use the term damp heat in our daily conversation, when we refer to damp heat, when we say this thing is really damp heat, and then we refer to it as very lingering, this is very long lasting. It is a kind of a very sticky and very troublesome, right? So we call this really damp heat. And how do you know that whether this leukorrhea belongs to the spin deficiency or the damp heat or the kidney deficiency? Now we try to outline their signs and symptoms to see how can we identify them according to each symptoms, right? And first of all, as I mentioned before, the leukorrhea happened with copperous and also copperous and also white liquid, and which is smell. This does not have smell, and this is because spin. Of course, you can combine with the observation from his face and also his complaint. That means if any woman who suffer from the copperous secretion of the leukorrhea with no smell, and also she displays some pale or yellow face color, it was really fatigued and poor appetite, and also with the watery stool. Sometimes you find she got some edema in the lower limb. That's surely because of the yang deficiency. And which yang, of course, is spin yang deficiency. The pulse always see is, slow and also weak, and also you find the tongue color should be, sticky or sometimes it's greasy, or also pale and greasy. That means the spin yang is not able to drive water away. So among all these symptoms, if you want to know whether this spin yang deficiency, you can just look at the diarrhea. Okay, where diarrhea with watery stools, loose stools or not, and also edema in the lower limb are always because of the kidney yang, not the spin yang. Just in this case, the author just borrow the symptom from the kidney yang deficiency into this case of spin yang deficiency, right? Actually, the edema in the lower limbs mostly because of kidney yang. So you must try to have a critical eye to pick up some of the signs and symptoms which belong to kidney, which belong to the spin, right? So the following passage just explain why we got all these signs and symptoms because of spin yang, mostly because of the losing of the normal function of spin. So leading to all this series of signs and symptoms. So you can just compare those symptoms with other symptoms, okay? In order to distinguish this is spin deficiency. Okay, as for the kidney yang deficiency, of course, the leukorrhea, the vaginal discharge is much more, and also the white. It seems to me that the leukorrhea in spin yang deficiency is similar to kidney yang deficiency because they come from the same source. Usually first spin yang deficiency, and later on it develop in the kidney yang deficiency. So that's why they share the similar color, the similar state of the leukorrhea, right? However, for the kidney yang deficiency, you can find a series of signs and symptoms which pertains to the kidney yang, just like you have a soreness in the lower back and also the lower limbs, and your lower abdomen is feeling cold, and the urine will become cold and also frequent urination, and also excess urine, and then also the stool, same as the kidney yang, the spin yang, we got the loose stool, and the tongue coat, of course, the thin white tongue coat, and also the deep pulse, all of them. And of course, the typical symptom here is the soreness of the lower back and cold sensation of the lower abdomen, which is specifically for the people who suffer from the kidney yang. Okay, so of course, the following passage also explains the symptoms. Why the symptom of this why the kidney young get this kind of symptom, because of them due to the lack of fire in the gate of the life. Gate of life actually means the right kidney. Okay, so this is the result of getting not enough fire in the main man. Then it's too weak to warm up the urinary bladder and also the spleen. So we got the long urination, and then also the frequent urination, all because of the kidney. As I told you guys before, kidney is also responsible for urination and the menstruation cycle. That means it will also affect the function of uterus, so it's able to keep the uterus warm. Okay, so in infertility, I will tell you one symptom is called this, which is called the cold uterus, and cold uterus is also a reason for women getting infertility. Okay, we don't do that. Okay, how do you know that this kind of leukorrhea is due to damp heat? And this is very distinguished. You know why? Because for the above two symptoms, it share the same similar symptom, that it got the long and also smellless the vaginal discharge. But in this case, damp heat, the vaginal discharge is sticky, viscous, and also stinking yellow. That means one is really sticky. Second, it get really smelly. Third, it get yellow. So in a large amount, sometimes may not. And the second characteristic is also important. Remember this one. And it get a itching private. Why? Because all those fluid flowing out contain bacteria. And this bacteria, when it reach the surface of the vagina, it will cause it itching. And sometimes it cause some, worms or bugs or going there. And when you put it in the microscope, you can see some eggs or some small animals inside there. This will cause itching in the the private area of the woman, right? Because accumulation of all those sticky fluid. I always tell you guys that how can we grow the plant inside our body? Between you and me, we got lots of bacteria, right? How come the bacteria cannot go inside our body? Because it doesn't have a good environment. How about if you put some soil here, and then put a seed here and keep warm all the time? Later on, you can find the soil and it rise to the seed, and get the seedling, and then get a plant here, right? And this is our imagination. However, you just imagine this is your foot. You get all the sweat here, and then you get some, some secretion of the skin here. I mean the residue or the dead cells with the sweat. Later on, you will find the fungus will go here. This is why we get the fungus in our toe and our feet, right? In this case too, if the woman just keep the private wet all the time by allowing all the secretion, the leukorrhea in there, it will grow some animals there, some microorganisms there. This is why you get itching, right? So this is a kind of the coccyx around there. So the people getting this kind of the symptom in the leukorrhea, they will get large amount of yellow secretion. At the same time, they will get itching in the external reproductive organ, and also the scanty and yellow urine because of heat. On the other hand, the pulse will be a little bit soft. That means soggy and rapid. As I mentioned, a soggy pulse means dampness, okay, and rapid means heat. And the tongue coat, everybody knows, should be sticky and yellow, and the leukorrhea will be yellow, sometimes reddish yellow. Bitter taste in the mouth. Do you remember what is indicated by bitter taste in the mouth? Liver fire, liver heat, right? That's why I always mention that, many diseases happen in the external reproductive organ are linked with the liver problem. So whenever she have a little bitter taste in the mouth, that means she got liver heat or liver damp heat, right? Dry throat with heat, irritability, that means we get irritable. In the body irritability, that means you get heat, and also heat sensation. Later on, palpitation, insomnia. All these are because of fire. Palpitation, as you learn in the second lesson, because sometimes the heart fire or liver fire, you get palpitation. Insomnia, of course, can be excess or deficiency. Yellow coat and string and rapid pulse. String is wrong because it's wiry. I'd rather say wiry and rapid pulse, right? This is somebody say string-like. Okay, all these are because of one organ. Remember, all those are because of one organ, right? It is the liver. So you can see this well socket. But I didn't correct it well here. Yeah. No, I mean soft. Yeah, this one. I didn't actually. This is the Canadian board examination accept this well, and soft of course is not, right? So we're not. So I just want to correct soft, and also the string here. Please correct the wiry. Okay. In this page, please correct the soft into soggy, S-O-G-G-Y, and please correct the word, the string pulse into wiry, W-I-R-Y, wiry. Okay, thank you. All these are because of the problem in the accumulation of heat in the liver or damn heat in the liver. Okay, I'm not spending too much time on the analysis part. Yeah. Oh yeah, thank you, because of my book here. I mean, my PowerPoint here doesn't have it. Thank you. Soggy, S-O-G-G-Y, soggy. Okay. After we finish the differentiation part, we try to look at the treatment. Spin deficiency, of course, the treatment method. We also got the treatment method. However, I found this they just write down the method. I would like you guys to write down the treatment about the method. Okay. In this page, you can find, some people just write down the method. So it should be treatment method. The treatment method, in here, we're trying to find the points for the Yangming and foot tie-in. So what we are going to do is to try to find the concession ratio and also the foot tie-in. That means the foot tie-in, that means the spin, and then foot Yangming, that means the large intestine. So the prescription here, we're trying to look at the Daimai. Do you know what's the Daimai? Easy. This is the umbilical here, and this is when guys get the shot, this is the part you get the shot here, right? Go down here, here. This is the Daimai. Okay, and this one just cross form between umbilical and also the lateral side of your shot here. This is Daimai. We call it the BL26. This is also good for regulate the belt vessel. BL26 is the point for regulation of your belt vessel. And also CV6, of course, this is good for the qi. We are tonifying the qi. And this upon BL30. BL30, just remember the diagram as drawn on the whiteboard, right? BL30 is the same level, as the 34, and the lower circle vertebrae, 1, 2, 3, 4, those 4 points, right? So this is the points you get it. I'm sorry. Pardon me? Yeah, BL30, same level, 34. This one is to regulate the bell vessel, Let me see. Yeah, this one, right? And BL30 is going to regulate the bell vessel, okay? And then the other is 竹山里猪岭泉, okay? Yeah, you're right. And then we get the SP9, which will regulate the water in the body. And also the SD36, of course, this is also for the regulate the spin. That means among these 5 points, the first one and the third one, first 1, 2, 3 are regulate the chi and also the bell vessel of the body. And the last two, SP9 and ST36, is tonifying the spin and get rid of the dampness. Okay? Because one is SP point, the other is T point. Both of them are working on the spin. And this is the page for explaining why we use those points. As I mentioned before, BL36 is for tonify the vessel and to check to leukorrhea. That means any kind of abnormal vaginal discharge, we can use BL34 or BL30 to regulate. Okay, and the second type is regarding the deficiency in kidney. For deficiency in kidney, we try to find out the kidney vessel, which is regarded the Fuchsian meridian. In addition to that, we use the kidney meridian to stabilize the conception and also the bell vessels. So what we're looking at of one, you guys must not forget BL23, which we call it the best shoe point of the kidney, sun shoe. And in order to tonify the kidney young, remember the CV4 and CV6, of course. Here in the book, it just mentioned about the CV4. And the other point is diher. Diher is along the KI. Okay, let me show you guys, right? This is a middle point, and when in the abdomen, the KI is quite near. I mean, the kidney channel is quite near the middle point, just given by half chin. So this is KI, and this is the ST, and this SP. So KI around here. So this point we call it diher KI12 actually is below our umbilical point, 4 trim below that, and quite near in the middle in the 2 point here. So this is the point to deal with the also the urinary problem and also the uterus problem. So KI12 and also the BL26 diamide, they're all dealing with the abnormal vaginal discharge. And one point, KI7. When do you use KI7? KI7 is a very good point to deal with the edema, dampness. But why when you use that? Sometimes you can use it to stop the sweating, right? So since leukorrhea is a kind of, a kind of a secretion from the body, and which you cannot hold it. That means you are not able to hold. Some foods you cannot able to hold it because of the deficiency in the body. So in this case, we try to use morphine to achieve the exchanging effect. That means we try to keep some useful substance inside the body, just like the sweat, all those blood, and all those secretion, they are useful, right? So Fulil KI7 is a good point. For example, when people suffer from profuse sweating, I advise you guys to use the LI4 and also the HT6, and also KI7. I repeat once again. For people who suffer from profuse sweating, we can use 3 points, namely, the LI4. The second is HT6. The third point is KI7. Those 3 points are able to exchanging your sweat so that the profuse sweat can be shed. So in this case, similar case, because leukorrhea is also the vaginal discharge is very useful to women. If you have let go all those vaginal discharge, of course, is no good to the body. So in order to get restricting, we also find the point of Fulil KI7, which is able to retain all the useful fluid inside the body. Okay. So in the explanation part, we tried to explain, but without the explanation part, I find the explanation part doesn't mention about the function of the KI7. It just mentions about BL26 and also the other KI12 and also BL620, CV4 and BL7 only. Okay, so I add one more KI7 is to try to retain your useful fluid inside the body. Okay, and number 3, dam heat. The third type of the first symptom of the leukorrhea, body leukorrhea, is because of dam heat. Here we try to use some points to clear the heat and remove the dampness, because clearing it and removing dampness is a treatment principle, right? In order to regulate the conception vessel and also to stabilize the bell vessel. So in this case, we are trying to use the 4 points we are using in the dysmenorrhea before. In chapter 2, when we have any people suffering dysmenorrhea, we try to use 4 points. Which 4? 中极 CV3, and also Chinel BL32, and Sanyijiao SP6, and also Taichung ALL-free. Now we can use this to deal with the same case. That means two kind of common disease, we can use the same points since they are from the same source. So Chinese medicine is so wonderful and amazing that you can use the same points to deal with different disease once they got the same same etiology, right? So in this case too, and supplementary, that means for besides the major point, we can use some modification. And in acupuncture, modification means we can use some supplementary points. For example, when the women get the leucorrhea with the yellow color, smelly, and it doesn't there, you get the itching private. And then we consider one more point, we call it Licol. Licol is the point in the liver, which is, the five chin from the LR4. So from the LR3, 1, 2, 3, and LR4, yeah, from LR4. LR4 we call it to be the 中风, the here, 中风, this one, it's 4, and then you go up to 5. Okay, 5 points here, the 5 inch here, and then you get the Licol LR5. LR5 is usually for tonification. Any people suffer from liver blood deficiency, we consider LR5 or LR8, which will tonify. However, when people get itching means what? Itching means wind. Why do we get wind? Because we get not sufficient blood, right? So in this case, we try to tonify more liver blood by finding the point LR5, Licol there. And on the other hand, if you say that, why not get SP10? Yes, down below here, if you get the reddish leucorrhea, that means the leucorrhea mixing with blood. That means you get the blood, not from the urine, not from the stool, but from the vaginal discharge. That means you tonify the blood, right? This is a method, is stopping bleeding by tonifying the blood. When I was teaching the herbal prescription, I always advise students that stopping bleeding, stop bleeding. We can get many methods. One of the methods is to tonify the blood. Once you tonify the blood, the bleeding will stop. Okay. Here we use the same principle that when we apply the needle into the SP10, we try to tonify the blood in order to stop the bleeding in the leucorrhea. And with excess heat, of course, this is the universal point for the heat in the body, Li11, right? So this is useful to stop clear any heat. So here's a page to explain why we use 中极, which is a move point, fun move point. We use a 七妙, which is BL32. This is also to remove the dampness, especially in our uterus, in our vaginal, for vaginal discharge, right? And of course, Sanjingjiao is the point for the free yin point. Always deal with the women disease. Okay, and then down below here, we are talking about usually when we talk about leucorrhea in the Western medicine, it is combining with those diseases just like vaginitis, cervicitis, and also endometritis, and also anesitis. All those belongs to the disease, belongs to the common disease, happen either in the uterus or outside the uterus, or the junction between the uterus and also the vagina. Okay, all those are the women disease, and also they got the abnormal. Once they got that, they get the abnormal secretions. That's why the Western medicine practitioner or your family doctor would like to prescribe the help of antibiotics, because they think all those abnormal vaginal discharge are because of the inflammation either in the uterus or in the neck of uterus or internal lining of the uterus, or belong to other part of the women organs, right? Okay. After we finish the prescription by acupuncture, we tried to look at the Chinese herbal prescription. So in this situation, when we find the women getting this kind of damp heat, type of prescription, we try to use one formula called the 劝避性止痛，避血性止痛 is usually to remove the dampness. So you can find most of them are containing about the dampness removing herbs, just like a 薏仁, 耆茯苓, 芥子, and also 痛球, 滑血. All this in Chinese medicine, trying to remove the dampness from the uterus to the urinary bladder and then out of the body, right? And the second type we call it the spleen deficiency and blood deficiency. Spleen and blood deficiency. Of course, this is the formula. Again, you see many times, either in the later part of the book 1 or throughout the book 2. This formula is called the 桂皮汤. 桂皮汤 actually is to tonify both qi and blood, but in this case, it is going to remove the it's going to tonify the spleen qi and also the high blood together in order to deal with people who suffer from insomnia, depression, palpitation. You can use that. Okay. And number 3, the leukorrhea due to the kidney and also the liver and kidney yin deficiency. This time, of course, you can use this formula called the 积水清肝饮. But for me, I rather use another formula, which we have seen before, called the 几株地黄汤. 几株地黄汤 means the Louis de Wangwan plus chrysanthemum and also the Chinese goji. Those are also helpful in tonifying the liver yin and kidney yin deficiency together. Okay, so this is the end of chapter number 3 on what we call it the leukorrhea, right? So are there any question in number 3 in chapter 3? No. Okay, let's finish chapter 4. Okay, chapter 4 means some kind of question. Yeah, pain and leukorrhea both together. Yeah. It depends. Usually, as you can see from the last symptom of the leukorrhea, you can find that actually the last symptom leukorrhea containing the blood inside the vaginal discharge. There is also they will cause some heat, some pain there. So in this case, of course, for me, I would like to mention the leukorrhea more than the dysmenorrhea, right? Because the leukorrhea will be more severe than that. And if you get two diseases coming together, I will choose the more severe one than the lighter one. So I suggest you do leukorrhea with blood, right? In this case, yeah. One student asked me if we get the both dysmenorrhea and leukorrhea together, how can I write it down? I told her that we rather write down the leukorrhea because I find leukorrhea is more severe than the dysmenorrhea, right? Okay. Number 4, we are talking about the irregularity in the menstruation cycle. So in Chinese, okay, 月经不调, and in this is we include 2 symptoms. One is the advanced, what we call it the preceding menstruation cycle. The other we call it the delayed menstruation cycle. And sometimes some women get sometimes delayed, sometimes the preceding. That's another story. Okay. So first of all, let's look at what we mean by irregularity in the menstruation cycle. The menstrual irregularity refers to the abnormal changes of the menstruation cycle, and sometimes preceding, sometimes delay, and sometimes we call whether it's delay or advanced. We're not sure. We will look carefully at the color, at the amount, and also the nature. I mean the texture of the texture of the menses, and also we take notes on whether we have other symptoms happening together, right? And as I mentioned before, I can divide it into 2 types. Either we call it the advanced type or the prolonged type. And of course, irregularity always sometimes it can be advanced or pronounced alternative. I'm not sure, right? But the Western medicine doctor will just attribute them to be the secretion hormone, and we sometimes refer to the amount, the ratio of the different kind of hormone, just like the hormone in the estrogen and hormone of the progesterone, right? And this is also because the result of the unbalanced secretion. I mean the abnormal secretion of all these female hormone or the hormone inside the ovary. Okay. Okay. After introduction, let's look at what is the etiology for that. The reason the women get irregularity in menstrual cycle are because of several factors. One, because of the body constitution. Second, maybe because of the diet disorder or what we call the improper diet. Sometimes because of overexertion, and sometimes because of some people they got overthinking, and those will also make the flush and also the concentration vessel disorder. Okay, so all of these factors, either the the emotional disturbance, the overeating, I mean the overthinking, and also the yin deficiency, all of them will lead to either we got the advanced menstruation cycle or the later menstruation cycle, right? But above this one, if any time we get heat or excess problem, usually will lead to the advanced menstruation cycle, right? So external contraction, that means the getting cold or yang deficiency due to prolonged disease, and also the improper diet, overexertion. Sometimes of this will lead to delayed menstruation cycle. So in this PowerPoint, we want you guys to distinguish different causes of the irregularity and the menstruation cycle according to the different reasons, right? So all this will have little different irregularity, either delay or the preceding. However, some of the reasons, just like emotional disturbance, some of them will become the kidney qi deficiency, and of course this sometimes will lead to certain type of irregularity. May not, sometimes it may have advanced, sometimes may have delayed. I'm not sure. Okay, so when the blood of C, the C of blood, that means what? The C of blood means the concentration vessel. Okay, cannot be regulated. Of course, it will cause what we call the irregularity in the menstruation cycle. So let's look at the symptoms of each type of the pattern. The first type we call the advanced menstruation cycle. What do you mean advanced? That means before. Usually, women have two periods separated by 28 days, but some women get not 28, but 18 and 18 days, it gets some little bit bleeding from the vagina. This is what we call it the advanced menstruation cycle. Of course, it is not the only symptom. With this, with this kind of the bleeding, of course, we see we have touched the color, the nature, and of course, with this kind of excess heat, of course, you can see the vaginal discharge at that time, or even the menses will be deep red or purple deep. Sometimes mixed up with the menses with the leukorrhea together at this time, because the blood is little, while the leukorrhea is more. They mix them together, of course, you can see the light red. However, if the irregularity or menstruation cycle is because of heat, so we will see the amount will not be more, will be sticky, and also will be deep red, and combining with the observation of other part of the body, just like the fresh face, the dry mouth, and also sometimes you see constipation, sometimes you see the scanty, dark urine. All those just indicate one thing: you get the heat. In addition, you get the red tongue with a yellow coat. This is excess heat, and the rapid pulse excess heat too, right? So the other type is a deficiency. Deficiency, of course, you see on the other hand, you can see the menses will be less. And the color, sometimes red, sometimes it's a light red. I'm not sure. But, the deficiency one of course, you can see the depending on the deficiency is due to the body deficiency or due to the heat deficiency. If the deficiency heat caused by yin deficiency, of course, the color of the menses remain red. If the pattern of the irregularity of the menstrual cycle is due to qi deficiency, of course, you can see the menses will be light. And combining with other symptoms, you can find she got lassitude, and sometimes palpitation with shortness of breath, and the tongue is pale and weak and with 30 pulse. Okay, before I remove this slide, I want you guys to make sure that there are two types of symptoms. One is excess type, one is the deficiency type. Excess, of course, it will mean excess heat. Deficiency can be either the real deficiency, that means deficiency organ. The other is deficiency heat, means this deficiency is because deficiency of yin. So yin deficiency, you get a red and profuse menses because it still gets some heat. This is deficiency heat. However, when you get deficiency qi in other organs, of course, you get less menses, and all kind of signs and symptoms will show that this is because of the qi deficiency or blood deficiency in this case, right? Okay, how about prolonged menstruation cycle? Prolonged menstruation cycle, of course, we get sometimes, the more than 10 days. Sometimes we get 40 days, sometimes 50 days, sometimes we get about 2 months time, we get one menstruation cycle period. Of course, this is what we call it the prolonged menstruation cycle. And all this we can divide into, two patterns also. One is because of cold. As I mentioned before, when cold pathogen attack people, it always constrict the blood vessel, constrict the cholesterol, making less blood flowing through there. Of course, the whole metabolism will be slowed down. And this slow down, of course, even the menstrual cycle will slow down too. In this case, when the blood slows down, the result is some blood will clog in some part of the body, especially in the uterus. When you get blood clogged in the uterus, you can feel cold and pain in the abdomen. Of course, you like to put the warm object near your abdomen, and you feel her 4 limbs getting cold. Tongue is thin and pale. The tongue is pale, while the tongue cold is thin and white. And the pulse is deep and also tight in this case. And for those women who suffer from prolonged menstruation cycle because of the deficiency, of course, this is because what? She got the deficiency in organs and qi or blood. Of course, her menses will be less. And also, she also got abdominal pain, but this pain is not the one who like people pressing. This is one like pressing because of dull pain and with preference for warmth, right? So the tongue will get pale and white coat and with deep and slow pulse. This is the second type. The third type is irregular. That means no matter, sometimes it get advanced, sometimes it get prolonged. So in this case, you will find that the menstrual cycle sometimes fast, sometimes slow, and however with scanty or profuse, is not sure because it has some possibility. And this is because what? Because of the liver cystinogenation. So liver cystinogenation can make the patient either have a prolonged or have the advanced menstruation cycle. So, and it also can lead to certain patterns, just like sometimes it's profuse or scanty blood. Sometimes it's smooth, but the reason is due to what? Also due to clotting and smooth menstruation cycle. In this case, she will display she will complain on the hypochondrial distension. Breast and lower abdomen also get distension too. She always sighing, burping, and also the white tongue cold can be found. The most important feature is her pulse condition. She always get the wiry pulse, right? Wiry pulse. On the other hand, the deficiency symptom also included the kidney deficiency. Kidney symptom, because when the kidney get deficiency, you also get sometimes scanty and light color menses. And in this situation, of course, you get the lower limbs and also the wrist get weakness, even aching. And also you get the dizziness and tinnitus because of kidney yin deficiency. And the two condition, pulse condition, of course, is pale tongue with white coat, while it is deep and big pulse here, right? Okay, how can we treat this? How can we treat the woman who suffer from this irregularity of the menstrual cycle? Of course, we still stick to those points we learned before. We also got Sanyin Gel, we also get the blood, SP10 Xie and also the CV4 Guanyuan. Most people getting the advanced type of menstrual cycle because of weakness. That's why we tonify her chi, her blood, and also the SP6 is specifically for those women suffer from any kind of menstruation disease, right? So, and for those people who got the excess heat, please remember we're not going to file the LI11, but instead we'll file all points in liver in order to get rid of heat. I repeat once again, in case people suffer from advanced menstrual cycle because of heat, we are not going to look to file for LI11. Instead, we are going to file all the points, all the heat points in the liver, just like LR3 Taichung, LR2 Xinjian, and LR14. 14 is the last point and most important point because it is quite near to the liver, because it is a local point, right? And for those who have a deficiency heat, of course, we file the point 25 yin. This is free. Yeah, no. Because LR11 is just for releasing the heat. In this case, if the woman suffer from advanced menstrual cycle, of course, it can losing the heat, right? And then losing the blood. If you are losing LR11, it will intensify the situation that you got more loss of blood, right? So what we're looking at is we go through the liver point rather than go through the LR11, right? Okay. And the last one is about the last modification is about the lower back pain. For lower back pain, of course, if we try to tonify the kidney by looking for BL23, and Chimel BL32 is also useful in dealing with this kind of situation, the irregularity and the menstrual cycle. And for vexation, that means the heart dysphoria, we try to use HT7, right? And this is the explanation part. And the other thing is about the prolonged menstrual cycle. We try to use what? We try to use the Qihai and also the Sanyin Gel, that means CV6 and SP6. 2 6 are useful. The first 6 is for tonify the Qi, and the second 6, SP6, is for tonify the any problem suffer from the menstrual cycle, or of course you can tonify the blood, the yin fluid. Okay, if any time you get the cold, of course you can try to use a point called the Jigong. You guys know the Jigong. Jigong is special point. It's under the Zhongji, and this is just a draw. Okay, this is the internal area, right around here, and this is the Zhongji. That means the CV3. And this one, CV3, it just points to the free chin, and until you do the internal area here, right? This is called the Jigong. Another point called the Weigong. Weigong and Jigong are actually the 2 points we are looking for when any woman who suffer from the irregularity of the the menstrual cycle. We choose this Jigong, which is a free chin, lateral to the Zhongji CV3. Okay, and also we are looking for the other point, just like Tinshu ST25 and DG. Those 2 ones are going to tonify the spin, because as we know that sometimes prolonged menstruation cycle belongs to a deficiency of spin and stomach. So ST25 and SPH are able to tonify the stomach and the spin yang in order to get rid of the excess cold. And in case of the deficiency and cold in kidney, we try to look for the point of the mean one. Mean one is GV4. Mean one actually is the same level with the BL23. Actually, it's 3 points. Remember, in the middle we got GV4, and then one and a half chin away we got the BL23, and then 3 inch we got the BL52. So remember, the 3 points are on the same line. Okay, and also the other coordinate Yao Yang Guan. Yao Yang Guan is 2 sections below the GV4. That means GV4 is at L2. I mean the lumbar vertebrae number 2. While GV3 is L3. No, L1 to 4 is the lumbar vertebrae, and L4. I mean, repeat once again. GV4 is at L2, lumbar vertebrae 2, while Yao Yang Guan GV3 is at L4. That means the lumbar vertebrae 4. Okay, and then besides that, we can use GV4 Guan Yuan to tonify the kidney yang. Actually, kidney yang can be warmed up by using GV4, GV3, and CV4, while Gui Lai ST29 is to get rid of the heat get rid of any coldness from the uterus. So in case you get the uterus get cold, of course, this is better to use ST29 Gui Lai to deal with that. Okay. Other explanation, sorry, I don't have time to deal with that. And the last symptoms before we get the lunch break today, of course, we deal with the irregular menstrual cycle. And this irregular menstrual cycle, of course, get many reasons. Okay. The principal point again is CV4, SP6, and BL18. This time we get BL18 because we want to tonify the liver. This is the best super on the liver, right? Of course, in order to deal with the irregularity of menstrual cycle, we are tonifying the kidney yang and also the liver blood together. Modification, if you get liver stagnation, please use the open 4-gate LR3 and also the Qiman LR14. And for kidney deficiency, please look for KI3 and also BL23. Last one, if you get the distension and pain in both chest and also hypochondrial region, as I mentioned before, any problem in the chest, please look for PC6. PC6 is important for heart problem, for vomiting, for car sick, and also for chest disorder. Of course, it's good. The other point is it's opposite. Here, opposite here, the G count, that means TE6. TE6. Of course, opposite to PC6 is the TE5, but you must go 1 inch more. We call that the TE6. TE6 is important in dealing with the constipation, in dealing with this kind of a chest problem. However, TE5 is dealing with what? TE5 is dealing with the upper limb problem, with the headache and others, right? So TE5 and T6 are very useful in this case, right? But in this situation of irregularity in menstrual cycle, we may use a TV6 and the PC6, 2/6, and also Yin Chuan, also Yang Chuan, then GB34, which is for liver 2. And lastly, we get the lower back pain. Of course, you can just use BL32, or some people use BL23 together. Just no problem. Okay, so you can mix the two together. Other alternate of treatment. Sorry, I have no time. You can just please read yourself. Okay, to conclude the treatment, we can just say that if you want to treat the people suffer from irregularity of the menstrual cycle, you can just treat it before. Don't treat it during. During the time, there's no use. Same as we use the Chinese herb. If we use the Chinese herbal formula, we will not use the herb during the menstrual cycle. All herbs are useless. Okay, we must use it before or after. So to deal with this one, I myself, I'm many experience to deal with the the dysmenorrhea. I always ask the patient to take the Chinese herb, between the two periods. Take until you see the period. Stop it, and the next time do it, and it's very effective. The first time their pain relieve a little, and then after 3 months, all the pains go away, right? So, and during the treatment, you advise the patient to eat less cold, raw, and spicy food, and avoid the irritability and stress, right? So the formula, one for any time you get the early or the advanced menstruation cycle, we use a formula called it 单支逍遥散. In Canada, we call it 加威逍遥散. And this is very popular for women suffer from any type of woman disease menstruation cycle. So this is 加威逍遥散. And for those suffer from the, the yang deficiency leading to the blood heat, we are using those herbs going into the bloodstream to clear heat. There are specific formula for those herbs to go into the bloodstream to clear heat. This is different from the ordinary heat clearing herb. And this we use a formula called 清金散, specifically for clearing blood heat. And number 3, we got the yin deficiency leading to blood heat. We use 两敌汤. 两敌汤, what does that mean? This is 2 D. One is D Wang, the other is the D Gu Pi. So the 两敌. This D Wang and D Gu Pi can go into the bloodstream to clear the heat. So this is also really popular for women suffer from, the deficiency heat, leading to the irregularity of the menstruation cycle. And last one is the qi deficiency. Very popular. Any Chinese medicine practitioner will know what is the 补中益气汤. 补中益气汤, that means tonifying the middle jiao while they're invigilating the qi. And this is very popular for people suffer from qi deficiency, even qi collapse, right? And for the delayed menstruation cycle, of course, it can divide with the blood deficiency. There's a very good formula called 代补元健. 代补元健, actually, during the teaching of the herbal prescription, I will tell the student that this is for tonify both qi and blood. Why? Because you can see Dangxin, you can see also you can achieve 3 type of the deficiency: blood deficiency, qi deficiency, and kidney deficiency too. And also you can get rid of the stagnation. So 代补元健 is a very, very useful formula in tonification. And for those women who suffer from cold syndrome leading to the irregularity of the menstruation cycle, we advise you to the 暖宫丸. 暖宫 means warm the uterus, warming uterus. And 艾附 is 2 herbs. We use the 2 herbs as a principal herb, 艾叶 and 附子 as a principle to warm the uterus by using this 暖宫丸. That means warming the uterus, right? For people suffer from cold, blood cold, I advise them to use a 温经汤. This is warming the menstruation cycle, 温经. And then the last one who get the qi deficiency, of course, the one formula I mentioned more than 2 times, which is called the 柴胡疏肝汤. 柴胡疏肝汤 to relieve the liver qi stagnation. Okay. And last one is about the irregularity of menstruation cycle. We use the 逍遥散. Again, 逍遥散, as I mentioned, will better for any type. So to play safe, please use 逍遥散 for any kind of irregularity, no matter advance, delay, and any irregularity. 逍遥散 is a very good herb to deal with that. And kidney yin deficiency, this is a very formula composed by our sage 江中景. 江中景means in his book of 金匮肾气丸 have a very famous formula called 金匮肾气丸. This is a 肾气丸, okay, and can be used. And too much menses, we can use this 举元健. 举元健 is the formula dealing with the people suffer from qi deficiency, but with much, much more menses, okay. And for heat, of course, there is one formula called 固静丸. 固静丸, that means to consolidate the menstruation cycle inside the body. And less menses, of course, this is all because of the deficiency. So we are going to use 几穴丸. Actually, 几穴丸 is similar to the 鹿威地黄汤 plus the 2 tonifying herbs, 当归, Dangxin, and also 北芪, 2 of them. So this is a combination between qi and blood tonification. For kidney yin deficiency, we use this same formula as the Gui Shen Wan, then same as the Shen Qi Wan. For last one, for people who suffer from the blood stagnation, please use Tao Hang Si Wu Tang, which is universal for removing all the blood spaces. Last one, you get the phlegm. This is a very important formula called the Chang Fu Dao Tang Wan. That means to removing the phlegm by Chang Shu and also Fu Zi. So those, okay, I think all those will be the 4 topics in the morning. So in the morning, I'm not able to finish all 5, but in the afternoon, of course, we did another 3.5 hours, 3.5 hours, 3.5 hours to finish these 4 topics in addition to one more class work for you guys, right? Thank you. Yeah. Good afternoon, guys. Welcome to the class in the afternoon. Yeah. In the afternoon, we're going to finish 6 topics, 5 on gynecology, 1 in pediatrics. And before that, of course, I will just share with you one class work because as I mentioned this morning, reviewing through the 52 cases is my main task. But you guys had to be recruited to prepare for the mock examination on Sunday, which Alex will conduct your final session. And also, another purpose is for your, the case study examination. You guys need to know more about that, right? So the more cases I give you, of course, the more preparation you can get it, right? So now in the screen, you can see that we are going to have a, so what? Also in the screen, you can see that, and also I send this to you guys, on the paper. So, yeah, thank you. Right, thank you. Can you see that? So, yeah, no problem. Okay, if you get the paper I gave you, you can just see that. I just gave you before the break here, right? So let's review on this. This is a case for a female of age 42, and her chief complaint is every time she got the menstruation cycle, she got diarrhea, right? And this is a really debatable cases when I conduct it in the daytime school, and then we have many discussions. So I just want to bring your attention to this case. I think for the acupuncture point, it is not too much argument, but from the Chinese medicine, of course, they get many different the opinion for that. Okay, first of all, the patient's bowel movement move regularly, except when in her menstruation cycle she suffered a lot of loose or even watery bowel movement. This is also common case when I was working in Hong Kong. Some women, they always get different kind of disorders when they get menstruation cycle. As I mentioned before, this is because they will get the lower immune system during this time, right? Of course, easily get affected by any the situations, any disorder. So this belong to menstruation cycle, and also belong to diarrhea. So we can just refer to page the last chapter 6 of the first book 1 of your book 1. You can see diarrhea, and also combining with what you learn in the menstruation cycle here in the chapter 1 when you mention about the PMS, that means menstruation symptom. You always combine both knowledge, and you can answer this question. So what he came to the idea when she came to your clinic, she found that diarrhea, and she's thirst for drinking, urgent urination, insomnia or sleeping with many dreams, perceiving heaviness, sensation of 2 legs compared to lead, recently profused menses along with the blood clots. There's a lot of problem, right? So you look at this one and try to figure out the diagnosis, and then you, as an acupuncturist or TCM practitioner, you collect information from her that her tongue is red, the coat is white, but I think it's a little bit slippery. Should be, and then there's a pulse. The pulse should be wiry and very okay. Yeah, okay, yeah, get it. Yeah, get it. Yeah, and then you find her tongue is red with white, but I think it's a little bit slippery, should be. And her pulse is wiry and thready, usually. And as I mentioned before, although this belongs to an excess syndrome, but sometimes you can also get slight thready pulse here, right? So what I'm going to do is ask you guys, what is the diagnosis for this patient? Okay. So the first one, illness. Illness. Which one do you choose? Illness. What is the name of the disease? Name of disease, of course, you have two choices. One, you either get diarrhea. Second, you can say this PMS. That means the the prematuration symptom. Which one you prefer? Premature symptom, right? Right? But the answer is you just combine two together. Yeah, if you look, if you read the chapter one of your book, and the first page it mentioned about the law of disease in during menstruation cycle. There was one thing you call it the yeah. Let me see. Yeah. No pain. No pain. No pain. No pain at all. No. 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 No during a pain. No. Okay. Premenstrual symptoms refer to physiological and mental changes before the menstruation cycle, such as irritability, pain or no pain at all, being, irritability and also nervous, and also edema, diarrhea, and also headache, and also descending pain, for example, such as, but one of them will be the symptom. Any one of them will belong to the PMS, right? So in this case, you can see a lot of example. Just like you can refer to page 6. And next, according to the clinical symptoms, there will be lots of symptoms, just like fever during menstruation cycle. No. Such as edema before. Of course, there's no one person having all those symptoms. Others will die, right? Because they can sing. Yeah. No. Yeah. So this should be one of the symptoms called the diarrhea during the menstruation cycle, I think. Yeah. So yeah. So this is a kind of diarrhea during the menstruation cycle. So the chief complaint will be the name of disease, right? Because this is also the name for the disease. Because we in our Chinese medicine we don't have other name equivalent to this one, so you can keep using. Yeah. You can just do PMS. Yeah. Yeah. Diarrhea during the menstruation cycle has a PMS. I think this is the name of that. Okay. How about the differentiation syndrome? It seems to me that there's a lot. It seems to me that there's a lot of symptoms you guys just stick to. Okay, one to one. First of all, diarrhea. Yeah, diarrhea. You're right. We must complain to the spleen, right? Either this is a spleen problem, just say spleen heat, spleen dampness, right? Spleen cold, and you can lead to diarrhea, right? However, when you refer to the symptoms presented by the patient, thirst of drinking, that means it's heat, you're right, and urgent urination. Deficiency may not be, because when you guys learn about the urgent urination, sometimes it's because they're damp heat, sometimes because of deficiency, right? And we combine the first and the second symptom, you'll find that this may be because of heat and damp heat. I'm not sure which one, okay? How about number 3? Insomnia or sleeping with many dreams. That means heat. Some kind of a liver heat or heart heat, and then you can have a man sleeping with many nightmare or many disturbed, or this is called the dreams disturbed sleeping, right? So heat, damp heat. And the fourth one, perceiving heaviness sensation on 2 legs compared to taking the lead there. Whenever you feel heaviness, whenever people having the headache, as if it was weathered by the towel, and the body have a very heavy sensation, there should be a kind of dampness. So you get heat, damp heat, and dampness. And lastly, recently profuse menses along with many clogs, right? This clotting may be a kind of a blood stagnation, right? Okay, and this blood stagnation maybe because of heat, maybe because of cold, I'm not sure. Okay, combining these 5 bullet points on the symptoms, what can you conclude? Maybe heat, maybe damn heat, right? Okay, and then you yourself carry out the physical examination and see what happened. Red tongue with white coat. Red tongue surely be heat, right? And the white coat, of course, it may be. Sometimes you refer to coat, sometimes it will be normal, I'm not sure, right? And how about the pulse? Wiry and fatty. That means a liver, right? Okay, now, how did the diarrhea brought about? How did it bring about? What brings the diarrhea to this woman? Damn heat advanced spleen, right? Damn advanced spleen. Damn heat, right? But how does the damn heat bring about? Why this woman do not have any, diarrhea during the normal time, but during the menstruation cycle, she got this damn heat? Why? You got to find the reason why. Spleen, yeah, which affects the transformation and transportation of the spleen. Which organ? Which organ should be? Which organ? Anytime you get the menstruation cycle, which organ is the liver, right? Since this is according to the relationship between the 5 elements. When the wood affects the earth, that means when the liver is in hyperactivity, it will affect the spleen. So making the spleen unable to carry on his normal function, right? So this is because during the menstruation cycle, the spleen, the liver is too exuberant, right? It's either this is because of liver yin deficiency or liver is because liver fire, but he doesn't get any bitter taste in the mouth, right? No bitter taste in the mouth. So this is somewhere else. No fire, no heat. This will be the liver yin. The liver yin. Liver yin deficiency, why? Because all the blood was driven to the uterus. So leaving the liver yin deficiency, and then you are affect the spleen. So the result may be liver yin, not enough to drive the spleen. There's a spleen lack of its function in controlling the water, in transformation and transportation, leading what is the kind of diarrhea, right? No liver fire, because you can't see bitter taste in the mouth, hypochondriac region, no distension, right? So the second thing is a liver yin deficiency, right? Because you get a wiry and fatty pulse. Fatty and fatty pulse is also the liver yin problem, okay? So what I suggest here is the liver yin bring to the heat deficiency, then heat tangle water, and then this water is formed because of the disorder of the spleen. So the waters flow down large intestine, resulting in diarrhea. I repeat once again. During the menstruation cycle, all the blood goes into the most of the blood goes into the uterus, and leaving little blood in the liver. Okay, resulting in liver yin deficiency, right? And the liver yin deficiency, affects the spleen, which loses function in the transportation and transformation, and then all the water, instead of staying in the spleen, will flow down to large intestine. If the large intestine contains lots of water, then this is the result of diarrhea, right? Okay, this is the reason to explain for that. Okay, now we got all the symptoms, we got all the diagnosis now. So this is the reason why. Why she gets thirsty? Because she get heat. Diarrhea because of the heavy and because of all the water, are flowing down the large intestine. Why she got heavy legs? Not because of kidney this time, because of damn heat in the legs, right? And then you got liver overacting the spleen. And yesterday when I was in Highway 7, in the clinic in Highway 7, a woman complained to me that she's 60 years old. She got a really heavy legs in the calf here. Whenever you strike the calf here, she will feel tired and tightness here, and she will numbness there, right? In the morning it's okay, but once in the afternoon or when she's walking for a long time, she got the numbness and also the pain in the calf. So I just explained to her, this is because of what? This is not in both legs, just one leg, just one leg. So this is a problem. Maybe the blood vessel blocked in the or in the calf area, or because of this reason, the dampness. Usually dampness will cause the heaviness of the legs. But in this case, it's both legs. In her case, it's one leg. So one leg, I think this is a problem. Maybe she's suffer. I tried many methods to improve, her kidney, but she doesn't like to take her. She like to take, the acupuncture. So 3 times acupuncture doesn't help her very much. So I decided, huh? How did start? She has no idea. I think as gradually she got numbness and the pain for about 1 year. Another 1 year, she tried to find out the reason, but she tried many methods, just like the physiotherapist, family doctor, and even specialist cannot find its own reason. But she just said, if this case persists, she will just like to do some operation or inject something into her calf muscle here. She thought this may be some kind of cortisol, some kind of cortisol. So she refused to take it. But she just find all kinds of doctors, including the Chinese medicine doctor, including the chiropractics, including the physiotherapy, but she didn't solve the problem. So she came to me. I tried a few times, but I find that she suffered from sciatica, and then down here. But the thing is, I make the use some acupuncture in her lower back, but she doesn't. It doesn't help her to solve the problem of the calf. So I just tried to think of whether this is because of what we call the atrophy. Maybe the muscle at the calf here is getting tired and also reduced. I'm not sure, but the weight. But the thing is, we try many methods, but it doesn't take any effect, right? So I don't know, maybe because of aging, because it's something we don't know. So you ask me how to. Yeah, first numb. Whenever you leave out the leg for about 2 or 3 minutes, and then she find this is very numbness and also the pain in here. That's the one side, not the other side, right? So it's on all the leg, all the lower limb get here, but the side has no problem, just here. When I put the needle in GB30, she feel really pain, and also another is in 54 BL54, she get also pain for the, and also the numbness are down here. When you press it, of course, it really the pain radiate down into the leg. So this is the problem for her. Okay, yeah. So I try to find the reason for her because it is very complicated. Okay, let's move to the treatment. Okay, if this woman get diarrhea during the menstruation cycle, how can we deal with that? So the problem, since it's a yin deficiency, so we try to nourish the yin, right? She also feels thirsty, so she feel disturbed sleeping. So we try to create a heat from her, right? One is nourishing the yin, the other is curing the heat. However, we deal with her diarrhea. What are we going to do? Remove some water, right, from the large intestine. So we are doing 2 things. One, nourish her liver yin. Second, we try to clear the heat, from her liver fire, and then we try to remove some water from her large intestine. So in this case, what we're going to do? One, how can you deal with diarrhea? How find a local point? Which 2 are the local points for doing diarrhea? Local points. Tinshu. Yeah, SC75, Tinshu here, right? And then of course you can get it. And the other is what is the distal point for dealing with the large intestine? Since diarrhea concerns large intestine, so this is the funmu point of the large intestine, right? And the distal point of the large intestine is here, ST37, 37 central shu. So ST37 is the lower Hishi point for the large intestine, while ST39 Saju shu is the Hishi point of the small intestine, right? So we are choosing the ST25 has funmu point, ST37 has the lower Hishi point. However, for dealing with water diarrhea, of course, we try to find out the SP9, SP9, 阴陵泉, right? The heat arising from the liver and also from the spleen. Of course, we find the ST44, and ST36. You must not forget this one. In order to tonify the spleen and stomach, please remember ST34, and also SP4. SP4 功勋 is for tonification of the spleen. So when the spleen is getting tonified, okay, no more diarrhea. And ST36 also tonifies spleen, stomach, and also qi. Once you get up the qi, of course, the diarrhea will stop it. The other thing is, how can we put out the fire? The fire, see whether does it come from. The fire comes from liver, of course, you can consider LR3, right? If the fire comes from the stomach, there's one point we can release stomach fire, which is ST44. ST44, we got the nating. We are not looking for ST45, right? So down below here, we got the explanation why we choose those points, right? And for this acupuncture one, there's no much argument. But down to the herbal prescription, when the students are several teachers, each teachers and their own, idea. Usually, for dealing with diarrhea, what we're going to do? Diarrhea, for herbal formula, we just use something to absorb some, water, just like 猪苓散 or something, right? However, in this case, since it's menstruation cycle, I would like to choose one formula called the 通泻药方. 通泻药方 is the formula I used when I do my doctoral thesis on irritable bowel syndrome. What do my irritable bowel syndrome? That means the irritable bowel syndrome means the kind of bowel movement, irregular bowel movement because of the liver problem, because of stress problem, right? So I make use of this 通泻药方 in order to deal with the diarrhea because of the liver problem. Since the menstrual cycle concern much links with the liver, so I just use this formula. Other teacher will advise you to use a 猪苓散, 汤 or 猪苓散. 猪苓汤 actually is to remove too much water. So my advice is, if in case of the normal diarrhea, that means normal diarrhea because of damn heat, you can use this 猪苓散. However, if this is caused by menstruation, that means the diarrhea during the menstruation cycle, I would suggest use the 通泻药方. Okay, this is what I suggest. Okay, this is the end of the class work today. Let's proceed on today's work, right? And of course, yeah. Okay, page 5. Yeah. Yeah. Okay. Yeah. But if we're going to take this book with us, yeah, and then look at it with this case, okay, then I'm lost. Yeah. You're right. Yeah. No. This is not because once you guys are familiar with what is diarrhea, and then the principle, right? You should know that this is deal with the spleen first, and then second you do the water. Regular diarrhea. This is the diarrhea during menstruation. Yeah. So we are not supposed to go back to book 1 to look at diarrhea. No. We're going to PMS to look at no. Whatever PMS is However, there's no symptom, just like what we mentioned about this, the diarrhea during the menstruation cycle, right? And so in this case, you're looking for the organs rather than this kind of the symptoms around there. You cannot include all. Although in page 6, down below you get lots of, according to the clinical symptom, you get lots of the other symptoms, just like those of the name in Chinese, right? But you cannot include all the, just like fever during diarrhea, so during menstruation cycle, or you got the edema, or you got the diarrhea or dyspnea. I don't think we can list out all those things, right? So I understand your problem. But in this case, I think First of all, you solve the problem. What is diarrhea? And not according to, even you bring in this book, this is useless. You can just find something here and there. For example, this is because of yin deficiency in number two. However, as I mentioned before, number two is not correct because you are not using 四神冲, we are not using also 神门. I mean all those special points, right? Just yeah, you're right. You're using 内关 and those are 25 are spin only. So what I think is, I'm sorry for giving you all this example, but this is just for training you guys to face different situations, but not according to the book, right? The book itself concerned about many, even the symptom in this case is really complicated because it's composed of one, heat, second, damn heat, and of course you have an idea that this damage may be arise from the menstrual cycle, which related more with the liver. So this is why I say this is not a simple case. Of course, I don't think. Yeah, question.
The explanation is kind of iffy. The symptom is usually under the etiology of pathology. The symptom is usually caused by emotional factor and dysfunction of the cells.
Mm.
To depression. Liver depression achieves stagnation.
Yeah.
Due to transformation of fire, in this case heat.
Right.
Disturbing cardiac spirits and by invasion of liver into the spleen and
Mm.
stomach.
Yeah.
Diarrhea.
Yeah, you're right. Yeah.
It's all in this 4 pages of next page, but still, he's right. I want to know which one of these 3 pages.
Sure.
Like 4 or 5 things.
Sure, you're right. This I can't help, sorry, because this. No. Yeah, and usually I can tell you guys before, in many cases, the disease related to the menstrual cycle always related to the liver. So if this appear in your examination, you guys have to stick to the principle that liver is always the organ related to the menstrual cycle. This is why I always emphasize, right? So in this case, yeah. Sorry for that. Yeah, great, no problem. Okay. Yeah, I hope you guys can manage it. Okay. Yeah. Right. Excellent. Okay, sorry for that. Okay, so let's start in this afternoon and see what happened in the. Yeah, I got the answer sheet here. I will ask Alex to give you the the copy for that. Yeah, I got the answer. So just power them. Okay, thank you. Okay, let's go. Okay, the fifth chapter today we're talking about is called the morning sickness. What do you mean by morning sickness? Okay, for many cases, if a girl or a woman who suffer from the delayed menstrual cycle, that means the menstrual cycle should come, but it's delayed for over 10 days. And in this case, she also suffer from a kind of morning sickness. That means when she gets up in the morning, she feel a little bit dizziness, and also she always prefer eating the sour food, and also she always get vomiting, and then we can just confirm that whether she get pregnant or not. So this kind of morning sickness actually is a kind of referring to some nausea, vomiting, and also dizziness. Who suffer from early spirit of the pregnancy. And this kind of morning sickness, of course, is caused by the rebellious stomach chi. As I mentioned before, the liver is responsible for all kinds of women disease, including menstrual cycle and also the pregnancy. And in the initial stage of pregnancy, the liver will have a really, really hyperactivity action, in that it will affect the function of other organs nearby, especially stomach. And stomach is the first organ being attacked. In this case, the stomach chi usually goes down. But now, after affected by the liver chi, it goes up. It causes all kind of vomiting, also all kind of burping, and of course, all the food cannot go down, right? In accompany that, of course, you get a kind of restlessness, and also this is because of transformation of fire from liver depression. And usually, the women get pregnant always get the liver fire or liver yang hyperactivity. So that's why the liver will be very, very dominant at that time. It can just interact both the stomach and also the spleen So in causing what? In causing phlegm, in causing qi, the stagnation, and this. So it causes the problem in the other organs, such as stomach, or it flows over, right? Because of the phlegm. So in this case, the morning sickness defined as the cause is is caused by the liver, and because the liver affects the stomach qi, so making the stomach vomiting and also the nausea, and the dizziness is also because of the liver and also the gallbladder qi uprising. So this is the introduction for the morning sickness. So morning sickness, as I mentioned before, usually appear in the first 3 months of the early pregnancy, right? And of course, in this case, if you go to see a family doctor, he has nothing to do with this pregnant woman. Just tell him, okay, go home and just stay where you are. But for the Chinese medicine, we do have something to solve the problem. The using of the herb in Chinese medicine practitioner are more open than the Western medicine, because sometimes that in order to treat a pregnant woman, we need to tonify her more than sedation. Even you need to just like induce sweating, we need to sedation, we need to have some purging, but still we can use majority of the herbs in a prescription to tonify the pregnant woman, and leaving about 20% or even 15% of them in doing the normal work of purging or inducing sweating or stop coughing, so on and so forth. So I just said that the use of medicine in our case is more diversified than in Western medicine. Okay. So this is the first medicine we got. Second, okay, what's wrong? Okay, this is what we call it as I mentioned before, this is because of the liver affecting the stomach and also the spleen. Sometimes the spleen is so weak that we produce a phlegm. This is what we mentioned in this morning, that because the spleen is responsible for producing phlegm. This phlegm will accumulate in the lung, right? Okay. Here concerning about the differentiation syndrome, this kind of morning sickness usually will due to one, the weakness of spleen. The weakness of spleen. That means the spleen deficiency. The stomach deficiency. And second, it will be because of the liver heat. And third is because of the phlegm. And for the first and the third one, they mostly linked together. Because while we get a weak spleen, we also get a weak stomach, and also which in turn will produce more phlegm. So the phlegm stagnation will be one of the reasons, one of the sign and symptom for people getting the spleen deficiency. Okay, and in case people getting the stagnation, of course, or the liver heat, we are using the qi regulation herbs to descend the rebellious qi, right? So the treatment principle usually you regulate the lung qi, and also will harmonize the middle energizer or descending of the rebellious qi inside the body. So the method is just has a strengthening the stomach and also clear the liver heat and also resolving the phlegm. Those are the methods we are using to deal with that. Whether they combine according to the textbook, is that better that you combine the integrate in traditional Chinese medicine and Western medicine together? I say no. This is not my teaching. Okay, although we get a clinic here called the integrative Chinese medicine, but for me, I always insist that Chinese medicine and Western medicine, they're using different approach to treat a common disease. I'm not going to, integrate anything of that. Okay, and although we can do it one after the other, but we are not working together. No, we cannot mix Chinese medicine and Western medicine together. So this is not my belief. Okay, I just share with them guys. Okay, concerned about the differentiation syndrome, we first consider the first syndrome, which is called the stomach deficiency. The stomach deficiency, any morning sickness caused by stomach deficiency should be treated at the early stage of the pregnancy, and which appears to have some nausea, vomiting, and also regarded, you know, epigastric, the abdominal fullness and distension. Sometimes you're not going to eat, and sometimes you got always sleepy. Those pregnant women always feel sleepy because her kidney is getting what? It's getting, consumed. This is very difficult for a woman to bear a baby. One, because when the baby grow up, starting from fetus, when the baby expands, it will press on her urinary bladder and also the large intestine. So in the early pregnancy, all the pregnant women would like to go to pee, and really frequently, because the uterus presses on the urinary bladder, and sometimes you will go to poo more frequently because of the same effect. And later on, when it grows up, okay, above the urinary bladder and the rectus, and then this kind of urgent urination or urgent, the defecation will disappear. However, when the baby grow up, it will create a lot of weight in the mother, right? So the backbone of the mother will get a little bit, curved shape, and in order to bear the baby, it will make the mother have some kind of lower back pain, right? And also it will cause some problem to her. And then after when the baby was in her body, she had to make some nutrient to the baby, because everything she eats, she should divide them into two parts. One is for the baby, the other for the mother, right? And in order to produce the bone and also the teeth for the kid, the mother will lose one teeth, because what? The bone and teeth of the baby is deriving from the phosphate and calcium from the mother. So what is the source of the calcium and also the phosphate? Either the bone or the teeth, right? So this is very easy for the mother to lose one teeth after giving birth to the baby, because of the deficiency in the calcium and phosphate, right? So you see, this is very tough for the mother to be a baby. Of course, she always sleepy because of the kidney yang deficiency, and the kidney yang is in order to support the baby. And of course, when you see her tongue, pale tongue, white coat, and the pulse is slow and weak, right? If she got some stomach. Why? Because stomach is the place where qi and blood are stored and produced. So if lack of qi and blood, of course, her tongue will be white further. That means white coat. That means cold, and also the slow and weak pulse. That means this is also cold and deficiency. So how about the treatment principle? Whenever you guys see deficiency, please think of the word tonify. Okay? So either say tonification or spleen, or some people like the word strengthening. So strengthening the stomach and harmonize the middle energizer. Whenever you say middle energizer, we are talking about two organs, spleen and stomach. That means in a few words you can say tonify the spleen and also the stomach. So descending a reverse flow of qi to stop. However, when you say tonify the stomach, be careful. The stomach now is going up. If you tonify the stomach qi again, of course it will go up again, right? So what we are going to do is we should take some herb which have the power to lower the stomach qi, but tonify the spleen. How can you divide the spleen and stomach in two parts? One is the stomach, above stomach, below spleen, right? So there's one formula we also use. We got 6 gentlemen soup. 6 gentlemen soup, we got a 六进几号. This is a very famous. You know why? Because among the 6 type of herbs, 4 type of herbs are going to tonify the spleen, while 2 types of herbs are going to lower down the rebellious qi of the stomach, which is 陈皮 and 笨萨. These 2 herbs. So this is why I always prescribe this 六进几汤. That means 6 gentlemen soup to the pregnant woman who got the morning sickness. One, it will not, ruin the make any bad effect to the baby. Second, it will just lower the stomach qi and also tonify the spleen. So 六进几汤 or 陈萨六进汤 are very famous here, right? And those are the modification. And second, morning sickness besides caused by the deficiency of spleen, it is also caused by the liver heat. That means the stomach is no problem. It's normal. However, due to the existing of the liver, which is going to exacerbate, it's going to getting higher high hyperactivity, and this higher hyperactivity action of the liver will affect the stomach and make it vomiting and make the stomach chi, rebellious. So in this case, you can find out since it's caused by the liver, you can think about bitter taste in the mouth, and also the mouth not only bitter taste, but also got a sour. You know why sour? Because there's some fatty acid, right, coming out from the stomach, and since this is full of water, and then you can find the oppression and also fullness in the chest and hypochondria. Not only the chest always because of the phlegm, but if you got oppression and fullness both in the chest and hypochondriac region, that means this is caused by liver, understand? And also dry sighing, belching, all this because of what? Cheese stagnation, remember. And also sometimes a woman got a dizziness and also got the dry mouth and constipation. The urine is dark urine, then surely be heat. And this is very common for people getting the heat in the liver, especially when you take too much deep fried food, fried chickens, and also temporal others, and your urine will become dark brown or even reddish, right? The tongue is red with yellowish dry coat. This is surely because of excess heat. And then you get wiry, slippery, and rapid pulse. This is surely because of liver heat. So all these situations so that you get liver heat. Okay, when we were young, I always get liver heat. How can you know liver heat? One, you get the red eyes. Two, you get nose bleeding. Three, you get sore throat. All this is because what? Overeating of deep frying food, which cause liver fire, right? So in liver fire, you can see all this will now displayed in the woman who suffer from morning sickness because of liver heat and liver fire in her body, right? So, yeah, questions. Okay. Liver heat. This is liver heat. No, we can. For liver fire, it will disturb the sleeping. When liver heat is only you got bitter taste in the mouth. You remember, both liver heat and liver fire, you get bitter taste in the mouth. Okay, and also you get the hypochondriac region here. Okay, and why you get sighing? Sighing is not because of liver heat, because of liver chi stagnation. Initially, it's caused by liver chi, but this liver chi is caused by pregnancy. Whenever a woman getting pregnancy, always affects the liver. Either you make it the liver chi stagnation or liver heat. Remember, okay? The guys who seldom get the liver chi stagnation, except you get the some of the emotional disturbance, right? In this case, it's not emotional disturbance. Okay, for liver heat, how can we solve the problem? Remember, every time you see heat, please remember well, clear. Okay, so clearing heat is the most important. Whenever you get vomiting, okay, either you stop vomiting or you harmonize the stomach, okay, in order to stop the vomiting. How can you stop the vomiting? Of course, you can just descend the rebellious chi. Okay, I try to put it step by step. Okay, in case you get the liver heat, please clear the liver heat. Whenever you hear vomiting, we try to descend or lower the rebellious stomach chi so that the stomach will not have more vomiting, right? So this is whether you like to write down the word harmonizing stomach is not necessary. But for me, I will just accept curing liver heat and descending the rebellious chi. Okay, and rebellious stomach chi is okay for me. Okay, this is the formula of the Wen Dan Tang, and here is another modification for that. Okay, besides the weakness in the stomach and also the liver heat, we're trying to figure out that there's a third reason for getting the morning sickness, which is the phlegm stagnation. How come we get phlegm? as you guys learn during this course, that phlegm is always because of spleen, right? So in this case, if you find the woman getting sickness with much more phlegm, the phlegm is always vomiting or even from the throat, coming up from down below, and lots of phlegm expectorate out. This is one of the phlegm damage. The other is the chest. The chest get congestion chest, and also diaphragm. This is also because of dampness, and this dampness is because of phlegm. The third, this woman does not like to eat because what? Not because it's to get full, because the phlegm always, get congestion in the chest, which will obstruct the flow and chi and blood in the chest. So she's not thinking of any no sense of hunger. He will not eat. And the most important thing is he got the tasteless in the mouth, the bland and greasy tasteness. I always ask my student, in the morning when you get up, what is the taste of your mouth? And then they got the taste of mouth, always get one tastiness, there's a bland taste. Second is a bitter taste, and then or they get sweet taste, or they get a sour taste. All of them have different indication, right? For those people who suffer from liver heat, whenever they get up, they find the bitter taste in the mouth. Whenever they get the sour taste, that means because of acid reflux. They get acid reflux, and then they got the mouth taste full of the sour taste, right? And tastiness, of course, it is good, but tastiness with some sputum or with some saliva flowing up the mouth, that is the spleen deficiency, right? And of course, however, some people getting up in the morning find the mouth taste, sweet taste, just like eating some candy. This is no good. This is because of dampness. Okay, so dampness, or even you get liver heat, or even sometimes you get acid reflux, or sometimes you even get the spleen deficiency. All of them can be found in this four types of taste. Whenever in the morning when you get up and then you get this taste, you should find it, right? And also, how to treat those people who get the phlegm dampness, or you get the phlegm, stagnation in the body? Of course, the only solution is to remove the phlegm. How can we remove the phlegm? We call them to be resolving the phlegm. We saw Chinese people just say this is resolving, is dividing into different components and then disappear. This is called resolve, right? How can we resolve the phlegm? Actually, the only thing is we increase the function, improve the function of the spleen. This is the most important thing, right? And the other is to resolve the phlegm by the herb itself. So first of all, phlegm is made up of dampness. So when you remove the dampness, of course the phlegm will resolve. Okay. The other, when you're coughing, you get a lot of phlegm, right? So after you dissolve the phlegm, there's no more coughing in the body. Okay. So we are going to use a formula called 小半夏汤 and plus some Fuling, and this is very typical formula for removing the enormous phlegm or copious phlegm inside the body, because Bansa is a kind of herb to deal with phlegm, and also is going to descend the rebellious chi inside the body. And as I mentioned before, how can we resolve the phlegm? We can remove the dampness. How can we remove the dampness? Of course, we go through the channel of the spleen. So what we're going to do is trying to make the spleen as clear as possible. Don't accumulate any garbage there. So the thing is, you use more herbs for elimination, just like sanja, maya, guya, all those things. When you eat it, you can just remove all the food stagnation. And after removing the food stagnation, your spleen will become clear, and then of course no more phlegm will be produced, right? And okay, let's come to the acupuncture point. For people suffer from this kind of morning sickness, we are trying to look for 3 main points. One is ST36, second is PC6, and third is CV12. Okay, let's look at them one by one. Okay, one, Why you get ST36? Everybody knows it. You want to tonify the spleen and also stomach, removing the dampness, also tonify the qi, right? So this is universal for the tonification. Second, why do we find PC6? I mentioned, yeah, vomiting. Anything concerned about the chest pain, vomiting, classic, right? All the heart problem, you still find this one. This is the PC6 here. And why do we find Zhongwan, CV2, CV12? This is because of the local punch. When you get morning sickness, of course, the first sign is vomiting. So when you put a needle in the Zhongwan here, of course, it will relieve some of the pressure in the stomach, right? Okay, concerned about supplementary point. If those people getting a deficiency in stomach, you have to deal with the stomach point. And this Zhongwan get 2 points, 1 point up, 1 inch upward. We call it the Xiangwan. Xiangwan means the point above the Zhongwan, right? And then down you get 2 more chin, you get a Shawan. So Shawan means lower, Zhongwan means middle, Xiangwan means upper. So the CV13 is Xiangwan. That means upper stomach. And CV12 is Zhongwan. That means the middle of the stomach. And then Shawan, CV10 is Shawan. That means the lower portion of the stomach. So you can deal all these 3 points. Of course, we can just deal with the problem of all parts of the stomach. Okay, so those 3 points are important. And what are you going to use? Since this is a disease caused by excess, right? So we are going to tonify. So this is a problem of disease, deficiency. So we are trying to reduce the excess. That means we are going to reinforce the spleen while we reduce the stomach in this case. If we get any phlegm, what can we do? I'm so sorry, the English part doesn't mention about that. The Chinese part also say that. Okay, the Chinese part also say this one, right? But here, until here, it means that if you get the liver hitch, please add the LR3. And if you get phlegm, please add ST40. This is ST40. This is LR3, but it doesn't mention the 4 points here, right? And ST36 Naiguan Zhongwan, yeah. And if in place you can get this one. And this is actually the point referring to that. That means if any people getting the upper hitch, the liver hitch, of course you can get LR. If anybody get a deficiency of the spleen and producing the phlegm stagnation, you consider ST40 and SP4. And of course, in order to prevent the vomiting, you can add some ST36 and ST40 as the main point, and also the SCV12 and PC6 and GB34 to prevent the vomiting. It doesn't mention this above, right? Okay. Exactly. Yeah, you're right. Universal. Yeah, never think about other things. Yeah, you're right. So when you're going facing the examination questions, anytime you get dampness, just remember SP6, SP9, ST36. Those must be applied. You're right. So this is my pleasure. After giving you lots of this kind of reading, repeat again. And lastly, I want everybody just get the same idea that whenever you get dampness, you just remember those points. Right? Hitch, of course, to this point, and organs. I think this is what I expect you guys to do, right? This is why I always murmuring all the time, because I want you to remember. Okay, so this is number 5. We call it the morning sickness. Just give you guys 1 minute to ask any question you want to ask concerning this morning sickness.
So in terms of points, there isn't is minimal points better than doing many points?
Exactly. This is for those people who are the first time to receive acupuncture, of course, we use as little point as possible. And of course, for those people who suffer from long-term disease and it's really more complicated symptom, of course, you can use more points. But usually, for me, if you're attending examination, please remember one thing. You use more point on your forelimbs, less point in your trunk. That means in the front and the back, use as little point as you like. But you know the forelimbs you can use more. This is what we suggest. Okay? Even the final examination do. Yeah. Mm. Yeah. Yes. There are many schools of thought. Sure. Sure. Your wife is pregnant. You can see your wife. Okay, share a story with you, right? When I was teaching the diagnosis with my student, I always advise that take more chance to get the pulse as much possible. You know, of course in the class you can get from your classmate, but you know at home you can get from your family. I share my experience with them, right? Every time to know about 40 years ago when we are, receiving the education at TCM in some private institute. You know, this is very doubt, and you know the method is very very simple. Just the teacher just take up the notes and then read it for 1 hour and then it's just left. No answer, no question, nothing, right? But when I was teaching, of course, I give them more teaching aids. And I told my student that anytime you get more practice in yourself, you know how do I learn that those people getting floating pulse? And when I know somebody is getting exterior syndrome, I just feel his pulse and then know what's that, right? This is simple. However, how do I know that when my teacher told me that whenever people get a sleepy pulse, that is the pregnancy. I have no idea until my wife get pregnant. Yeah, this is the situation. I think I went home and just feel my wife's pulse, and this is the first time I felt what is the pregnant pulse. Okay, although in the book it mentioned that sleepy pulse means what? Means stagnation. Stagnation, you get all kinds of stagnation, right? However, the last sentence you mentioned that women getting pregnancy, they also get the slippery pulse. So when you get the slippery pulse, you have to eliminate all the possibility of getting edema, foot stagnation, or other blood stagnation, other things. And in addition, that she had to tell you that she got the menstrual cycle later more than 10 days. So this is very wonderful and amazing for the Chinese medicine practitioner. So you can just tell that whether the woman get pregnant or not. One ask the woman whether she got her period past over 10 days. And then you feel the pulse. When you find the pulse above the sub pulse, you get what we call the sleep period pulse. And then you eliminate all the possibility of other stagnation and also accumulation. And then the other thing is to watch her face. Her face will just have the color of some kind of yellow color, which like the in Chinese people tell you washing. Because Chinese people like to eat rice, right? When you eat rice, you have to wash the rice. We wash the rice, of course, the water is yellow in color. Those yellow color is equivalent to the face color of a pregnant woman. And then I ask the woman in the morning, well, do you feel some dizziness? And of course, ask her whether when she was in the bathroom, check whether her breast, the breast is whether there's distension or not, and also the nipple, whether the nipple turning the color to a dark red or not. All those will tell you all the symptoms. So after we, collect all the symptoms, and then the last conclusion is yes, you get pregnant. And then at that time we try to ask her when is her last, the period. And then we try to calculate by 9 plus 7. That means 9 months and then 7 days. And later we can foretell her which is the delivery day for her baby. This is what I did. So conclusively, I can tell you right. For me, I have many experience to confirm that even the woman, she didn't carry on any pregnancy test, any 4 tests before. I can foretell that she's getting whether she's getting pregnant or not. And I remember one case that the patient coming to my clinic asking me whether I can confirm the pregnancy or not. I say yes, But after that, she went to her family doctor. The family doctor said no. So she was really wonderful. How come the Chinese medicine practitioner said that she said yes, but the family doctor say no? Why is that? And last, you know what is the problem? The problem is she actually get pregnant, but the baby get on disappear. That means it form at a moment, but later on the baby disappear. That means this is a kind of no miscarriage, but it doesn't form. It doesn't in the very initial stage. They say this is a kind of very ghost, the shadow, but later on. So this is also my experience. So I really have much time there. So just answer your question that yes, we can use the pulse to confirm that whether a woman get the
delivery heat,
mm,
slippery balls,
mm.
phlegm stagnation, also the slippery balls.
Yeah, that's why.
But in the stomach,
Yeah.
deficiency does not have slippery balls.
How come you get sleepy pulse means what? Means stagnation. Stagnation. When you get stomach heat, it doesn't mean that you get any stagnation inside your body. Just heat. Heat is heat, right? But when you say phlegm, digested food, undigested food, water, or other stagnated blood, stagnated qi, maybe you get slippery. Others may not, right? Heat stagnation is not a kind of because you've got qi stagnation, blood stagnation, phlegm stagnation, and fire stagnation, and we also got the what kind? Qi, blood, phlegm, fire. We also got the two other food stagnation, food, right? And the other kind of stagnation you also get it, dampness. So there's no heat there except fire. So if you get summer fire, maybe you get the slippery. But it's not that clear, right? Right. So are there any questions? No, the sixth one we are talking about this. We call it the menopausal syndrome, or what we call it the perimenopausal syndrome. This is very typical. You know why? Women are about 49 years old will get this kind of what we call the menstruation cycle, or this kind of menopause, right? Menopause is very, very significant in women. You know why? Because during the time of menopause, many diseases can happen. Usually, women get what? If you get menopause, you get the malnutrition, or sometimes they get all kind of dizziness. Sometimes they get night sweating. Sometimes they get the dry throat. And at this time, of course, you get lots of problems because of different situation, right? And this is because what? Abnormal secretion of the female hormone. The estrogen and also progesterone start to secrete abnormally. Usually, these two hormones will, secrete at different time in order to make up the level of the blood level inside the uterus, or in order to, peel off all the blood from the uterus, right? But if abnormal secretion of these two, it makes the body some kind of feeling of heat and cold. Sometimes you feel fresh in the face. Sometimes you feel really palpitation. Sometimes you feel really anxious and you feel really nervous. All those are because of the abnormal secretion of all these kind of female hormone. Remember, okay? However, I can tell you guys, 48 years old is not the exact date. Many women, they have an early menopause, about 42 or 43. Some of women, they even at the age of 55 or 55, they still get the menstruation cycle, right? So I can tell you guys, 49 is just the mid number of that. What do you mean by mid number? That means among the 10 women, and then we take the average. The average will be about 48. So 48 years. How come the Chinese people say 49? Because Chinese people always add one more. You know why? Yeah. Whenever they were born, they get 1 year old. And then next year, New Year, they get 2. So Chinese people always have the age at New Year because they believe New Year is a year. So if you were born in December the 30th, the 31st, you're lucky because today you're 1 year old. Tomorrow you're 2 years old, right? And this is so Chinese people always count this number. So usually the number will be more than normal. So therefore, according to Chinese medicine classics, menopause should be at 49, but actually the actual year should be 48. Remember, 48 in this case, right? Okay, we talk about the this kind of menopause. Menopause is a stage about in 48 years old, and then they can this time they suffer from lots of problems. These problems, of course, will include what? About one third of the women they will get this kind of menopausal complex, and so one third of them they get nothing wrong with that. About two thirds of them they got a serious problem, due to the deficiency of the female hormone. Okay, and those will usually occur about 45 to 55. Usually 45 is sometime before 48, while 55 sometimes more than that, right? This is a number I'm not concerned about. And remember, some women they get this kind of menopausal complex just having 1 or 2 years. They're lucky. Some women do not have. Some women can have this for 10 years, over 10 years, right? So this depends on the constitution of a woman. Sometimes because of hereditary problem, hereditary issue, because this inherited from her mother. Her mother will get this, or the daughter will get the same pattern, maybe. So this is caused by what? Sometimes the hormones, sometimes inherited. And usually at this stage, the woman will get lots of changes in the body. One, the hormonal secretion will be decreased, and which bring what? Bring the menstruation cycle. The menstruation cycle previously should be every 28 days, right? But some women will get more and more separate from each other. This is 1 month, next time is 2 months, next time is 6 months. And then after 1 year, and of course if you go to find the family doctor will check your hormone inside your blood and tell you that, okay, sorry, you are menopause because your blood cannot find any hormone now, right? This is one of the confirmation. The other, of course, the woman himself will not have any period any longer. So there are two situations. One situation is some women undergo a very serious bleeding for one time. After that, stop. Some women will just get their menstruation cycle very separate from each other. 1 month, 3 months, 6 months, one year. That's it. Okay, and those depends on the constitution and also the body condition of each people, right? Do you know? How about men? Do men have a menopause? Many people don't believe that. I can tell you so. With the andropause, andropause is will exist. I don't know your experience, but many people told me that our andropause, we experience andropause in every situation. Sometimes it will happen in 50 years old, sometimes 60, 65, and every time we get a little bit change of that. So whenever you feel tired, you don't have energy, and then you feel your body weak. And this is actually kind of andropause for us. So we'll experience several times of andropause, but we will not, unlike women. Women just a sharp age and 48, but we will have a different time. So of course it is different according to different individual, right? So this is also a kind of study by biology, right? So this is let's look at the etiology of this kind of menopause, right? This menopausal complex usually caused by what? The kidney qi. I always tell my students that kidney is a very important organ. Kidney is an organ first responding to aging. So in order to stop aging, you should tonify your kidney. Okay, taking more kidney and also tonifiers, and then you can get, right? So deficiency of the flush vessel and also the conception vessel, and of course this will bring about the menopause. And menopause, of course, again caused by kidney yang deficiency, which cannot provide nutrients to the meridians and vessels, or sometimes by blood deficiency, or sometimes by excessive sexual life. This is why some women they will get the menopause with many diseases, because in China, old China, many women like to give birth to over 10 students. If you more people, more kids you get, of course, the more kidney yang will be consumed. So after that time, of course, this woman will really weak, at the menopause time. So those are very important for us to know that don't give birth to many baby, right? Otherwise, and also some people say that after giving birth to the baby, this is time for tonify. If you are not tonify yourself, you also will get weak, right? So there are several reasons. One is because the body always suffer from kidney yin deficiency, and the other is because excessive sexual life and excessive uh, giving birth to the baby. This is also a problem. Okay, and also for long-term disease, kidney yin deficiency, and the body will lose his yin, and leading to yin deficiency transforming to yang hyperactivity. Of course, if the woman lack of kidney yin, of course, it cannot nourish the heart and liver. In this case, kidney yin will lead to heart and liver fire. As I mentioned before, kidney is the one who suffer from kidney yin, but the problem will lead to the fire in the heart and liver. Okay, and some people get a weak constitution. Suddenly, he will get sick because of taking too much cold nature food. And remember, cold nature food or cold food will damage our kidney yang. Therefore, this is also cause for the menopausal complex because of the kidney yang deficiency. In the Chinese medicine classics, doesn't have the name of menopausal complex, but it has other name. Just as what we call it, the aging, the stoppage of the menopause. No, the menopause and aging, and sometimes we call this one to be dryness disease. Dryness disease. Some people call it Lily disease. Lily disease actually means this is because a kind of perimenopausal complex, and all those before and after we can go into this disease, right? So this slide suddenly, actually tells you guys what are the causes of the menopausal complex, and sometimes we link with all kind of problems, just like the kidney, the spleen, and also the liver. Of course, kidney is the most important one, right? Okay, how can you diagnose? Okay, the diagnosis is important because women at this time remember all the disease. When the flush cheek here, which always happens in the afternoon. Okay, sometimes you get heat on both sides. And fever, color fever, this only limited low-grade fever. Sweating, profuse sweating is also another problem, another common problem for the women suffer from menopause. Aversion to cold after sweating. This is very interesting. If you get the sweating, of course you get cooling, right? That means in the hot summer, when you exercise yourself, because the body is so hot, and then a body will automatically sweat in order to cool down your body. This is normal. However, for those women at the menopausal stage, you will suddenly get sweating. No matter if it's heat or not heat. For example, in this room, he suddenly gets sweating. And of course, this is because of yang, the service qi deficiency. And after sweating, what happened? She feel cold. She feel cold, right? This is the same situation that because of the abnormal secretion of the hormone, right? And also sometimes you feel palpitation, and chest oppression, and of course this is because of the blood deficiency, and of course again dizziness and tinnitus, headache, and also the insomnia, or just a pain in the wrist, that means in the lower back. All these symptoms we can explain either because of the kidney yang deficiency or the liver problem, the liver qi. Therefore, liver qi and the kidney yang are the main causes of this kind of the menopausal disease. Of course, these women are easily irritable, sometimes easily get angry and anxiety. Therefore, many women about age 48 usually get depressed or usually get any emotional disease, just like the neurosis or the dyspnea. Okay, and some women they will got the especially for those women undergo the conceptive operation. If they remove the ovary, remove the uterus, of course at this time they will easily suffer from this kind of the menopausal disease. Therefore, for those people who women who do not have those uterus and ovary, and they will get the similar symptom, just like people getting the menopause, right? So those here you also concerned about the name of those hormones. As I mentioned before, FSH means follicle stimulating hormone. LH is a luteinizing hormone, and those the hormone when a woman is needed for her menstruation cycle and for her body, right? So in this case, if we are considering about the diagnosis, and then we had to consider sometimes other disease, just like the angina pectoris and also the hypertension. Sometimes we'll mix up with this kind of menopausal compass with other disease. Sometimes people suffer from benign and also malignant tumor in the external reproductive organ. We also have this kind of problem, just like the sweating and also diaphoria, and also those are the same, right? So this we just in this situation, I just want to inform you guys the causes and also the analysis of the menopause stage in the woman. Okay. Okay. How about the symptoms? And the symptom is not can be divided different type of differentiation symptom. And in this situation, in this the common disease, you should remember that more deficiency than excess symptom. I mean for the menopausal. Usually because of the kidney deficiency and because of the liver fire, I think this is very short term and not really common, right? Even this is the excess symptom. It will also mix up with both deficiency and excess symptom together, okay? And the organ involved, of course, including the heart, liver, spleen, and also the kidney, and of course, this will be concerned about either the kidney yin deficiency, kidney yang deficiency, or heart and spleen deficiency. I think those are the important organs. Most of the time for the excess type should be the liver stagnation. I think it's most common type for the excess type. Okay, let's look at each type one by one, and I want you guys to pay attention to the treatment principle. Okay, whenever we have those symptoms, just bear in mind how do we treat this kind of symptom. Okay, be ready for that. Okay, first time we call it the liver kidney yin deficiency, liver and kidney yin deficiency. And in this symptom, of course, everybody knows that you have learned about yin deficiency, and yin deficiency usually cover the kidney yin. So if you have both liver yin and kidney yin deficiency, the symptom will be more obvious and more prominent in this case. So in this case, you find the women suffer from this kind of menopausal disease will have the tinnitus, have the dizziness, and their face may sometimes get flash cheek, and again light sweating, sweating, and we get the 5-pound heat. Now you can see all these symptoms belong to yin deficiency, right? And also they easily get insomnia, and even they can sleep, even she can sleep, but the sleeping quality is very poor. Either you get dream disturbed sleeping, or she cannot fall asleep, difficulty in fall sleeping. This is because of the yin deficiency generating fire. And on the other hand, she also will find some soreness in the lower part of the body. This is because of the kidney, right? And the skin is so dry, like this season. I know when I was in Hong Kong, I never applied any Vaseline in my hand. But now, after I get up, I'm living in a condo, okay? I'm not living in a house. But even I get up, I find all the fingers really dry here, and to apply the Vaseline here. This is the same case in women. Although in the summertime, if she suffer from any kind of yin deficiency, her skin always crack, screen crack, right? Even in high humidity. and sometimes the get constipation, and the urine is dark and also yellow. Sometimes even uh, she have the menstruation cycle, the menses always get scanty. One, because it's going to menopause. Second, because she get yin deficiency. Yin deficiency means blood deficiency, fluid deficiency, gene deficiency, right? So it will lead to scanty menses. This is reasonable, right? And also, she will get the uh, sometimes if this problem more severe, we will find bleeding between two periods, and the bleeding between two periods is very severe. Sometimes it got more, we call those flood. If just by droplet, we call those to be leaking. So flooding and leaking is the name of the disease in women. They get bleeding between two periods, right? And in this common symptom, if the woman suffer from the kidney yin and liver yin division, sometimes they will find bleeding in the middle between two periods, and this is also because of what we call the menopausal complex, right? And the pulse, of course, is fine and rapid, while is red tongue with a little cold, right? Okay, now again, guys, your homework, your assignment. One, if you see liver and kidney yin division, how can you deal with that? First word is nourishing. You're right, nourishing. So nourishing yin, right? Nourishing yin. And then this time you check whether you can get the fire. If you get the fire, of course, you suppress the fire, suppress the yang. If no fire, just yin deficiency is nourish yin, right? So nourish the liver and kidney yin. This is what you need to write on it. Okay. So how can you deal with that? Of course, for the pawns, everybody knows, right? This is the SP6, SP9, all those, and KI3. You need to tonify the both kidney yin and also although SP6 and SP9 doesn't belong to kidney and also liver, but still you can use them for regulating the water, right? And then you go to the organ. Kidney yin, of course, KI3 and also BL23. Okay, liver yin, of course, you either go to the LR5 or LR, the H. But usually people like to find the best supon. The best supon always also upon to tonify your kidney yin, which is BL18, 18, Gansu. Okay, I think those are the points for that. Okay, and then now for those people who are not major in Chinese medicine, you need not remember that. But if you know Chinese, it's very, very important for us to know. Anytime you let a kidney yin, we are using a formula called 左归丸. 左 means left, right? Tonify your yin. And then you leave a yang, you're going to use 右归丸. 右 means right. That means tonify the right kidney. So this is easy. So in this case, if the situation is liver and kidney yin deficiency, so we are going to use a formula called 左归丸. 左归丸. That means tonify the left kidney, which govern the water, govern the body fluid. Understand? And of course, another situation is on the opposite, kidney yang deficiency. We try to compare. Okay, if you have time, we try to compare the symptom in kidney yin and kidney yang deficiency. Kidney yin, of course, you can see all the night sweating, 5-pound heat, and then you get dryness in there, right? How about the kidney yang? If you let a kidney yang, what happens? Since kidney is fire. If you get kidney yang, of course, what you think is cold. How about the kidney? Concerned about kidney, both kidney yin and kidney yang deficiency will make your lower limb lassitude. Will make your knee forceless, and then you will be really tired, right? Okay, let's look. Let's see. For kidney yang deficiency, since kidney yang is going to dry the water away, what you see is in severe state you can get edema. So edema in the lower limb is very common for those people who got the kidney yang deficiency, right? And the other thing is severe cold. So whenever you see people suffer from lower limb edema, which edema is pitted, that means you press it, it will never go up in 1 or 2 minutes. This is pitted edema, and also you can find this woman get cold limbs, and also aversion of this intolerance to cold, and also the limbs cold, and also she's not allowed to eat too much and to get the abdominal, abdominal distension. Watery stool, much more urine. I mean the profuse urine, and irregular in the menstrual. Yeah, before the menopause, many women have this kind of symptom that she got irregular in menstrual cycle. Sometimes close, sometimes far away, sometimes it's delayed, sometimes it got the advanced, right? This is also because of kidney yang deficiency. Kidney is also responsible for menstrual cycle, and of course, you get the leukorrhea. Leukorrhea is much profuse and with watery. Remember when we studied last chapter about leukorrhea, when you get the watery and also profuse leukorrhea, that means the kidney or the spin yang deficiency, right? How to confirm the spin yang or kidney yang? Of course, you see whether they got the lower part of the body get latitude or not. The other, you look at the tongue. The tongue is pale with a flat, pale tongue and flat, or also plump. Plump, that means swollen tongue, the pale and swollen tongue. And also we got the fingerprint, the teeth mark on that. That means the tongue is too thick to be, accommodate in the jaw. So the tongue coat will be white, thin white, while the pulse is deep and also fatty. Okay, all this will mean that this is because of kidney yang deficiency. So kidney yang deficiency, in conclusion, is cold. You should feel cold, right? And the other hand, you feel, sometimes severe cases edema, and of course, always you find is dampness inside the body, just like the tongue. You always see the pale and also swollen tongue here. Okay, how can we treat that? It's your sign, right? If you got the kidney yang deficiency, the word you write is warm or tonify. Okay, either you warm your kidney or you tonify your kidney yang, right? This is enough. And whether you need to strengthen the spleen and assist transportation, this is another story. But for me, the first one I want to see is whenever you get kidney yang deficiency, you just warm your kidney yang. But in English, you just write down yang deficiency symptom, right? But in Chinese, you write kidney yang deficiency. Those they do not agree with each other. But anyhow, I advise you guys that if you see yang deficiency, please write down both kidney and also spleen yang. Okay, you warm the kidney yang and strengthen the spleen yang. But if it write down just kidney yang deficiency, and then you just tonify the kidney. Okay, those are easy. Okay, again, formula. Previously, we used the 左归丸, that means tonify the kidney yin, right? Now, we try to use 右归丸. 右 means right. So we use 右归 to tonify the kidney yang in order to warm up the kidney, right? And with other herbs. And of course, besides 右归, we add some more things just like very important. Later on, when we study about infertility in the woman or the importance of men, of course, you get the two herbs. One is called 线毛, or this is 线毛, okay? And also you got also 阴阳火. This one is 线毛, this is 阴阳火. All those are important 阴阳火, right? This is 线毛. And those two are used to strengthen the the sexual activity of us, for those people who get libido. I will just prescribe those two herbs for him. Okay, when he send out, there's a yin yang火. And of course, this is aimed to warm up the kidney yang. However, this is also used for people to raise up their sexual desire. Okay. Number 3 is liver depression or liver cheese stagnation. And women at the menopause stage always suffer from cheese stagnation because they will easily get irritated, easily get depressed, and then sometimes they will sigh, they will get pain. All those are the symptoms, right? And suddenly they get profuse sweating. Nobody knows. Okay, not although the weather is not heat, but they not so hot, but they even get this. So this can be explained by having much more sighing. The two size of the hypochondrial region gets distension, and also you get easily irritated. And of course, as I mentioned in other cases, you got irregularity in the menstruation cycle just before the menopause, right? How do you know that this woman suffer from the liver depression in the menopause disease? This is, you must look or take her pulse. Her pulse to be wiry pulse, and also the this is one of them. And the tongue is red. The tongue is red. Remember, if the red tongue always means what? Red tongue always means heat, right? But this red is on both sides, not the whole tongue. So I would like to say the red tongue margin, and then with a cold and thin white coat. This is sometimes with yellow, depending on it's more close to heat or more close to cold, right? So this is the symptoms for those women who suffer from menopausal, complex because of the liver qi stagnation. Okay, how can we treat with that? Anytime we get liver qi stagnation, how will you do that? We try to, this time, no warming, not nourishing, not tonify, okay? So the reason is we try to move something, activate something. This is our main task. We move the qi, activate blood. Yeah, I say again, move the qi, activate the blood, right? Whether you're going to soothe the liver is not my business. Okay, I'll just try to find the word, whether you can regulate the qi or whether you can activate the blood, right? And of course, you notice the yin is also important, but in that case, you can soothe the liver and to release the depression. Okay, don't follow the textbook. Textbook mentioned that soothing the liver to relieve the depression. This is just part of the answer, and this is not complete. What I want you to write down is to move the blood, to move the qi, activate the blood, or you regulate the qi and to nourish the yin. The later part will be more relevant to the answer, right? So which formula we're going to use? Xiao Yao Shan. Xiao Yao Shan, this is the third time I mentioned today. It's a very good herb for tonifying the liver blood and also to regulate the menstruation cycle. And here, since it is near to the end of the menstruation cycle to the menopause, so I think that this Xiao Yao Shan is also workable in this way, right? And number 4, we call it heart and spleen deficiency. Heart and spleen deficiency. You guys made this word before when we mentioned about insomnia, depression, palpitation, right? Even some other disease, we always have this source, spleen and heart deficiency. This concerns 2 organs. One, spleen qi. Second, heart blood. With both spleen qi and heart blood deficiency, of course, what will be the problem? One, you got sweating, right? Because what? Qi deficiency will lead to sweating in the daytime. And palpitation, because what? Blood deficiency. Why do you get shortness of breath? Lung qi deficiency. Okay? And then you get forgetfulness. You got amnesia, forgetfulness. Forgetfulness is usually concerned with 2 organs. One is heart, the other is the kidney. When you are young, so Chinese people like to say, okay, recite all this paper. They don't know it's recite. We learn it by heart. Actually, if you learn everything by heart, you can remember. You learn it by brain, it's no use. Okay, just as we mentioned about it. Whether you believe anything, you believe it in the heart, believe it in the brain is different, right? So in this case, remember forgetfulness. That means amnesia. It's because of heart and keep both the function of the heart and kidney, right? So if both organ just getting disorder, of course you cannot remember anything for long. Okay, and for those people who suffer from Alzheimer, actually there are 2 organs getting disorder, right? One is kidney, the other is heart. Insomnia, because of blood deficiency, and shallow compassion, spleen problem, and facial dropsy. Dropsical face, that means a face full of water. That means edema in the face. This is because of the spleen deficiency, lacetal qi deficiency, epigastric and abdominal distension. This is 100% because spin chi deficiency. Right? If you got spin chi deficiency, you will got epigastric and abdominal distension. Okay, anorexia. You don't want to eat. In addition to the loose stool, of course, this is the spin deficiency. How about disturbance of menstrual cycle? You gather all the signs and symptoms above, and then you lead to the one thing: disturbance of the menstrual cycle, right? Because disturbance of menstruation are all caused because of what? Qi blood. Suddenly profuse vaginal bleeding. That means, as I mentioned before, many women before the menopause, they will have one time suddenly lots of the the menses there, and then stop. Then this is also we can just explain this kind of sudden profuse of the sudden profuse vaginal bleeding or deepening profound bleeding. With this is also because the qi and blood obstruction inside the body. The light color and thin texture. This is why any people getting qi deficiency will have the thin and light, menses, because you don't have enough qi to put the blood. You can have the blood, the total warm blood is just less than normal. How can you have a light color? How can you have a bright color blood there, right? The tongue, of course, will reflect the blood. If the blood is pale red, of course the tongue will be pale red. If the tongue is pale, the blood is pale too, right? So the tongue and the blood, they close together in the color, remember. Okay, the coat, of course, is white coat, fatty and weak pulse, as you learned before. For those people who suffer from, both qi and blood deficiency, always get a pale tongue. I don't think it's a white tongue. Red tongue, I don't say right tongue. The tongue will be pale. The pulse usually is thready and weak. Thready means what? Deficiency. Weak means weak constitution. So in this case, we mean 2, right? Okay, if you guys have this kind of patients with the heart blood deficiency and spin chi deficiency, what are you going to do with him? What are you going to do with her? Of course, deficiency, tonify. Tonify. Any kind of deficiency, we use the word tonify. Okay? Tonify. Although the technical word is strengthening, I advise you guys to use tonify. 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 Tonifying the spin or tonifying the spin chi, and then we nourishing the heart blood. If you find this guy get irritability and also disturbed dreams, disturbed sleeping, please add one more: tranquilizing the heart. Tranquilizing the heart. In Chinese medicine, we do have a lot of herb to tranquilize the heart. One is we got the zhenjimu. Zhenjimu is what? It's usually the pearl. You find the pearl and then chop it into pieces and then take it. Very useful. One, calming your son. The other, zhenjimu, is very, very precious. And then, of course, you must get the pure, good quality. Either, from the fresh water. Sometimes when I went to Taiwan, sometimes when I went to Japan, I would just buy those pearls and then put it in the pieces. It's very useful. Sometimes for tranquilizing the mind. And when people get the allergic in the skin, allergy, and then we can just apply them to the skin. When the people get dislocation in their ankles, or when they get the fracture, we usually use some Chinese herb to put it on there and then keep them for about 8 hours before they get bathing and take them off. But some people cannot stand for those herbs, and then they will get small red dots and red rashes over the skin. Okay, how can we solve the problem? We try to use those zhenjimu. That means those powder from the pearl, and then to push there, and then we will release some of the allergy in the skin, and also an ability to calm our shen. So tranquilizing mind is good. So what formula we're going to use? Again, Gui Pi Tong. Gui Pi Tong is also used for both tonifying qi and blood, which you can find both in the insomnia, the depression, and also the palpitation. Okay, so this is what we call. Okay, and this is the only 6 one we got it menopausal the compass, right? So I think this finished. And before we end this one, we got we just finished the menopausal compass. But how about the menopausal symptoms? That means exactly the same as it was menopause because it happened before, just before the menopause. And this kind of menopausal premenopausal compass, I think it is more or less the same as menopausal compass. And however, this happened before. So in Chinese medicine, we regard this one is because of insufficient blood and because of the insufficient of the secretion of the hormone, right? And Chinese people call those hormones the ten kui. Ten kui in Chinese medicine classic represents the hormone, right? Controlling the ovary, controlling the thyroid, the thyroid secretion, is controlling about the renal, I mean the toxin, I mean the hormone from the renal, adrenaline. So the tin quay can mean many things in the Western medicine. Okay, so according to the menopausal symptom, we talk about we are going to share about several cases, right? Several symptoms. One is because of the liver and kidney yin deficiency, and then second, concern about the spleen and kidney yang deficiency. That means kidney and also liver yin deficiency. It causes a kind of disease just as the fluster, compression, night sweating, and also the the pain in the lower part of the body, and those are the result of the irregularity of menstruation cycle, right? So in this case, we get profuse or scanty menorrhea. We don't know. Sometimes profuse, sometimes scanty, right? It depends on the body. But the red tongue is necessary for this red tongue and scanty cold, and thirdly and rapid, because as I mentioned before, those pulse condition and tongue condition are universal for those people who suffer from yin deficiency. And the other is yang deficiency. Yang deficiency, as I mentioned before, if you can apply what you learn here, it's just the same thing as the pale complexion, you got feel cold, your face is full of water, and then for the women, they got the leukorrhea, watery, and they're not going to take more food because of poor appetite. And of course, the other symptom is night urination. Night urination is a really common cause for those people who suffer from, the yang deficiency. Remember this, okay? And of course, the other thing is what we call the imbalancing between the yin, heart, and kidney. In student clinic, we don't say this name. We always tell the student this is called disharmony between kidney and heart. Disharmony between kidney and heart. And this is the main reason why we got insomnia. Remember, okay? People getting insomnia, getting, the dream disturbed, sleeping are always because of the disharmony between kidney and heart. And in this case, of course, this kidney and heart all both refer to the yin, move to the yin. That means kidney yin and heart yin, they're not enough, so they cannot communicate with each other. This is why we call it disharmony, right? So the pulse and also the tongue condition just indicate that this is a general yin deficiency because you get red tongue with little cold and also sweaty and maybe pulse. And the fourth one is about the phlegm. If you get some phlegm accumulate inside the body, right? Of course, usually the fat guy. And the people with obesity, of course, they get more phlegm inside the body. And this phlegm, of course, make them the feeling of oppression of the chest and also abdomen, always to have a burping and also acid reflux. And also the pulse appear to have the water, just a little bit, sleepy pulse, and the tongue will be greasy tongue cold in the case. Okay, so how can we deal with those women who suffer from this menopausal disease? Again, we are looking for SP6. SP 三阴交 SP6 is really useful, okay, in dealing with all kind of women disease. And besides that, Qihai, that means CV6 for 25 the kidney yang, and the other is Shanman here. Shanman, okay, ST HT7. Why do we use Shenmen? Because Shenmen is to calm to tranquilize our mind. And Shenmen, and also people always getting, the insomnia. We always look for P6 and HT7. Those 2 points are very useful. And the other one is on the top here. So for me, any people coming for the insomnia, I just look for 4 points. One is on the Bao Hui. Second is P6. Third is Shenmen. And the leg, of course, you must not forget the SP6. SP6 is a good point for dealing with insomnia, right? And of course, the modification, if people getting kidney yin deficiency, please don't forget KI3, KI3, and also tonify the liver by LR3, LR3, and also the BL20, BL18, BL18. If you got any spleen deficiency, of course, ST36, and also the SP9 and CV12. Of course, heart, the disharmony between heart and kidney, we have the Tony. Tony is a very special point. Okay, in the hand here, in this point, right, within 1.5 inch, it's very close to get 4 points, namely HT4, HT5, HT6, HT7, all close these 4 points. These 4 points have a similar function to deal with the heart. But usually when you get when you get the insomnia, you usually look for HT7, Shenmen. But another point, up about a little bit less than half chin, we call this HT6, which is yin C. Yin C is for people getting too much sweat, confused sweat. And then the other Tony, and we got the HT5. HT5 for dealing with the heart and also the heart and the kidney disharmony. And the other one for Tony, remember, for what? For people getting the stiffness in the tongue. That means some people getting windspoke and cannot talk. And then what I'm going to do is to find HT5 and also the other point 2 here. One is we call it the Jinjin and Yuyi, these 2 points. This is in Hong Kong. In China, what they're doing? Open the mouth and then roll the tongue and use 2 needles to just pin on the underside of the tongue. Those 2 points actually we call it the Jinjin and Yuyi for those people who suffer from stiffness of the tongue, cannot talk, and then you can reduce that. Okay, and these are the functions of Tony. And of course, people getting the phlegm stagnation, and then you can add ST40 and also the CV17. Okay, and those are the operation. And here, okay, I think that's the end of the chapter 6, 5, 6, and 7. Right? Are there any questions? I think yeah, we can do one more before we get the break. Okay. Okay, number 7. For number 7, we are going to talk about the amenorrhea. What do you get amenorrhea? Means no. Dysmenorrhea means you get painful menstruation cycle. But anorexia, that means what? Amenorrhea, that means no menstruation cycle again. That means when the woman suffer from no menstruation cycle for 3 months, we can call them amenorrhea. She should not suffer from menopause, remember. She's still between 14 and 49, but she has no menstruation cycle. You know why? Due to deficiency in the body. Okay, I remember one time in Hong Kong, many people just say that if you get some black fungus, and then you get more black fungus, it will make your blood vessel more free flow, right? Because they think that why do people get the hypertension? Why do people get the high blood cholesterol? Because they get too many garbage inside their blood capillary, which will increase the blood pressure, which will increase the blood cholesterol, right? So some people in the internet say that if you can put some black fungus, put some yellow sugar, and with some dates together, and drink it every day, and then you can just clear the scavenger to clear all the garbage from your blood vessel. Many people believe in that, right? One day, a patient coming to me, she's about 40 years old. she told me that, Dr. Fong, I don't have a period for 3 months. I said, why? Why did you say that? I don't know. I asked her why. She told me, I don't know. Previously I get it, but now I don't have. I say why? I just do some observation and find that actually she believed in that news in the internet that she took the black fungus every day and with all the sugars, with all the days together for 3 months time because she want to clear off the garbage inside the blood vessel. However, the result is, black fungus has a result that because it will disperse your blood, just remove the stagnation blood, right? Removing stagnation blood is good for the white black fungus, but if your blood is normal, you keep on taking that, of course you remove all the normal blood, all the good blood again. What's the result? The result is blood deficiency, right? Blood deficiency, she got dizziness, she got blood eyesight, she got tinnitus, everything, right? And then the last one is she got no period. I say stop that, please stop that. Okay, don't take that. And then later on, after 1 month, her period come. This is one of the example of the getting amenorrhea because of taking all those, the black fungus with the white red sugar with the red date. I think this is no good for take every day, right? If you take once a week, that's no problem. But every day there's a problem. Okay, this is why supposed to share with you guys on this situation when I mentioned about the amenorrhea. Okay, let's move. What do you mean amenorrhea? As I mentioned before, the absence of the menstruation cycle in a female more than 3 months time. Okay, so there are two reasons. Either this is primary or secondary, of course, and of course in after the menopause this is normal, but before the menopause this is a problem, right? Why? The case I just shared, it belongs to what? The blood deficiency. Actually, besides blood deficiency, the causes include one is because of weakness. The kidney is the kidney chi is too weak. One is because of constitution. Second is about the kidney chi insufficiency. Three is because bearing too many babies, and then during this time having too much miscarriage. In old China about 40 or 60 years ago, the sanitary system is not so good. Many women give birth to 10 babies, but only 5 or 6 of them can survive. All of them, either they get miscarriage or the baby will die within the 1 month or 1 week of after they're getting birth. This is the problem. Okay, so the problem of amenorrhea sometimes because of giving birth to too much baby, right? Sometimes this is because of the long-term disease and also consuming all the blood. In this case, when the blood, get not enough, of course, you will affect the whole circulation. This is why guys should remember every time we concern about blood and chi. Blood and chi can be found inside the organ. Blood and chi can be found inside the meridian system, right? Whenever they do not have blood and chi, or the blood being clogged or being obstructed in this system, it will cause lots of problem, right? Especially in the flush and also the flush vessel and also the conception channel, which will affect the menstruation cycle. On the other hand, internally, you can cause it by the failure of the spleen to carry out its own function of transformation and transportation, so that the water and grain cannot transfer. What leaving behind is a stemness will be remained in the body, right? So internal injury, just like anger, worry, and also you get lots of frightened. All of them. I will mention to you guys what is the harmful effect of being scared or frightened. This is also no good to the boys, to the kids, and also to the men, right? And this will be also the causes of all, also including the blood and chi stagnation. Those are all the causes for having the disease of the amenorrhea. Okay, so in this case, what we're looking at is we're trying to differentiate the symptoms into different kinds. First of all, no matter what kind of patterns, they do have the same chief symptoms. Those symptoms is delayed menstruation cycle, or actually there's no menstruation cycle, more than 3 months. This is what we call the amenorrhea. And this is because because of the kidney and liver deficiency. Again, when you look at those symptoms, just like dry throat and dry mouth, 5-pound heat, and also night sweating, you should say that this is not only liver and kidney deficiency, it should be kidney and liver yin deficiency. Be careful, okay? And heat sensation in the 5-pound heat and red tongue with no coat, scanty coat, and also the wiry and fatty muscle, all of them belongs to kidney and liver yin deficiency. Be careful, okay? And the second pattern about the qi and blood deficiency. Many women, when I was in Hong Kong, they like to have a slim body. Even in your body, they say, "Oh, I'm too fat." Yeah, some people have a crazy feeling that even they're so kidney like me, they think they're really too fat. So psychologically, they want to get slim as possible, skin as a skeleton. So they do not like to take any food. Not enough food. The result is what? Get deficiency, right? So in this case, deficiency because of keeping body slim, of course, will get the deficiency of the body. And then what will the result? Dizziness, blurred eyesight, shortness of breath, and also really fatigue, easily get fatigued. No, the poor appetite. This is a vicious cycle. What do you know? Vicious cycle. How many people getting the disease of neurosis, or what we call it, the neurasthenia? Because what? First of all, they're working too hard. They don't have time to eat, and then after that, when the lunchtime passes, they don't have the desire to eat, and then later on they will getting thinner, skinny, and later, and after that they lost appetite. Okay, the less they eat, the less appetite they get. And then this is a vicious cycle that later on they do not like to eat, and also the body also and not unable to eat. Later on, this become spleen deficiency and develop to a kind of eating disorder. This eating disorder, we call it anorexia. Remember, anorexia is the name of psychological disease, which means when we see those things, we're not going to eat. When you feed him, he will vomiting. He rather vomit all the food out rather than taking in the food, right? So those are disorder. And in this case, when people getting qi and blood deficiency, they get all sorts of disease like this one if they want to get the slim body, right? Those are the second pattern, which we call it the pattern of qi and blood deficiency. And the third type of pattern called the qi stagnation. Qi stagnation with blood stagnation, of course, these people will appear some irritability and distension in the chest and also the hypochondrial region, right? And this heat will radiate down into the abdomen and become the abdominal pain, which refuse people pressing. Remember, when you get abdominal pain, refuse touching, that means one, you get excess here. Excess what? Excess of blood stagnation. Too much blood stagnation or too much water. So whenever light touching and refuse touching are two kind of disease. Light touching, that means you get empty. You get deficiency inside. You get nothing, and then you light touching. And then when you refuse touching, that means you get much stuff inside, just like stagnated blood, water, phlegm, undigested food inside. If people get abdominal pain, refuse touching, also with the blue tongue, the whole tongue turn blue. What this means? Stagnation. Or not that adverse, right? Not that worse. Just the tongue, but we find some blue stalks on the top of the tongue, or blue taint, two bands of blue color on the top of the tongue. That is less severe case of blood stagnation. Remember, okay? And the pulse, of course, you find choppy and deep and wiry. Those are because of the stagnation. Okay, the last time we mentioned about, of course, is about the phlegm. In fact, guys always get the phlegm, and then they get the congestion in the chest, and they get tired, and they are too much for the too much for the vaginal discharge, and the tongue will be greasy, and the pulse will be slippery. And last one about the cold. When the congealing in the stomach, of course, it will cold hand and cold foot, and also it light the warm foot, right? Those are what we call it. And the pulse will be deep and slow. The tongue cold will be white. Okay, how can you deal with that? Anytime people will get in this kind of the disease, of the amenorrhea, we are looking for 3 more points. One is a guanyuan, that means CV4. The other, ST4. And then the third one is ST29. So up to this moment, if you guys pay attention to the previous 6 chapters, you will know that points dealing with the women disease are limited to several, not too much. As I was learning gynecology about 35 years ago, after I finished the course, I come to conclusion. Any women disease is just 25 by 25 the chi, 25 the blood, 25 the kidney. Now the acupuncture point the same. You just 25 what? For any woman who suffer from amenorrhea, we just consider about tonification, because most of the disease here consider about deficiency, right? So how can we tonify? Tonify chi, which point? CV4, and also ST36. And Guilai is specifically for what? For getting rid of the cold. So these 3 points tends to removing the cold and also tonifying the chi. CV4 and ST36 is going to tonify the chi, while ST29 is to removing or getting rid of the coldness inside the uterus. Right? That's easy. So for other associated points, if the kidney and also liver yin deficiency, of course, you find the best suitable on the kidney, BL23, best suitable on the liver, BL, the 18, and also from the leg, you find the 2 points for getting rid of the fire and also the liver chi, just like the 2-3, KI3 and LR3. LR3 Tai Chong is to get rid of the heat, fire, while KI3 kidney number 3 is for 25 more water. So qi and blood deficiency, everybody knows. If you get qi and blood deficiency, please find all the qi point. Just like the qi hai, that means the CV4. I mean the qi hai, and also you got the spin, the best super on the spin and the lung, right? Qi stagnation, same as the qi deficiency. You got also find the point to get rid of, to activate the blood and also to move the qi. Phlegm, 2 points. One is the Feng Long, ST40. The other is you get the water punch of the SP9. If you get more cold, how are you doing? Of course, you get the kidney yang, which is on for kidney yang. Of course, Mingman, GV4, Mingman, and Yao Yang Guan, GV3. That means anybody suffer from cold congealing in the body, we look for 2 GV points, GV3 and GV4. Okay, remember that. So the hearing point, I'm not pretty sure. Okay, this is also important point for you guys to remember. Any people coming to deal with about amenorrhea, please ask her to keep calm, to keep normal mood, don't get irritating, and get more exercise, and also get good lifestyle. And of course, the most important thing is you get the root problem. I always tell my students that in Chinese medicine is important in what? In finding out the organ, the relevant, the meridian, and then we can get the root problem. We are not treating the head because of the headache, right? So when dealing with the formula, people getting kidney and also liver yin deficiency, we try to look for the same formula. Although the textbook just asks you guys to find the Gushen one, but for me, I like to put the Jingui Senqi one. This is one of the solutions, Jingui Senqi one. And the second, thank you. The second one is about the qi and blood deficiency. So we try to use Ba Zhen Tao. Ba Zhen Tao means what? The 4 gentlemen plus the 4 substance. So 4 plus 4 to be 8. So this is the Ba Zhen Tao going to deal with that. Number 3, and anytime the patient's got the the blood and qi stagnation. What we are going to do is to move the qi and also to activate the blood by using one of the formula in Chinese herbal formula, which is called the 血府主义汤. You guys have seen this before the lunch break. For phlegm, of course, this is another important formula called the 冲附道堂丸. This 冲附道堂丸use 仓鼠 and 附子 to guide the phlegm away. So you can see 半沙 and also 茯苓 there, right? Okay, I think this is the end of this first session. We finished 3, okay, leaving the other 3 to the rest out to 10 minutes later, okay? So how about we get 12 minutes break? Please come back at about 4:50. 4:50. Thank you. Okay. Yeah, welcome to the class again. For this last session, we still got about 1 hour and 5 minutes. I hope to finish 3 topics within this short time, and then we also get an assignment for you guys to finish tonight. So tomorrow we are going to check all this work, right? So number 8, chapter 8, concern about the beng lao. Beng lao, in Chinese, beng means what? Means flooding. Lao, it means leaking. And the word beng lao means what? Means the bleeding between 2 periods. It's a kind of pathological, changes within. This is the time the woman should not have any bleeding, but this is the unknown reason. You get this beng lao. So as I mentioned before, beng has a meaning, lao means meaning. That means between them, the uterus, get a continuous bleeding, right? And the heavy bleeding, of course, which refer to beng, while the droplets means lao. Beng lao together, that means metrorrhagia. So we can use the word metrorrhagia to mean the word beng and lao. Of course, this disease occurs when the woman, get the either in the regular time or in the menopausal stage. They do have, as I mentioned before, some women before their menopause, they will get 1 time of beng lao, and then later on, and then there's no any menstruation again. And according to the research, according to the medical research, that means this beng lao is caused by dysfunction of endocrine. That means it's a kind of abnormal secretion of those hormones from the reproductive organ of the woman. And there will be 2 kinds. One is functional, the other is non-functional. Functional means this is related to the reproductive organ. Non-functional, of course, related to other parts of the body. So in this case, we can classify into 2 kinds. One we call it the ovulation, the other is non-ovulation bleeding. Okay, but that doesn't matter because according to Chinese medicine, we just need to know what will be the reason of that. So we are all looking for the etiology and also pathogenesis of this kind of abnormal uterus bleeding. We call it beng lao. So this abnormal uterus bleeding, of course, will concern about 2 vessels. One, because of the penetrating vessel. That means because of the flooding, the flush vessel. The other, we were talking about the conception vessel. And the common factors, are because of what? Usually because of the heat. When the heat forces the blood cannot flow peacefully inside the blood vessel. And then the blood will just force open the blood vessel and then it flow outside. And then this is the first reason. Because what? Because of either the external, exopathogen, or because overeating of some, the spicy food, and leading to the liver fire or the liver stagnation, and which will force the 2 vessels abnormal. So the bleeding. And second is because of the stagnation of blood stagnation. And the blood stagnation, of course, will makes the blood not staying in its original channel. It will go to the other channel, and this process going from one other channel to the other channel will result in bleeding. And the other way is because of the weakness of the spleen qi, because the spleen, according to its function, it can govern the blood inside the body. Once the spleen qi is so weak, it's unable to govern the blood will appear either in the stool or sometimes in the urine, or most of the time appear under the skin as a kind of subcutaneous bleeding. So on the other hand, the last one will be because of the deficiency of the kidney. The kidney's deficiency, of course, it cannot keep his kidney zinc inside the body and then inside the kidney. So what the result is, it will lead to the bleeding in the uterus. Why? Because there's a great relationship between the kidney and also the uterus. Okay. So overall, I can say that this disease will involve about two vessels. One is a flush vessel, the other is a convection vessel. And the organs related will include the liver, the spleen, and also the kidney. Okay. And how can we do the differentiation syndrome? One, no matter what kind of patterns, it will have the same symptom, which is the bleeding beyond the normal time. That means between two periods, you will find copious or continuous, either dipping or flooding. Dipping means droplets, but flooding is a large amount of blood flowing out from the uterus. Okay, and let's divide them into different patterns. The first pattern, we call it the pattern of blood heat. Of course, this probably, how can you know that this is because of blood heat? Because the blood is sticky. Heat will consume the water away, so the blood will appear more sticky, more red in color, and also sometimes the blood flowing out from the uterus will be smelly. In addition, the patient will feel dry mouth and light drinking because it is excess heat. The tongue, red tongue with yellow tongue coat. The pulse will be slippery and rapid pulse, right? And the second type, we call it damp heat. Again, as I told you guys before, many diseases concerning about external reproductive organ related to the liver. So in this case, you find the damp heat from the liver will make the woman have some kind of the vaginal discharge mixed with blood, and of course the discharge, no matter the blood or the leukorrhea will be yellow and also smelly, and which make the woman, the patient, have a itching in the private area, and also the tongue coat will be yellow and also greasy, while the pulse will be soggy and rapid. As I mentioned, soggy means dampness, rapid means heat. So when you combine the soggy and the rapid, it means damp heat. The third type, we call it the qi stagnation. And qi stagnation, any kind of blood stagnation or qi stagnation will result in the situation of clogged blood in the menses. So if you find a menses containing clogged blood, and also the patient complain about irritability and also frequent sighing, sometimes you get this tension pain in the lower lower abdomen, and sometimes the hypochondrial region, and with the red tongue and also wiry pulse. This surely because the kidney, the liver qi stagnation. Remember, in liver qi stagnation, there's nothing wrong with the tongue. You can't see the liver qi stagnation from the tongue condition, no, but only from the pulse condition. And the fourth type concern about the pattern of the blood stasis. Of course, this time again, we can see the clot in the blood, and also a large bleeding with not only the clot, but the blood also, the menses itself also appear dark in color. The pain in the lower abdomen, which will be intensified by pressure, and of course you get a cold thing, kind of cold drink, of course it get more intensified. The tongue, the whole tongue getting blue, or you can find the ecchymosis on the top of the tongue. The pulse will be deep and choppy. Remember, choppy pulse means stagnation. Okay, and another type of pattern we call it the spleen deficiency, and magnified as the red blood. And this red blood, of course, this is because the red is not really red. Sometimes it's pale red only. Why? Because the spleen deficiency cannot enough get enough blood to the tongue, and the patient will get lassitude. Also shortness of breath, and also not enough desire to eat. So anorexia, the tongue will plump, that means swollen tongue, white coat with deep and fluffy big pulse, right? And besides the spleen problem, also the spleen deficiency will lead to kidney problem. When the patient have the pattern of the kidney yang deficiency, again you can find the cold. Cold is really common in the case of kidney yang deficiency, and the patient will like to have this warm thing, warm objects inside his abdomen, and we like to apply pressure to the lower abdomen. Limbs close, and also she will get the feeling of the intolerance of cold. That means cold will generate inside the body from deep from the liver and the heart, right? And we accompanied by the cold pain in the lower abdomen, right? And of course, you will get the tongue with white coat. The pulse will be steady and slow. And the last pattern, we got the kidney yin deficiency. You can get all the symptoms similar to what we learned before about yin deficiency, just like the tinnitus, the dizziness, restlessness, insomnia, weakness in the lower part of the body, just like the wrist and the knee, and the tongue. Again, I thought everybody can remember that it's red tongue with little coat and the rapid and steady pulse. Okay, so all this will include as the prevention syndrome in case of the bang lao, that means the abnormal uterus bleeding. Okay, how can we deal with that? Again, as I mentioned before, do not away from those points, just like 关元、珠山里，三阴交、三元 and 关元 then CV4, San Yin Jiao, that means SP6. But what is new to this time is what we call the Yin Ba, SP1. Yin Ba is what in your large toe, the big toe, the outer side of your big toe, outside here. This is SP1 because those are the jam points of the spleen. And when we use that, of course, Yin Ba is very useful. Unlike other jam point is going to subdue the fire, but Yin Ba has many functions. One, you can deal with the bang lao. That means you can deal with the abnormal uterus bleeding. It can also, deal with any women disease. So for the women disease, we make use of SP1. So in this case, you guys need to remember 1 point SP3, SP1. Others you can remember from the previous lesson, just like GV4, SP4, and SP6. They are all the important points in dealing with the flooding and also leaking. And if the flooding and leaking because of the blood heat, we add one more SP10. It's very interesting for us to know that SP10 actually is for tonify the blood. But now if you get a blood heat, we also tonify the blood in order to lower the blood heat. So this is a very special technique, a very special strategy for us to deal with that heat. And for dam heat, of course, please look for those water points such as SP6, SP9. But now the textbook use S3, SP9. And cheese stagnation, again, we use LR3. And of course, blood stagnation. This is also another new point called the DG, that means the SPH. Actually, SP6, SPH, SP9 are all usable in dealing with the blood stasis, right? And of course, for people who suffer from qi stagnation, especially spleen qi, we first look at qi, which is 保会 on the head here, right? We got the GV20 and ST36 for 25 the qi. Okay, for the kidney problem, please look for GV3, GV4. This is easy. However, kidney yin, usually we refer KI3, right? But how come we use KI2? Rangu. KI2 is used for dealing with the heat in the other organ because of the kidney yin deficiency. Just like as I mentioned before, kidney never get excess disease. Kidney never get fire. But once it get the fire, it will not put it inside. It will descend down to its partner, which is urinary bladder. So you always get heat in urinary bladder instead of kidney, because kidney will not retain fire, remember, okay? So why do we use Ki2? Ki2 is used because we want to put down the fire caused by the kidney yin deficiency in other organs, just like the liver fire, the heart fire, stomach fire, or urinary bladder fire. We can use Ki2 to stand for it, but this is not common, okay? And other alternative treating, I'm not really sure. Okay, remember, this kind of burnout is not happen in one day. So if any patient got the flooding and also the leaking, we need more time, a longer time to get recover. So remember to inform the patient, don't be, hurry. Okay, we cannot be, must be patient in this way, right? Okay, how about the formula? No matter what kind of disease in the woman disease, we are looking for the cause of that. For example, kidney yin deficiency, right? Of course, we are trying to use the 右归丸, 左归丸. In this case, if we find that it is because of the kidney yang deficiency or the kidney too weak to hold all the kidney gene, still we are using the 右归丸. That means no matter this is kidney yang deficiency or the kidney deficiency because loss of consolidation, we're still using the same formula, which is 右归丸 in order to tonify. However, if we find the kidney weak on both kidney yang, kidney yin, can we use 左归 and 右归 together? So the answer is yes. Why don't we can use both 左归 and 右归, although 左归 and 右归 they're common in 5 herbs. 左归丸 get 8 herbs, but 5 of them are common with the 右归丸. So when we combine them together, of course it means just not 8 plus 8, but 8, 13 herbs for doing that, right? And the other symptom is called the spleen deficiency, failing to govern the blood. Spleen deficiency failing to govern the blood. In this situation, of course, we try to tonify the spleen so they can govern the blood, so no more bleeding, right? Usually, when we tonify the spleen, we use a 4 gentlemen soup. But 4 gentlemen soup is not enough in this case because we are trying to stop the bleeding. So in addition to the 4 gentlemen soup, we add the other. So what we call this is 固本, 固本子本汤. What does that mean? 固本, that means consolidate the origin. 子本, that means stop the bleeding. That means we're trying to use this herb to consolidate the origin. This is the kidney origin. And also to stop the bleeding. So this is a formula for the spleen deficiency failing to govern the blood. And number 3 is the deal with the blood heat, going astray. That means the blood heat to force the blood to go out of the blood vessel. Okay, if we find that the flooding and leaking because of the blood heat, and then what we're going to do is we're trying to use a formula called the 清热固精汤. 清热固精汤, according to its name, means clear the heat and consolidate the channel and the flush and also the bell channel. I mean the consumption channel. Number 4 symptom is the symptom because of the retention of the blood stasis. What does that mean? Usually the Chinese name means what? Means the stagnated blood obstructing the channel. Okay, so in this case, if you find the woman suffer from leaking and also flooding because of the obstruction of the stagnated blood, we try to use a very good formula called the 时秀散. 时秀散, it names what? The name is very ridiculous. It means laughing. You're losing the laughing. I don't know what the same, but usually in Chinese medicine practitioner, whenever you name the 时秀散, we know that this is we're trying to remove the stagnation in the lower energizer, right? Because 时秀散composed of 2 herbs, 蒲王 and 五灵芝. 蒲王 and 五灵芝, these 2 types of herbs is able to remove the stagnation in the lower energizer. Of course, you have to add other herbs as a modification, right? So those is number 8 about the flooding and also leaking, or what we call it the abnormal bleeding in the uterus. So are there any questions? Good. So let's finish number 9, and then we get off time for the pediatrics, right? Number 9 concerns about the 不孕. In Chinese, with English, it means infertility. As I mentioned before, men, if you cannot give birth to the baby, this is because of impotence. Women, because of infertility. Infertility, of course, it contains a lot of reasons, right? Anyhow, that means the woman, one couple should marry for a certain time. They should give birth to the baby according to Chinese tradition. But after that, if it still do not get enough, do not care the baby, cannot conceive the baby, either it's a problem with the man or the woman, right? But in old China, we always say that what is the purpose of getting a wife? Because we want to give birth to the baby. If the wife cannot give birth to the baby, we'll get 2 solutions. One, the mother-in-law will get another woman for his husband so that they can give birth to the baby, right? The other, of course, you can try to separate from each other and then you go out, right? So this is the only solution they get. So the infertility, of course, in China is very important because the Chinese people like to get more baby because son and daughter, they are properties like a Jewish people, right? You get more son, of course, you get more power to strive for other benefit and to strive for the property from other people. So getting baby is the sole purpose, the sole task for the woman to be married to a man, right? So if get married or the wife, the cannot get a baby, the husband has the right to get a second or third and even the fourth wife in order to get the baby, right? So infertility here, as I mentioned before, is to conceive baby after a normal time, just like 2 or 3 years, and without contraception. You know, nowadays many couples like to use a contraceptive method to stop, the pregnancy because they want to live with the 2 people, right? They want to live without any baby. This is not their choice. But the situations, if the couples, they do not have any conceptive method, but they still do not get the baby at the normal time, and after checking body check, both of them get healthy, but still they do not get it. What do you mean? That means they get something wrong with, their body, and of course they in this case, I try to look for the reasons why. And actually, this kind of infertility can be divided into 2 types. One is a primary type, the secondary type, right? It's caused by disease, of course, it's primary type. Of course, sometimes in the Western medicine, this unable to conceive the baby, can be divided into different reasons. One, either the problem in the ovary of the women, or the inflammation of the endometrium problem. That means the inner lining of the uterus get the problem. Or sometimes you get the inflammation in the neck of the uterus. We call it the cervicitis. And sometimes because last one should be the endocrine system. That means the hormonal control. All those can be the reasons, right? And this disease always due to what? Why the woman cannot conceive the baby? Many people say this is a woman's responsibility because of her kidney deficiency by the impingement problem. That means a congenital weakness of the kidney qi. Second is because not enough blood and zinc inside the body, right? And of course, the other reason is the flush vessel and also the conception vessel getting deficiency. And last one, we also got the malnourishment, the malnourishment of the uterus vessel. And also sometimes, both anytime of them will get nervous or get mental depression. And also, you remember, mental depression is one of the reasons. And liver oxygenation, of course, will obstruct the free flow of the qi and blood. Okay? And last one, of course, the flush and also conception vessel, which unable to supplement each other. And of course, when going to the organs, actually, we find that even the spleen deficiency, which unable to perform the transportation and transformation, also will be one of the reasons because it will accumulate some of the phlegm inside the body. And this phlegm coagulation and the blood stasis will also retard the growth, the flow of the qi and blood, and this also the causes of the infertility because it can stop the sperm to mix up with the ova together, so the pregnancy cannot be cannot form. Okay. When you try to divide the infertility into different sign symptoms, different patterns, we try to look at them. But before that, we know that any patterns of infertility will have this common symptom, which means that the woman cannot conceive the baby within 2 or more years. Right. So the first pattern we call the kidney deficiency. That means usually this comes with the delayed menstruation cycle. That means the menstruation cycle always delayed because of the weak body, the weak constitution, and in this situation we call them the kidney deficiency. And what you see is the woman, when she have the menstruation cycle, her menses is always getting light. Remember, light menses always means deficiency. Either this is blood deficiency or qi deficiency. But when you get dark complexion, I mean the face of the woman, you seldom see people get a dark complexion. Either one because of the kidney deficiency, second because of dampness. You get dark, or sometimes you get the blood clotting. I mean the blood stagnation. You get dark facial complexion. And accessority, that means it's not able to carry on the sexual activity according to, maybe the structure of the external reproductive organ. Sometimes you have psychological problem. So anyhow, any factor leading to the unsexuality, that means it will lead to this kind of the infertility. Or sometimes, you can find these people also suffer from what? Less sexual desire, because of lower kidney yang deficiency. And also some people will get the, weakness and soreness in the wrist and also the knees. This because the area is governed by the kidney. And profuse clear urine, loose stool, and also the pale tongue with the white coat, with deep and thready or deep and slow pulse. That means the kidney yang deficiency will lead to lots of signs and symptoms. Just like the kidney profuse urine, and also the the stools, the loose stools, and also the the weakness in the lower part of the body. Those are the problems, signs and symptoms shown by the kidney yang deficiency. The other, as I mentioned before, liver qi stagnation actually is the main cause of many diseases, including the infertility. If the woman gets liver qi stagnation, she will first have irregular menstruation cycle, and then during the menstruation cycle, she also got the abdominal pain. The blood flow is very important. I didn't mention before. Many women get unsmooth blood flow. That means the blood inside the uterus cannot flow easily because just like a stagnation, just like choppy pulse. And this is also, this will make the woman or to make the patient herself a little bit frustrated. And this, of course, is because of the liver qi stagnation, right? And of course, when the blood flow out from the uterus, it will also contain some dark clogged color. And during the time, she also got all kinds of pain, just like the distension pain in the breast, and also pain in the abdomen, and also she also got some mental depression, and also the vexation, that means the palpitation, and also dysphoria. All this because of what? Liver qi stagnation. That's why liver qi is a very important factor for us to consider in all kinds of the women disease, right? So including the infertility. And the third type, we call it the pattern of spleen deficiency and dampness retention. Dampness retention is the result of the spleen deficiency. And in this case, you find the woman very fat, the fat woman, because it's called the fat dampness. And delayed menstruation cycle we've called. Sometimes not even the delayed menstruation cycle, with no menstruation cycle at all, we call those amenorrhea. And also the profuse sticky leukorrhea. That means it's suffer from damp and also heat. And dizziness and palpitation, that means not enough blood and weakness. And also fullness in chest and hypochondria, this actually because of the spleen deficiency caused by the liver. Okay, fullness in chest and hypochondria, and also poor appetite. And also nausea, white and greasy tongue, and slippery tongue. You can see in the third pattern, usually this is not only the spleen deficiency, but it's a spleen deficiency affected by the liver, because you can see the fullness and hypochondrial region, right? And also the greasy tongue and slippery pulse. Slippery pulse means we get a lot of accumulation there. Okay, after we differentiate the symptom into different patterns, we try to look at the treatment. Again, you can familiar with all these points. I'm happy to see one, Sanyin gel SP6. Second is the Guanyuan CV4. And then, in order to think about the kidney, please look for the BL23 and also the KI3. You guys can see the primary treatment with the primary principal points. They're all concerning about the kidney yang and kidney yin and also the water, right? So just remember the kidney point of BL23, kidney yang CV4, and kidney yin KI3. All those the only point away from this, different from these 3 points is SPV, Sanyin gel. But Sanyin gel also the cross point for the 3 yin, including the kidney, the liver, and also the spleen, remember, okay? Okay, for any modifications, for the kidney deficiency, please add GV4. Actually, GV4 is for the supplementation, addition, add more energy to the BL23, right? And also we find the whenever we cheese stimulation, liver cheese stimulation, please look for LR3 to relieve the liver fire and liver qi, and tonify the blood by looking for the point BL18. And for spleen deficiency, everybody knows that whenever spleen deficiency, you get phlegm. So what you're going to do is to find the ST40, 飞龙, 丰龙, and also ST36, we call it the 主战力. Okay? Those are easy for you to get. Actually, as I mentioned before, any point are easy because you just think those are the symptoms, and then you get the relevant point is okay, right? So, moving down to the remarks. Please note that there are many causes for the infertility. But after checking, the body checking for the both spouse, you find that there's nothing wrong with that. Of course, you have to take consideration into the kidney problem, right? Usually, we can use the acupuncture to deal with the kidney yang, but we cannot use the needle to increase the sexual desire. Last time when I was working in Highway 7, a man from Middle East, he always came to our clinic asking me for releasing his stress. And after that, he just said, can I raise up my sexual desire? I say, sorry, no, I can't do that, right? Because I just can tonify your kidney yang, but I cannot directly increase your sexual desire. Otherwise, I get rich. No, I don't do that. But the only thing is, even I can release this stress. Second, I can increase your kidney yang. That's it. It's not more, right? So, when you are talking about the treatment for the infertility, of course, you can just advise your patients that during the time of treatment, please have limited sexual activity. Second, cultivate a healthy condition for your emotion. And third, of course, you must know the time for the ovulation. Why? In Hong Kong, I tried to help several couples to get the baby. Of course, the thing is, if they don't get the baby, I will ask them to go home to check your body temperature. Because according to the Western medicine and also to the physiology, our body temperature is usually about 36.9 degrees, right? But the day when the women get the ovulation, the body will go up 1 degree and then become 37.9. So this is very important for us to know what is the safety period. Safety period has 2 functions. One, to prevent get the baby. The other, to get the baby. You know why? The method is we put a thermometer below the pillow, and then the time when the woman get up in the morning, we put the thermometer into the mouth before they go to the washroom, before they do anything, put it in there. And the body temperature will be about 36.9. But the day after giving 1 to 7 day, 1 to 14th day, and it's about the 15th day, when you put the thermometer in the mouth, you find the temperature is 37.9. That means go up. And then after that, the temperature remain the same. That means at the ovulation, the body will go up one degree Celsius. And this time, I will ask the couples to do the sexual intercourse for continuous 3 days. Means 14, 15, 16, and at this time, when the sperm go into the uterus of the woman, of course, it's easy for her to get fertilization. This is what I advise. Of course, you can use this method to stop. That means you can do the sexual intercourse for 1 to 14 days, and then you will not stop in those 3 days, and after the 20 days, and you do use it, make love again. This is no problem, right? So this is, for me, I say, the safety period is mutual. But whether you can use it to make up the baby, or you can use it to avoid making the baby, this is your choice, right? So this is the safety period according to the those people in the Catholic Church. They would like to use the method to avoid getting baby or to get the baby, right? So this is what we call it the safety period. Okay. After we talk about getting the baby, or the how about to use the safety period, we'll also talk about the using the needles to increase the the kidney yang, and also to improve the spin function, so we can get rid of all those heat and also the stagnation, cheese stagnation. We also talk about using the herbs now. Okay, for those people who suffer from infertility, and then we have one formula which called the for me, I have no idea about this one. Although I'm teaching the herbal formula in the day school, in this school, but I have no idea this one. But if you ask me the ingredient of this, of course, this ingredient is actually the ingredient of the Yao Gui Wan with all the other herbs to tonify the kidney yang. So all those things, just like the Jihuo Qie, this is Jihuo Qie, this one, this herb called the Jihuo Qie, or this Jihuo Qie. What is that? This is actually the placenta, right? People believe that if you take in the placenta of the sheep, and then of course you can increase your sexual desire, you increase your kidney yang. And Taiwan and Hong Kong, they're using the sheep or the goat, the placenta. But in China, they usually get the human placenta. You know why? Because after giving birth to a baby, the placenta will leave the body within 1.5 hours. If the placenta do not leave the body, it will cause continuous bleeding, and the woman will die, a dependent woman. So after the placenta comes out, and then the midwife will take this placenta. In the past, they will go home and then preserve this placenta and put it in the powder, and they can eat it, because they find that this placenta contains lots of female hormone. After they take it, they will more beautiful. They will go there. Right now in the Chinese herbal shop, you still can find some placenta there. For those people who suffer from lower sexual desire, they suffer from kidney yang deficiency, or in men, they get the impotency, you can just get this kind of Jihuo Qie, which is actually the human or the sheep's placenta. And then we rather put in the powder, we can eat it, we can boil with the soup, we can boil with the decoction together, right? So this is, so for me, if you ask me, I can give you some herbs which can, increase which can increase the sexual desire, also the kidney yang of the people, right? Sometimes it's not only for doing making love. For some men, they get a lower sperm count. And in Hong Kong, I get a couple. They're not going to. They do not want a baby, but the husband do not get enough sperm count. Each time we get a little bit sperm, usually we get 1 million of sperm during one ejaculation. About 3 cm within the 3 milliliter milliliter of semen. They contain about 1 million of the sperm, right? But his sperm is a low count, and some of the sperm died, once he get ejaculated. So they asked me whether we can increase that, not because of getting more desire, then because the family told them that if the guy do not get enough male hormone, he will get osteoporosis after she getting old. Okay, so they asked me to how to get more and more sperm count. The only thing is I will introduce them to certain kind of herbs, just like 几何切, just like 营养火, just like 阳起石. All those increase the kidney yang, within a very short time. And after he got those Chinese herbs, her sperm count go up and the female hormone and male hormone go up, and this way she will avoid getting the osteoporosis when he get older. Okay, this is my situation for that. So the second symptom, what we call it, is the kidney and also the liver yin deficiency. So what we are going to describe is the 儿剂地黄汤. 儿剂地黄汤, we are making use of actually this comes from the cousin called 儿剂丸. 儿剂丸 composed of two herbs. One is called 女金子, the other is 海南草. Those are the ingredient for the 儿剂丸. We combine the 儿剂丸 with 地黄汤 together. So this is useful for those people who suffer from kidney and also liver yin deficiency. And number 3, we are talking about the qi and blood deficiency. Again, whenever people get qi and blood deficiency, I will introduce them to 拔针汤. That means the soup containing both tonifying the kidney yin and kidney the qi and blood together. And number 4, we have the heart and liver qi stagnation. Usually, qi stagnation concern about the liver qi. However, we seldom have heart qi stagnation. If we got heart qi stagnation, of course, we get what? We get some kind of facial tightening and some kind of trigeminal, the neuralgia. All those are because of the heart stagnation. So liver qi stagnation is for people who always get sighing, always get congestion in the chest, but the heart blood stagnation will lead to the face tendering and also tightening and also some kind of the headache. However, heart qi stagnation, we seldom use it. We always call them the liver qi stagnation. So in order to solve the problem of the heart qi and liver qi stagnation, we use a formula called the 开油中玉汤, which is to remove the blood and qi stagnation, right? So I think all this 9 chapters concern about the women disease or the gynecology, and then we finish that. So are there any questions? Again, I still emphasize on one thing, that throughout the 9 common disease, please remember that some points are common to this women disease, just like to never the qi, so never the kidney. Okay, and one point we can always use in that point is the 三阴交 SP6. SP6 is very useful and for all these 9 disease, remember, okay? And then after that, if you got any problem, just like the irregularity in the menstruation cycle, whether it's preceding or after, of course the point you can use is the qi nail, BL32. So usually we refer, and the other point is you want to get more warmth, you want to get rid of the coldness of your uterus. Of course, this is the way you can use a 归来 ST29. Yeah, ST29 is a point for get rid of the heat and not get rid of the coldness from your uterus, right? So this is PC6, right? No, it's yeah, you're right. Of course, you're right. And then I didn't mention about the contraindication of the pregnant porn, right? When people get pregnant, of course, the first one you cannot do is this Hugo. Yeah, the LI4, never touch that. If you touch LI4, we will get the baby, I mean the miscarriage, right? The second point, just as mentioned by this gentleman, that this is San Yijiao, that means the SP6. SP6 you cannot touch. And any point below your abdomen, right, and also below the sickle vertebrae. I'm not going to touch that for the lay pregnancy. Lay pregnancy don't do that, okay? Of course, for the menstrual cycle, that's good. But if you suspect that this woman has been pregnancy, don't move, okay? Those points are important. One is the LI4, the other is the SP6, right? And also any point just like some people even say that the point here, I mean the GB21. GB21, you need not do that, right? All those points, remember, okay? Okay, leaving for the other 20 minutes, we are talking about another symptom, which is in kids, and what we call it the infertile malnutrition. In Chinese, we call ganji, ganji. When we were young, ganji means what? Means we have some stagnation inside our body, inside our abdomen. It means we cannot eat too much for that, right? So this is a ganji. So in here, when you mention the ganji, it means what? The chronic disease in also the spine and stomach, which means what? Malnutrition and combining with food stagnation. And this is classified as a kind of spine deficiency due to the food stagnation, right? And in the time when we were young, we also had another symptom called the 骨 syndrome. 骨 syndrome is also another type of disease. Last time, when students are attending their blood examination, the question asked the student is when 骨 syndrome concerned with involve which organ? And they got the liver, heart, and also spine, and also lung. Which one? Actually, 骨 syndrome actually means there's a lot of the abdominal distension, bloating, and also pain. All of them including the 骨 syndrome, right? This means a lot of stagnation and accumulation there. Actually, when we talk about ganji has two functions, right? Clinically, ganji means what? Means emaciation, skinny, and the kids always get what? The hair is dry and yellow, always lack of energy. When this kid, after giving birth he will just lie in his mother's body, always very silent and always sleepy all the time. And some of them will be very visible. So ganji here, we have two reasons. Why? Because you give too much food to the kid. When my mother, when I was young, my mother told me that when we feed any kids, remember, you must not feeding too much for him. Otherwise, we'll get too much food, and which will cause the damage to the spine and the stomach. Two, ganji can also be the name of the disease, means not enough water, emaciation. And when I study the pediatrics, my teacher told me that kids only get 4 types of disease. Which 4? One is frightened. Second is the wind, and then we get the phlegm, and then we get the food stagnation. I say again, kids only have 4 types of disease. One is frightened, that means scary. Second is wind. Third is the phlegm. Fourth is the food stagnation. The disease will not be away from this 4. Frightened, that means please do not scare the kid. If you scare the kid at night will just cry, and then they will develop in the kind of the commotion, high fever because they're frightened. So don't scare the kid. Second is the wind. Wind is external. That means the kid easily get the wind cold, wind heat, wind stem, and then wind phlegm. The third is because of the phlegm. The phlegm is also another disease for the kids. Many kids, after they get the serious symptom, they quickly get the phlegm, right? And the last one is the food stagnation. This is what we call it the ganji here. That means if you get too many food to the kid will what? Will get stagnation and is not going to eat because damage of the organ, right? So this disease is same as the name of the Western medicine, just like they got the two names for that, right? And of course, it is demand for ensure the growth and maintenance and also the body. Okay, and what is the formation? Why do kids have this kind of the ganji? This is because according to the ancient TCM practitioner, that kids have a very delicate body. Kids always have a delicate constitution. One, kids always have excess in the liver, while the deficiency in the spleen. Excess in liver, what does that mean? The liver of the kids always get hyperactivity. That means whenever we get the situation that we will get fever. This is hyperactivity. When you give the kids a little bit deep fried food, just like the French fries or fried chicken, he will easily get the fire, red eye, nose bleeding, and also sore throat. All those. This is because kids always get the excess, liver. On the other hand, we will get the deficiency in the spleen. That means a little bit cold food and make him diarrhea. And also he will get very sensitive alimentary canal. So remember, kids, the body is so delicate that he get the excess in the liver, deficiency in the spleen, right? So this is true here. You mentioned that the kid always get the deficiency spleen, and he eats. He cannot know which is the limit. He always eat more than his limit. However, too much food will make him sick, right? So it's in the matter of the caretaker, the parents or the kid himself. When the kid is small, of course, you give too much milk to him, too much food to him, it will damage his stomach, damage his spleen. And for a long time, this food will accumulate inside the body and become ganji. And the other reason is because of long-term disease. When the kid get long-term disease, of course, he will not get enough tonification after the sickness. This also will hurt the spleen and also the stomach. So usually, when I treat with the disease, I would like to take care about the spleen because I think even I can get rid of the disease from the boy or from the kids, and afterward he cannot eat. This is my responsibility. So whenever I prescribe any herb to the kids, I would like to take care one about his spleen and stomach. The other will get rid of the pathogen. So in this way, after the disease, disappear, this kid will still have the ability to take the food to eat. So I will like to take care about both the spleen and also the stomach while I'm treating these people. Okay. And on the other hand, the kidney and also stomach can be also the important part. People always say spleen. I'm sorry, I'm going to say kidney is the pre-heaven, while the spleen is the post-heaven. When you get the enough qi from your mother, you get enough primordial qi in your kidney. This is because your mother provides enough qi to you. This is a pre-heaven congenital condition. After getting birth to the baby will feed on the milk, feed on the food, and this time, all the energy of the baby will depend on the food. So the spleen and also stomach become the post-heaven part of the body, which will consume the food and change the food into the qi and blood. So if the food is not enough, of course, it is also the cause of the ganji, this kind of disease, because of lacking of the ingredient, right? So ganji can be divided into several symptoms. So in case you find this disease in the final examination, please divide them into different symptoms. The first one, we call the waste and malnutrition. And in this case, you will find that the kidney always suffer from emaciation, although it get more, but you will get pale, shallow, and also glutinous complexion. Shallow complexion is not scary, but the most important thing is it lusterless. That means without shining. The face without shining, that means dry. That means without lubrication. That means do not get enough yin. In this case, you will find it's become the kid himself become no appetizer, no appetite, and become very tired, looseness, and sometimes you lose temper, and the stool is loose stool, and also sometimes you get constipation. That means this is the problem of the spleen. The tongue is pale and thin, white, yellow coating. The pulse is steady. In this case, we'll try to give him a prescription which called the 鸡生健脾丸. And actually, this is not the one I prescribe. I always prescribe what we call the 森林保湿散, or 细菌鸡汤 in order to deal with this case. And the second case was the Kawashiorkor. And this is the name I studied when I studied in high school. There's a chapter in biology called the food and also the health. And the food and health, of course, we study a lot of the, the vitamins. And when we lack of the protein, and then the people will get skinny. And this skinny problem, we call it the Kwashiorkor malnutrition. This is shown by the people who are getting the, skinny body, accumulation of some water in the body, because where this, edema, with a round and full look in the face. However, the skin is dark and the hair is brittle, some enlarged liver. This is what because of lacking of the protein inside the body, just like the abdomen. Whenever you see the kids in the Africa, just like it's a fan epithemia. And you can find those kids very skinny, but the tummy is very big. You know why? Because the tummy is full of undigested food, just like the roots of the plant, the fiber, and also the undigested, the seed inside the body. So they will get the very large tummy and distension tummy there. And this, if it happen in our country, in our area, this is not because of starvation. This is because of he get much water there. So what we are going to do is give him some free one. That means what? The pill making the kid fatter, right? This is free one. And the third type we call it the marasmus nutrition. And this is extremely skinny because if you lose all the muscle, just a very skinny and with all lack of the fat inside the body. And this is like a skeleton. And all hair lost. The skin all darkened. And this is line. And this skin, when they give, after giving birth, and then they will get long period of do not move, right? And this is a kind of deficiency in the kid. You can find his lack of energy, his lack of body fluid, and all the body means that this guy is lacking of the energy and lacking of food, and this is an inborn problem. I can tell you. The second find is because the acquired problem. Food, of course, is enough. However, this is the problem during the time her mother incubating him and then giving less care of this kid, and also sometimes because of hereditary problem. That means the hereditary instead of others. Okay. The last type of problem because they're lacking in vitamin. Vitamin A is important in our eye, and usually when you get the problem of night blindness, I will advise you to take more vitamin A or take more carrots, right? And this situation, this symptom, the kid cannot see anything at night, and then this is because she is lacking of vitamin A, and this symptom she get poor eyesight in the dark places, and she also got photophobia, that means afraid of light, and also in severe case she also got the eyes, the right part of the eye, get some blur, some white substance covering the eye, the eye, so that he cannot see. That means the white and black part is not clear enough, get the turbid. So in this case, we got it is lacking in vitamin A symptom, right? And last one is called the cancer disease. Cancer disease is the name of that, but you refer to the heart, getting the stagnation. And this stagnation not only in the spleen, not only in the abdomen, it goes to the heart. How do you know that? Because you find this baby, after getting baby, we get all the boys, and all the the boys and also shore around the mouth. And you guys know this area is governed by the spin. That means the spin accumulating much more heat. And also when he breathes, you can breathe a bad breath. The bad breath is from the spin. And this kid also get the 5 pound heat. And also the face is red, the lips, and also the lips is getting red. Always crying at night. It's not. This is because of the get internal heat inside the body. The time when we were young, my mother will go to the herbal shop to ask for help, and the herbal shopkeeper will ask, again, what we need the 七星茶. 七星茶 means 7-star tea. And 7-star tea is what? Because those kids, when they drink the milk, they're not from the human drink. I mean human milk, not the because it's breastfeeding, although it's common at that time, but the mother may not get enough, milk for the kid, so they buy some milk powder and then get the water with the milk, get the milk. But the milk produces milk powder with a little bit heat, a little bit dryness. After drinking a lot of time, and then the kid develops some, the acne and also macules on the face. This a kind of, the heat sign in the body. So what they're going to do is you get more water for the kid. That's not enough. You get more water with the and also some kind of the herbs which releasing the heat. So this is because of the accumulation of heat in both the heart and also the part of the body. So what we're going to use is we use a 泻心散. 泻心散 means what? We use a 3 kind of yellow, the Wangqin, Wanglin, and Wangxin in order to release the heat in the triple energizer. And this is a very effective herb to release the heat from the body. So this is one of the solutions for that. How about the needling? Some people ask me whether the kids can use acupuncture. I say yes, why not? Some kids, even below 1 year old, we can still use the acupuncture. But the thing is, we are not using too much points. The stimulation, of course, will be less of that, right? I know a kid, falling off from the height, and then he get the stagnated blood in the brain, and the Western medicine said, sorry, I cannot extract the blood from the kid because he's too young. So what I'm doing, what his parents did is just put it into an acupuncturist and do the acupuncture on the head in order to get rid of the stagnated blood. And after 3 months' time, all the blood in the brain has dissolved. Right? I don't know what is because of self-healing or because of acupuncture, but this is an example that we still can use the needle for the acupuncture for needling the kids under 1 year old. Right? This situation, if the kids get the ganji, what can we do? Again, we try to use the points just like the Pishu. This is the best shoe point, BL20, the best shoe point for the spin. And BL23, the best one for the kidney, and ST36 Juzani, and also the local point is CV12. And the other point, we got the Daidu. Daidu is the second point of the spin, which is near the big toe, near the side of the big toe, right? And also Jie ST41. ST41 is the place where you have your shoelace, here. This is ST41, right? You can get all those points in order to remove the foot stagnation. And then if you get the stomach distension, you try to use SP4 and also the Sifeng. The Sifeng? Sifeng is here. 1, 2, 3, 4. Sifeng is especially for foot stagnation for the kids. We use a needle to needle this form. Sometimes you use a needle to take it up, to dip it, and then to break it open in order to get the bloodletting. We can bloodletting all these 4 points in order to get rid of the foot stagnation, the stagnated foot stagnation in the kids. So Sifeng is a very good point to deal with the blood stagnation in kids. And if we have the smelly stool, you can just consider ST25. And then we also get the other point for the weak body. We can get tonify the body either by tonify the chi, CV6, or we tonify the kidney at BL23. Okay, I think that's 20. This the end of the Ganji, or the only case, the only common disease for the kids. So, do you have any questions? Do you have any questions? No. Good. Thank you. So, see you tomorrow at 10 o'clock, right? Thank you.